All FMG aspirants, I hope all of you are doing great. As exam is very near now, I hope you are well prepared. Let's discuss few of the most anticipated questions in forensic medicine in upcoming FMG exam. We are going to discuss the most anticipated questions. And in this lecture, I will be using English also and Hindi also, right? So when I say only 30 questions, it does not mean only 30. Related to 30, I will be discussing some more relevant topics also. And so let's start with the first update in the forensic science. See, what is the new name for Indian Penal Code? I hope all of you know about IPC, Indian Penal Code, which defines laws and offenses, right? And CrPC. What is the meaning of CrPC? CrPC is called as Criminal Procedure Code. And IEA, Indian Evidence Act. So this is very easy to understand. See, what is the new update? New name for Indian Penal Code is what? Bharatiya Nyaya Samhita. Nyaya means what? Justice. So new name for IPC is what? Bharatiya Nyaya Samhita. And new name for CrPC is Bharatiya Nagrik Suraksha Samhita. Suraksha means actually protection. And Indian Evidence Act, new name is Bharatiya Sakshya Bill. Remember, only this much is the update. New IPCs, new CrPCs are not implemented yet, right? So still they are going to ask you, suppose if they will be framing any question related to IPC and CrPC, जो भी आएंगे ना law से, वो जितने old थे वहीं से questions आएंगे. Right? When I talk about IPC number 375, what does it mean? It defines rape. It defines rape. Definition of rape, that against the will or against the consent of a woman. If a man is attempting sexual intercourse, that will be considered as rape. And for this, there will be punishment, right? So that is as per IPC number 376. तो क्या मतलब हो गया? Indian Penal Code क्या बताता है आपको? सिर्फ about the definition of offenses and punishment. लेकिन अब ये rapist को arrest कैसे करना है? Right now? कि एक को accuse किया जाएगा, फिर उसको arrest किया जाएगा, कोर्ट में पेश किया जाएगा. ये सारे जो procedure हैं, that is as per CrPC. That is called as what? Criminal Procedure Code. इसका नया नाम क्या है? भारतीय नागरिक Suraksha Samhita. I hope all these points are clear to everyone. Related to CrPC, you have to keep in mind few most important CrPCs. One CrPC is 174 and second is 176. CrPC 174 is about police inquest, police inquiry, and 176 is what? Magistrate inquiry. Keep in mind, very important. Okay, fine. Here only let's discuss few of the important IPCs. Okay, related to murder. IPC number 300. See, this defines murder. This defines murder. But for the punishment of murder, it is what? IPC number 302. Okay, IPC number 304A and 304B. Please keep in mind 304A. Why it is important? Because this is related to Medical Negligence Act, and B is responsible for what? B is what? Dowry death. B is a dowry death. Okay, A for apron, B for bride. Remember, like this. And most important IPC which you should always keep in mind, that is what? IPC number 84. IPC number 84 is what? McNaughton's rule. McNaughton's rule. So what is the meaning of McNaughton's rule? IPC 84, see, it is McNaughton's rule. If an insane person is going to commit any crime, there will be no punishment. मतलब एक पागल अगर जुर्म करता है उसको सजा नहीं मिलेगी. Why? Because he does not understand the consequences of crime. This is what? IPC number 84. Okay, next IPC important, IPC number 320. This is what? Grievous hurt. Grievous hurt. Very, very important. Please keep in mind. See here. So basically, I anticipate the most frequently asked IPCs only, right? Okay. Next question. Shape of incision given for autopsy. For sure, whenever we have to do postmortem examination, है ना, जब postmortem examination करते हैं तो body खोलना पड़ेगा ना, राइट ना, तो उसके लिए एक इंसिजन देना पड़ेगा. सो डिफरेंट डिफरेंट शेप्स होते हैं. तो अब ये देख करके बताओ विच टाइप ऑफ इंसिजन इज गिवन हियर. मोस्ट ऑफ यू माइट बी मार्किंग सी, राइट. दिस इज वाई शेप्ड, बट आंसर इज नॉट दिस. आंसर इज टी शेप्ड इंसिजन. आंसर इज टी शेप्ड इंसिजन. लेट्स लर्न. देखो, इन टोटल देयर आर 5 मोस्ट इंपॉर्टेंट टाइप्स ऑफ incision which we are giving for the postmortem examination. Let's learn this topic in detail. See here, the most common type of incision is just below the chin to pubic part. This is called as I shape, right? This is called as what? I shaped. This is the most common, right? After that, suppose if I'm giving incision directly from acromion to acromion, and after that from this center if I'm giving incision like this, this is called as T-shaped, which is also called as bucket handle shaped. Very easy. And next shape from acromion to cephasternum part like this, and after that I am going down. So this is called as Y-shaped. This is called as Y-shaped. Very easy to understand. Okay, suppose if I'm giving incision around the neck like this, and after that I'm going down. This is called as modified Y. This is called as modified Y shape. Modified Y shape. Now, all these incisions are given over the anterior part of the body. But if there is a death in a custody during interrogation, or if there is a case of custodial death, उसमें especially कौन सा incision दोगे आप, right? Remember here, when a police is going to beat over the back most of the time, ऐसा ही होता है ना, right? No? तो उसमें postmortem examination करना, तो उसके लिए सबसे पहले हम लोग incision कहाँ पे देंगे? Back part में देंगे, posterior part में, right? No, acromion to gluteal, acromion to gluteal. So that is called as what? X-shaped. X-shaped. Remember here, very, very important point. Overall, most common type of incision given is what? I-shaped. Okay. T-shaped is also called as bucket handle. Bucket handle shaped. Bucket handle. Okay. Now, where do we give modified Y-shaped? Remember, especially जब मुझे neck part को अच्छे से examination करना है, तो especially in a case of hanging, especially in a case of hanging or ligature strangulation or any kind of neck injury. Basically, remember, hanging or strangulation case में कौन सा incision दोगे आप? Modified Y. X-shaped incision. ये कहाँ पे देते हैं? Especially in a case of custodial death, right? Custodial death. Very, very important. So overall, what is the most common type? I-shaped. अब दोबारा ये फोटो को देखो और आप बोलोगे ये तो Y देखने में लग रहा है, राइट ना? ठीक है भाई, Y देखने में तो लग रहा है, बट डू अंडरस्टैंड Y का मतलब क्या होता? सी, अगर यहाँ पे इंसिजन दिया गया होता है acromion to cephasternum part like this, अगर यहां से इंसिजन ऐसे दिया गया होता तो इसको बोलते हम लोग वाई शेप. लेकिन देखो, जब पोस्टमार्टम एग्जामिनेशन के लिए इंसिजन दोगे, ऑर्गन्स को बाहर निकाला, एग्जामिनेशन किया, आफ्टर दैट सारे ऑर्गन्स को अंदर रखना पड़ेगा, फिर सूचर करोगे ना. सूचर करने के बाद ठीक है, तो स्किन कैन बी स्ट्रेच्ड आल्सो ना. वही हुआ यहाँ पे, देखो क्या था ये, एक्रोमियन टू एक्रोमिन ही तो था, और क्या था ये, एक्रोमियन टू एक्रोमिन ही था, राइट नो, राइट. वेरी इजी टू अंडरस्टैंड. ये थोड़ा सा स्ट्रेच हो गया, नीचे चला गया. सो दिस वाज अ केस ऑफ व्हाट? T-shaped incision. T-shaped incision, right? Okay. So basics forensic में याद रखना है, shape of the incision. Now फोटो देख करके बताओ. See picture number 1, picture number 2 and picture number 3. Easily, now you can easily understand that, okay, this is a case of what? Shape like Y. And this is what? Shape like modified Y. And here this is what? I-shaped, most common. Now you see here, after completion of postmortem examination, now picture number 1 and picture number 2, now you can easily understand this is a Y-shaped and this was actually a case of what, T-shaped. थोड़ा stretch होकर के नीचे चला गया है, right? Okay, T-shaped. Now look at this picture. Now I am sure you can easily understand which shape of incision is given here and in which condition. Yes, this is a case of what, modified Y. This is a case of modified Y. और ये कौन से condition में दिया जाएगा, especially in a case of hanging or strangulation. If again suppose if I ask you again this question that custodial death में कौन सा incision दिया जाएगा, X-shaped. Now some methods of autopsy, please keep in mind. There are 4 methods of autopsy. Suppose after giving incision, if I am removing all the organs one by one, है ना, जैसे मैंने ये डायग्राम बनाया लिवर का, right now, see, so basically I am making the diagram of what, hepatobiliary part here. So incision देने के बाद अगर मैं gall bladder separately निकालता हूँ, liver separately, bile duct separately, stomach separately, right, stomach separately, okay, lung separately, heart separately, इसको बोलते हो आप क्या, removing organ one by one called as Virchow's technique. लेकिन इसको जब सारे organs को वापस रखोगे तो आपको क्या लगता है, gall bladder अपनी जगह पे ही रहेगा? नहीं, gall bladder नीचे सरक करके कहां चला जाएगा, pelvic organ पे, right ना, pelvic region में. So what does it mean? Virchow's technique में anatomical relations are not preserved. But when I talk about Letieule's technique में क्या होता है कि we are giving one incision with the right hand we are holding what, posterior part of the tongue, with the left hand we are holding what, rectum. एक साथ निकाला सारा, फिर एक साथ वापस रख दिया. This is called as what, all organs are being removed in mass, all together. तो इसमें जब वापस एक साथ रखेंगे तो anatomical relations will be preserved. Yes, this is called as Letieule's technique. लेकिन अगर मैं organs निकालूं block by block, like cervical block separately, thoracic block separately, abdominal separately, urogenital separately, इसको बोलते हैं क्या, Gon's technique, block by block method. लेकिन अगर एक पेशेंट था जिसको HIV था, अब मुझे उसका अगर पोस्टमार्टम करना है, राइट, वेयर आई एम हैविंग रिस्क ऑफ इन्फेक्शन, HIV हो, हेपेटाइटिस बी, हेपेटाइटिस सी, कोविड-19, व्हाटएवर, और अगर किसी और चीज का रिस्क हो, रेडिएशन हैजार्ड हो, तो ऐसे कंडीशन में क्या करते हैं हम लोग ना, बहुत ज्यादा रिस्क नहीं लेते हैं. ऐसे सिचुएशन में क्या होगा, वी हैव टू डू व्हाट, इन सिटू डाइसेक्शन ऑफ ऑर्गन्स, राइट नो, इन सिटू, दिस इज कॉल्ड व्हाट, रॉकेट एंड स्काई टेक्निक, अंदर ही अंदर, राइट, ओके. इवन फीटल ब्रेन डाइसेक्शन भी हो, इसमें भी रॉकेट एंड स्काई टेक्निक करते हैं. सो आई हैव टॉट यू 4 मेथड्स ऑफ ऑटोप्सी, वर्चाउस, लेट्यूल्स, गोन्स एंड रॉकेट एंड स्काई. इंपॉर्टेंट है, याद रखना. ओके, इसके साथ में ये भी हम लोग समझेंगे कि व्हाट इज द मीनिंग ऑफ मेडिको लीगल ऑटोप्सी. एक होता है मेडिको लीगल ऑटोप्सी, दूसरा है क्लिनिकल ऑटोप्सी, और यू कैन से पैथोलॉजिकल ऑटोप्सी. मेडिको लीगल ऑटोप्सी मीन्स व्हाट, in any suspicious death, in any unnatural death, postmortem examination is mandatory, right? Like rape case, hanging case, suicide, murder, or traffic accident, right? Poisoning case. So this is called as what? Medico-legal case. Here, police authorization is mandatory. Police authorization is mandatory and there is no need to take the consent from the family members. ये important चीज याद रखना, consent की जरूरत नहीं है family members से. But when I talk about clinical or pathological autopsy, right? Here, in this case, if you want to do postmortem examination, you have to take the consent from family members. Easy to understand. One more is there. See, that is called as vitropsy. Vitropsy means what? Suppose in a building collapse, there is fracture of multiple bones. इसमें open करना, close करना difficult है. तो इसमें क्या करेंगे हम लोग? हम लोग इसमें क्या करेंगे? Virtual autopsy करेंगे. Virtual autopsy क्या होता है? या तो CT scan से या फिर MRI. राइट नो, वी आर गोइंग टू टेक मल्टीपल इमेजेस, उसके बाद देखने जाते कि कौन सा ऑर्गन रप्चर हुआ, राइट. वेरी इजी टू अंडरस्टैंड. दिस इज कॉल्ड एज वर्चुअल ऑटोप्सी, दैट इज विट्रोप्सी. Vitropsy. Suppose if I have done postmortem examination. Postmortem examination का पर्पस क्या है? So that we can understand कि रीजन क्या था, क्यों मरा इंसान, उसका रीजन ऑफ डेथ, राइट नो. पोस्टमार्टम एग्जामिनेशन करने के बाद भी नहीं पता चल पाया कि वो क्यों मरा था या उसका रूट कॉज ऑफ डेथ क्या था, राइट नो. सो दैट इज कॉल्ड एज व्हाट? नेगेटिव टाइप ऑफ ऑटोप्सी. नेगेटिव ऑटोप्सी, राइट. एंड एट द सेम टाइम अगर एक बंदा सुसाइड करता है तो उसके फैमिली मेंबर से हम लोग जाके सिर्फ सवाल पूछते हैं, क्वेश्चन पूछते हैं. व्हाट काइंड ऑफ पर्सन ही वाज, उसका इमोशन कैसा था, उसका सोचने का तरीका क्या था. सो बेसिकली ओनली क्वेश्चनायर फ्रॉम द फैमिली मेंबर. इसको क्या कहते हैं हम लोग? साइकोलॉजिकल ऑटोप्सी. कीप इन माइंड, इंपॉर्टेंट क्या है? मेडिको लीगल एंड क्लिनिकल. मेडिको लीगल ऑटोप्सी में फैमिली मेंबर से कंसेंट की कोई जरूरत नहीं है, बट क्लिनिकल ऑटोप्सी और पैथोलॉजिकल ऑटोप्सी में यू हैव टू टेक द कंसेंट फ्रॉम द फैमिली मेंबर्स. Next question. A suspicious death case of a 38-year-old male is presented to hospital for postmortem examination. Family members are claiming of heart attack. Which of the following chemicals is used for the infarction? See, देखो यहाँ पे first of all एज है सिर्फ 38 और मतलब देखा जाए तो केस थोड़ा सा सस्पिशियस है. So when postmortem examination is being done, तो कौन सा केमिकल यूज करेंगे जिससे पता चल पाएगा कि इन्फॉक्शन था या नहीं था. इन्फॉक्शन डिटेक्ट करने के लिए क्या है? सो रिमेंबर हियर वी शुड नो अबाउट सम ऑफ द केमिकल्स व्हिच वी आर यूजिंग. व्हेन आई टॉक अबाउट 10% फॉर्मेलिन, राइट नो, यस दिस इज अ फिक्सेटिव वी आर यूजिंग फॉर व्हाट? ब्रेन, right? No, brain. Sometimes we are using acetic acid also in the solution, but for the infarction please keep in mind, because this was the question. This was the old question I'm telling you. TTC, triphenyl tetrazolium chloride. This is used for what? Infarction. Infarction, to detect the infarction. So remember here, कुछ different organs के postmortem examination कैसे करते हैं, यहाँ से questions बनते हैं usually. See, remember, suppose if esophagus is there, esophagus, stomach and intestine, right? Okay, fine. Or if there is blood vessel, basically any long and hollow structure, how will you do the postmortem examination? Which type of incision you will give? See, remember here, you have to give what? Incision, a straight cut. Straight cut. But if we have solid organs, no, solid organs like liver, lungs, spleen, kidney. So how you are going to cut it? Fine. तो कैसे slices की तरह कट करते हैं, right? No, slices की तरह, like loafing of bread. Slices. In this manner we have to cut. Okay, fine. Very easy to understand. तो जैसे मान लो कि ये इसका यूज कहाँ पे करेंगे? When I talk about neonaticide, right? No, newborn baby expire हो गया है. So here we have to check न्यूबॉर्न बेबी ने सांस लिया था या नहीं लिया था. ही रेस्पायर्ड और ही डिड नॉट रेस्पायर. ही वाज अ केस ऑफ लाइव बर्थ और स्टिल बॉर्न. इसके लिए हम लोग क्या कहते हैं? लंग्स को बाहर निकाल के स्लाइसेस कट करके वाटर में रखा. अगर एयर आया है तो वो फ्लोट करेगा पानी में, एयर नहीं आया तो वो सिंक हो जाएगा. दिस इज कॉल्ड एज रिगार्ड टेस्ट और हाइड्रोस्टैटिक टेस्ट, राइट? रिगार्ड्स टेस्ट, also called as hydrostatic test. Very easy to understand. Hydrostatic test, or you can say what? First life test, right? Okay, so basically lungs में अगर air है तो वो float करेगा, नहीं है तो वो sink हो जाएगा. Regard test. In the same manner you should know, if baby has respired the oxygen, the air, तो उसके stomach में भी जाएगा. तो stomach को बाहर निकाल करके if I'm going to give a cut over the stomach, इसको बकेट ऑफ वाटर में रखें तो एयर बबल्स निकलेगा ना. एयर बबल्स निकला, इसका मतलब क्या? बच्चे ने सांस लिया था, राइट? सो इफ एयर बबल्स आर कमिंग फ्रॉम एब्डोमेन, राइट? नो, एब्डोमेन, इसका मतलब क्या हुआ? बच्चे ने सांस लिया था, राइट? नो, लंग्स के बाद स्टमक में भी गया, राइट? इजी टू अंडरस्टैंड. दिस इज कॉल्ड एज सेकेंड लाइफ टेस्ट, ऑल्सो कॉल्ड एज ब्रेसलॉट टेस्ट. ब्रेसलॉट टेस्ट, easy to understand. Breslot test, regard test and Breslot test, repeatedly asked question. Easy to understand. इसी तरह से अगर बच्चे ने सांस लिया है तो लंग्स में एयर जाएगा, लंग्स थोड़ा बड़ा हो जाएगा, साइज इन्फ्लेशन होगा, राइट। सी हियर, तो उसमें हम लोग क्या करेंगे, नाउ वेट ऑफ लंग्स एंड वेट ऑफ बॉडी का रेशियो चेक करेंगे। इफ बेबी हैज नॉट रेस्पायर्ड, this will be approximately what, 1:70. If baby has respired, this will become what, 1:35. इसको कहते हैं हम लोग Plauquet test. This is called a Plauquet test. I hope these points are clear to everyone. In the same manner, one more test we can know. Respired lungs will be heavier, unrespired lungs will be lighter. Very easy to understand. That is called as Fodder's test, right? That is called as a Fodder's test. Fodder's test. एक और टेस्ट है, मिडिल ईयर में एक जिलेटिनस टिश्यू होता है, एम्ब्रियोनिक टिश्यू, राइट ना, दैट इज कॉल्ड एज रेडिंस। बच्चा सांस ले लेगा तो रेडिंस विल गो डाउन, बट अगर सांस नहीं लिया है तो रेडिंस वहीं पे रहेगा, मिडिल ईयर में रहेगा, राइट। दैट इज कॉल्ड एज रेडिंस टेस्ट। These 5 tests which I have mentioned here, these are for live birth baby to differentiate if baby has respired or not. Now, how we are doing postmortem examination of heart? Heart के postmortem examination के लिए क्या करते हैं? See here, ideally we have to give incision along with the blood flow. So, see, this is what? Right atrium, this is right ventricle, left atrium, this is left ventricle. Remember here, we have to give incision along the inflow and outflow, right? So, first incision here, and after that, this is the incision here. This is called as inflow and outflow method. Inflow and outflow method. In this manner, we are doing the postmortem examination of heart. Remember, what is the name of chemical for infarction? It is what? TTC, right? TTC. Brain. Usually, if I have to do postmortem examination of brain, इसको open करने के लिए incision आप कहाँ पे दोगे? Forehead पे, या lateral side में, या back side में? Remember here, we have to give incision just behind the ear lobes, around the mastoid. बिल्कुल cerebral cortex एकदम नीचे में incision देते, right? So, you have to give incision over the mastoid process. You can say what? Behind the ear lobe. Behind ear lobes. Okay. Spinal cord. Remember here, there are 2 approaches. Anterior also, posterior also. So remember, posterior approach is better than anterior. Stomach open करने के लिए कौन सा method हम लोग use करते हैं? Remember here, suppose if this is the stomach part here, right now. So first of all, we have to ligate here and here. At 2 openings we have to ligate. So because see, in the case of the poisoning, we have to do like this, no, so that whatever content is there, it should not go up or it should not be going down. That's why we have to ligate at 2 positions. This is called as what? Double ligation method. This is called as a double ligation method. Remember here, अब स्टमक को ओपन करने के लिए इंसिशन कहां पे देंगे? Around the lesser curvature or greater curvature? Answer is we have to give incision around the greater curvature. I hope all these points are clear to everyone. Now, some extra points related to autopsy and embalming. First of all, what is the meaning of embalming? What is the meaning of embalming? I'm sure you would have seen a dead body in your anatomy lab. See, that dead body is actually artificially preserved. You will not be seeing foul smell. You can see the pungent smell, not the foul. बदबू नहीं आएगा, बेकार smell नहीं आएगा, foul smell नहीं आता, right? You do not see foul smell. You do not see any kind of pus collection, any kind of infection. Why? Because with the help of some chemicals, it is artificially preserved. That is called as embalming. Embalming का मतलब क्या होता है? Artificial preservation of dead body. Artificial preservation of dead body with the help of some chemicals. With the help of some chemicals. That's why it is also called as what? Chemical stiffening. Body पूरा ऐसे tight हो जाएगा, एकदम rigor mortis जैसा. That's why it is also called what? Permanent rigidity. This is embalming. Another term for embalming is what? Thanatopraxia. Thanatopraxia. Keep in mind, last time they have asked one word meaning question. Study of death process is called as what? That is called as thanatology. Thanatology. Remember, one more term is there, that is called a taphonomy. Remember here, when I talk about thanatopraxia, this means artificial preservation of dead body, means embalming. Thanatology, study of death. Taphonomy, study of process of decomposition. Right now, after death, body जो है सड़ता गलता है ना, that is called as what? Decomposition. So study of the process of getting decomposition is called as what? Taphonomy. अब आता है embalming के लिए we have to use some of the chemicals. Right now we have to use preservatives like formaldehyde. We have to use anti-clotting agent. We have to use germicide. Germicide like phenol. Okay. We have to use a dye also. Dye, ताकि जो है नॉर्मल इंसान के जैसा कलर दिखे. तो dye का नाम क्या? Dye is what? Eosin. We are also using a perfume. वो perfume क्या होता है कि so that मतलब normal smell लगे, right now? So what is the name of the perfume? That is called as wintergreen. चलो ठीक है, ईओसिन जो देते हैं ना डाई, दिस इज अ डाई, एक डाई है ताकि नॉर्मल जैसे इंसान के बॉडी का कलर होता है वैसा दिखाई दे, राइट? क्वेश्चन क्या पूछा गया है एक बार कि जस्ट बिफोर डेथ इफ अ पर्सन वाज सफरिंग फ्रॉम जॉन्डिस, okay, after death, after embalming, what will be the new color? New color will not be brown or pink because of eosin. New color in a jaundice case, it will be what? Green color. It will be green color. ये green color ये question आ चुका है, ठीक है? तो ये सारे chemicals को we are mixing it in 10 liter of water. That is called a vehicle. So we have to give what? Injection into the body right now. So what is the best method of injection? Discontinuous injection and drainage. Remember here, injection should be done in high pressure and low flow, right? Because of obstruction inside the blood vessels, right? This is also the old question. Question is that autopsy पहले करना चाहिए या embalming, right? Now remember here, अगर embalming पहले आपने कर दिया autopsy से पहले तो क्या होगा? You will lose all the evidences, right? No? So that's why remember autopsy must be done before embalming. ये multiple times question आ चुका है. Easy to understand? And now when you have completed the postmortem, when you have completed the autopsy, right? Remember here, how many postmortem report, how many copies you are going to make? Remember, 3 copies. For whom? 1 copy should be given to the investigating officer, the police officer, right? 2nd copy for the magistrate or police superintendent, and 3rd copy for hospital use for office purpose. Easy to understand? So how many copies of postmortem report we are making? 3 copies. The question is that police जो इसमें inquiry करता है, right? Now that police is called as investigating officer. What should be the ranking of that police? Ideally his rank should be sub-inspector, but a minimum head constable. Remember, post-mortem examination is being done only in the mortuary house, especially in the government sector only, right? Next, look at this picture and now you try to answer. First of all, you tell me, what do you see here? What is this? You can see the diagram and you can understand. I can see here around the blood vessels, around the vascular channel, I can see appearance like this, no? Appearance like this, right? Around the blood vessel. So what it is called as, right? See, this appears to be like what? This appears to be like marbled appearance. I would say what? Marbled appearance. This is called as marbling. So what it is called as? This is called as what? Marbling. This is what? Post-examination sign, right? So this is post-examination. What is happening? See, inside the GIT, so many bacteria are there. So what they are producing, which gas? Especially hydrogen sulfide. Especially I'm saying, right? Hydrogen sulfide किससे mix होगा? Hemoglobin से. And this will make what? सल्फ हीमोग्लोबिन। सल्फ हीमोग्लोबिन कौन से कलर का होता है? ब्लूइश ग्रीन कलर का होता है। एंड नाउ दिस ब्लूइश ग्रीन कलर और ग्रीनिश ब्लड फ्लो विल बी देयर अलोंग द वेस्कुलर चैनल। तो सुपरफिशियली जो लोकेटेड होता है ना, वो ग्रीन ग्रीन कलर का दिखाई देगा और डार्क ब्लूइश ग्रीन कलर। दिस इज कॉल्ड एज मार्बलिंग। This, see, time of appearance is approximately 36 to 48 hours. Approximately, right? Easy to understand. Now you can easily rule out. Mark the right option. Out of these four, if I say, see, is it due to contact pallor? Obviously, no. Arborescent burn? No. Discoloration is due to oxyhemoglobin? No. This because of what? Sulfur hemoglobin, right? So, what is the right answer here? Option number A. Remember here, related to marbling, multiple other images can also be shown, and examiner will try to trap you here, right? Look at some extra pictures and then you will be having more clarity. Now I'm showing you picture number 1 and picture number 2. See here there can be confusion. First picture which I see here, see, this is along the blood vessels, no, along the blood vessels. Very easy to understand. Blood vessels along the vascular channel. But when I look at picture number 1, this is not along the blood vessels. This is over the epidermis. Superficially what? Epidermis. Easy to understand. So both pictures are completely different. Remember here, picture number, see this one, this is, see, these two are what? Marbling. Marbling. But what about picture number 1? Picture number 1 is what? This is a lightening burn. This is lightening burn. Lightening burn means what? Because of lightening, this is also called as arborescent burn. Right? This is also called as filigree burn. Filigree burn. And if you look at the picture here, see here, you can see is, right? See, if you look at the picture here, so this is somewhat like a flower-like pattern. This is also called as Lichtenberg flower-like pattern. Lichtenberg flower-like pattern. Be careful. This is superficial over the epidermis. This is along the blood vessels, right? Now, some more pictures related to postmortem examination. Suppose if examiner is asking you what is the first sign after death. First sign after death. So this is what? Loss of voluntary movement. Loss of voluntary movement. This is first sign after death. But if examiner is asking you what is the first eye sign, what I'm asking you, first eye sign. First eye sign. This is Kevorkian sign. Just after death क्या होगा बताओ? First of all, there will be a stoppage of circulation. Blood vessels के अंदर में भी क्या होगा? Blood vessel पूरा रुक जाएगा, stagnant हो जाएगा, right? So there will be hemolysis. And remember here, so see, inside the retinal vessels, if you see, there will be fragmentation of blood column. So this appears like a railway track, right? Now, this is also called as what? Railway trucking sign, same like cattle trucking sign, or it is also called a Kevorkian sign. Kevorkian sign. Remember, this cannot be seen with the help of naked eyes. This can be seen only with the help of ophthalmoscope. So remember here, this can appear within second. This can appear within seconds to minutes, but this will persist up to 1 hour. This is called a Kevorkian sign. But when you look at this picture, remember here, see here, after death, when eyes are open, now there will be deposition of debris and dust, right now. Because of this, what will happen? See here, easily you can understand that at the two corner of eyes here, right? See, there is formation of what? Two triangles. राइट तो सबसे पहले येलो फिर ब्राउन फिर ब्लैक बनेगा. दिस इज कॉल्ड ए टैकिनोयर स्क्लेरोटिका. टैकिनोयर स्क्लेरोटिका, प्लीज कीप इन माइंड this can be your image based question. Tachynoir sclerotica, formation of two triangles at the corner of eye, right? Tachynoir sclerotica. Here time since death, you can easily understand this is approximately 3 to 4 hours. Now, we are going to discuss some more post-mortem changes, right? First of all, one is called as a somatic death. One is called as somatic death, also called a clinical death. Just after death, there will be what? Sudden stoppage of heart, brain, and lungs. Complete stoppage of heart, brain, and lungs. So, like this will occur within seconds. This will occur within seconds. Stoppage of heart, brain, and lungs. It is called as what? Bishop's tripod. Bishop's tripod. Okay. See, during somatic death, remember, aerobic processes are gone, but anaerobic processes are still working. So what does it mean? The tissues which were able to survive with the help of oxygen, those are gone. But the tissues which can still survive for some more time, even in the absence of oxygen, that is what? Anaerobic, right? So easy to understand. So during somatic death, if I am going to use an amniotic or a mydriatic inside the eyes, yes, people will respond. If I'm going to shift the patient to ventilator, yes, there will be what? Response to the muscles. But after few hours, now each and every cell of the body will be dead. Now that will be called as what? Molecular death. Molecular death. Period between somatic death and molecular death is called as what? Supravital period. Supravital period. This is important for organ harvesting. This is important for organ harvesting. Okay, organ harvesting in a brain dead patient. Easy to understand, right? Now, somatic death starts in a few seconds, but in molecular death, there can be early signs and there can be late signs. Changes in eye are early signs. What does it mean? Basically, this can appear within minutes to hours. Minutes to hours. Here only we are going to learn about rigor mortis, when body is becoming very, very stiff. Stiffening of dead body is called as rigor mortis. Body will become cold, that is called as algor mortis. Algor mortis, cooling of dead body. In the same manner, cooling of dead body. In the same manner, if you see body, there will be a discoloration, different color, right? No? So that is called as what? Livor mortis. Livor mortis, discoloration, right? What are the late signs after death? Late signs, remember here, that is called as putrefaction. That is called as putrefaction. Putrefaction, it will take hours, 2 days, 2 weeks, 2 months also. Basically many days, that is putrefaction. See here, basically putrefaction का मतलब क्या हुआ? सड़ना और गलना. When there is a decomposition of body, decomposition of tissues without any bacteria, self अपने आप अगर decompose हो रहा है, that is called as autolysis. Autolysis. But if there is bacteria involvement and then there is decomposition, that is called as, see here, no? So that is called as decomposition. That is called as decomposition. Easy to understand. What are the most destructive bacteria? It is what? Clostridium welchi. What is the most destructive enzyme? This is lecithinase. Now you look at the picture. Now you tell me what I'm talking about. I'm talking about discoloration. Discoloration मतलब क्या हो गया ये? Livor mortis. Livor mortis. Okay. अब ये फोटो देख करके बताओ कि what is the diagnosis? Okay, fine. Now see here, why there is livor mortis, why there is discoloration. See, after death, when a person is in supine position, ठीक है ना? So now there is what? A stoppage of blood circulation, है ना? पूरा का पूरा blood circulation रुक चुका है. Okay, तो सारे blood vessels के अंदर में भी blood होंगे. Okay, जो major blood vessels है, तो जो उसके जो vessel wall है, वो तो काफी थिक है, राइट? बट स्मॉल ब्लड वेसल्स आर देयर लाइक वेन्यूल्स, आर्टेरियोल्स, कैपिलरीज. ग्रेविटेशनल फोर्स की वजह से वो रप्चर होगा और ब्लड क्या होगा? नीचे जाकर के एट द लेयर ऑफ द एपिडर्मिस, एट द लेयर ऑफ द लोअर पार्ट ऑफ द डर्मिस, राइट? वो क्या हो जाएगा? जाके एक्यूमुलेट होगा. Easy to understand, right? No, और उसी की वजह से just below the skin you can see some different kind of discoloration. तो discoloration क्यों आ रहा है यहाँ पे? See देखो, expire होने के बाद, death के बाद, now there is no oxyhemoglobin. There is what? Deoxyhemoglobin. There is a deoxyhemoglobin, right? So which color it will be? Right? No, this will be what? Purple color. So that's why, see, natural color after death, the discoloration, what it will be called as? So this will be bluish purple color, bluish purple color. Now where there is accumulation of blood, remember here accumulation of blood is there over the dependent part of the body. तो यानी कि blood के accumulation को देख के समझ जाओगे कि what was the position during the time of recovery. ठीक है, तो now you can easily understand if there was accumulation around the back of the body, back of the neck, right, over the posterior part of the thighs, it means what? Supine position, right? No, supine position. Very easy to understand, supine position like this. But if you can see discoloration over the anterior part of chest, anterior part of abdomen, means what? Prone position. Easy to understand. Remember, loose the dependent part पे accumulation होगा, but over the tight or pressure there will be no discoloration. Easy to understand. So now here you can see, here you do not see accumulation of blood over the anterior or the posterior part of the body. Here you can see over the lower part of forearms, lower part of the legs. Basically what was the position? Vertical position. किसमें होगा? Hanging में होगा, right? It will be in the hanging position. Very easy to understand. So remember, if you can see discoloration over the back part means supine position, anterior part means prone position, right? No, over the forearms, hands and legs, hanging, right? Hanging, vertical position. Very easy to understand. Where there will be no lividity, no lividity means ऐसा कौन सा situation है जहां पे discoloration नहीं नजर आएगा. Remember here, when there is no any chance of dependency. So basically when body keeps on moving, when body is not stopping at one place. So remember here, drowning in running water, drowning in running water, drowning in running water. Easy to understand. Drowning in running water, there will be no lividity. Or if there was severe hemorrhage, more than 65% blood loss, yes, obviously in this case also you cannot see lividity. Now look at this picture and now you tell me what was the position of dead body at the time of recovery, supine or prone. Now you can easily understand over the anterior part of chest and abdomen, right? No, so here position was what? Prone position, prone. But you can see discoloration around the stomach, around the chest, but you cannot see discoloration here. क्या मतलब हुआ इसका भाई? इसका क्या मतलब हुआ? It means something was there, hand was there like this. So basically when there is what? Hard contact or hard pressure, you cannot see discoloration, right? No, so this is right now. So here you can easily understand something was there somewhat. So this appears like a hand only, right? No, very easy to understand. Some synonyms are there of liver mortis. Liver mortis का मतलब क्या हुआ? रंग बदलना basically, no? कोई दूसरा color आ जाना, stain आ जाना. That's why it is also called as staining. You can say lividity, hypostasis, darkening of death, cadaveric lividity. Confusion होगा vibices में और sigillation में. See देखो, याद रखो कि अगर कोई बंदा, कोई इंसान मर गया है, इफ ही वॉज वेयरिंग बेल्ट, तो बेल्ट के जगह पे तो नहीं आएगा, राइट? नो, सो लीनियर पैटर्न अगर आएगा ना, दैट इज कॉल्ड एज ए विबाइसिस, लीनियर स्टेनिंग, विबाइसिस. और इफ यू कैन सी पैची पैची, राइट? नो, पैची पैची, राइट? दैट इज sigillation. One important point you should know here, fixation of liver mortis occurs in 6 to 12 hours. What does it mean? Fixation of liver mortis, क्या मतलब हो इसका? कि लिवर मोटिस फिक्स हो जाएगा एक जगह पे, उसके बाद कोई भी रंग नहीं बदलेगा. What does it mean? During the time of recovery, I could see that discoloration was there over the chest, over the abdomen, bluish color. Okay. तो इसका मतलब क्या था? During the time of recovery, there was a position like the prone. जैसे मैंने supine में रखा है ना, now 1.1 situation, I can see shifting of discoloration, shifting. अब आगे से ये धीरे धीरे ब्लड एक्यूमुलेशन पीछे की तरफ जा रहा है, राइट? नो, सो ये जब शिफ्ट हो रहा है ना, if I can see here, no, see, suppose if I can see shifting of blood towards the back side, it means फिक्स नहीं हुआ है अभी. ओके. सेकेंड, नो शिफ्टिंग. नो शिफ्टिंग ऑफ ब्लड फ्रॉम एंटीरियर टू द पोस्टीरियर पार्ट. व्हाट डज इट मीन? कि वो फिक्स हो चुका. अब कितनों पोजीशन बदल लो, इधर से उधर, लेफ्ट टू राइट, राइट टू लेफ्ट, कुछ भी कर लो, वो एक ही जगह पे फिक्स रहेगा. जो डिस्कलरेशन है ना, वो वहीं पे रहेगा. व्हाट डज इट मीन? फिक्सेशन हैज ऑलरेडी हैपेंड. So if you can see fixation of liver mortis, no, so you can easily understand that, okay, fixation can happen in 6 to 12 hours. Here only we can discuss a clinical aspect, how examiner can trap you. मैं एक सिचुएशन देता हूँ. एक डेड बॉडी मिला एक कार से, and that dead body was in the sitting position, first passenger seat पे. When police recovered the dead body, no, police after that police has taken the dead body to hospital. During the time of examination, okay, staining was over the back, over the lower back, over the posterior thighs, over the leg. There was no staining over the back, right here, right? But when dead body was in the supine position, now there was a shifting of discoloration. Now there is a discoloration over back also, here just over the posterior part of thorax also, right? No, not only at the lower back, above part also. क्या मतलब हुआ? कितना देर पहले उसको कत्ल किया गया है? How much is the time since death? More than 6 hours, more than 12 hours, or less than 6 hours? Answer is what? Less than 6 hours. लेस देन 6. जब डॉक्टर बोलेगा कि लेस देन 6 आवर्स ही हुआ है इसको मरे हुए, उसी 6 आवर्स पहले सीसीटीवी जितना पूरा पुलिस चेक करेंगे, राइट ना. पुलिस लोग क्या करेंगे, 6 आवर्स में जितना भी सीसीटीवी है पूरा चेक करेंगे, उससे पता चले कौन आया था, किसने यहाँ पे मार के, कौन कार रोक करके, कौन है ना. तो 6 आवर्स के अंदर में सब कुछ पता चल जाएगा. इन दिस मैनर यू कैन रीच अप टू द रियल मर्डरर. फाइन नो. सो बी केयरफुल. फिक्सेशन ऑफ लिवर मोर्टिस कितनी देर में होता है? 6 to 12 आवर्स. नाउ फ्रॉम दिस टेबल वी कैन एक्सपेक्ट a question. Remember here, what is the natural color? Normal color क्या होता है after death? It is bluish or purple color. So basically, what is the reason? See, because of what? Because of the nature of hemoglobin only. No, after death there is what? Deoxyhemoglobin. Deoxyhemoglobin कौन से कलर का होगा? पर्पल होगा ना. लेकिन देखो अब यहाँ पे डिफरेंट टाइप्स ऑफ कंडीशन जिसमें डिफरेंट कलर आए हैं, तो डिफरेंट कलर के बेसिस पे वी कैन अंडरस्टैंड विच काइंड ऑफ पॉइजनिंग हैज हैपेंड, राइट नो. देखो यहाँ पे है चेरी रेड, ब्रिक रेड, ब्राइट रेड और ब्राइट पिंक. ये तीनों कंडीशन में ऐसा लग रहा है कि ऑक्सीजन तो था लेकिन इंसान का जो बॉडी है वो यूज नहीं कर पाया, राइट. Okay, fine. So remember here, so they're asking these questions frequently. First of all, carbon CO poisoning, no? CO poisoning. Repeatedly asked question, CO poisoning. Why there is cherry red color in CO poisoning? When a person is alive, there is what? Oxyhemoglobin. But in burns condition, in burns or CO poisoning, remember CO has much more affinity for hemoglobin than oxygen, 200 times more, right now. So now this will make carboxyhemoglobin, right now. So what is happening here? What is the cause of death here? Remember, oxygen is available, oxygen is there, but hemoglobin is not available, right now. Hemoglobin is not available to carry the oxygen. So in which condition this can happen? I'm sure you would have learned 4 types of hypoxia. One is called as what? Hypoxic hypoxia. Another is anemic hypoxia. Third, stagnant or hypoperfusion. And fourth is cytotoxic or histotoxic type of hypoxia. So question what they've asked, in CO poisoning, which type of hypoxia will be there? Remember here, I have taught you just now that oxygen is there, but hemoglobin is less. Hemoglobin is not available there, right now. So lack of hemoglobin, so anemic type of hypoxia. This is important question. In carbon monoxide poisoning, what is the cause of death? Anemic hypoxia. Now, see here. What about cyanide poison? I'm sure you have learned in biochemistry also. Cyanide blocks which pathway? Electron transport chain. 4th complex. Which enzyme? Cytochrome oxidase. Right now, this enzyme is important for the tissues to utilize the available oxygen, but cyanide will be blocking this. So what is happening here? Any condition which is going to create a problem where tissues are not able to utilize the oxygen, that is called a histotoxic or cytotoxic, right now. So remember, in cyanide poisoning, what is the cause of death? histotoxic or cytotoxic hypoxia. Cytotoxic hypoxia. Here, what will be the color of body? Remember, brick red or bright red. Last time also carbon monoxide poisoning, cherry red color. In hypothermia, oxygen will be trapped in the subcutaneous and that will appear like bright pink color. Okay, now when I talk about PAN, potassium chlorate, aniline, nitrate, nitrite, sodium chloride, here there will be formation of what? Methane part. So this will be forming what? Methemoglobinemia, brown color. So what will be the color here? Chocolate brown. Sometimes deep blue in aniline. Hydrogen sulfide with hemoglobin, right? No, so this will be forming what? Sulfur hemoglobin. No, sulfur hemoglobin. Sulfur hemoglobin appears like bluish green. So hydrogen sulfide poisoning, which color? Bluish. Septic abortion, bronze, and opium, black. Remember, this table is very, very important for your exam, because on the basis of discoloration we can easily understand the type of poisoning. Now look at some other pictures. See picture number 1, picture number 2, and picture number 3. I have taught you here that over the hard part, because of pressure, there will be no discoloration. In picture number 1, you can easily understand that like butterfly, no, there is no discoloration. So this was the area of pressure. That is called a what? Pressure pallor, or you can say what? Contact pallor. Here also you can see, right, no, pressure pallor or contact pallor. Here you can see linear branches, no, linear branches, right? So this is what? Vebaceous. Very easy to understand. On the basis of this, you can easily understand. Now see the next question. All of the following are true about cadaveric spasm except. Remember here, cadaveric spasm is an extremely important topic for your exam. So before we understand cadaveric spasm, what do you mean by rigor mortis? Rigor mortis. Rigor mortis. Remember here, first of all, understand rigor mortis. After that, we are going to learn about cadaveric spasm. Rigor mortis means what? Body will become tight, stiffening of dead body, right? Stiffening of dead body, rigidity of dead body. Okay, fine. So what is happening here? Just after death, first of all, body will become loose. That is called as primary relaxation. At that time, 100% ATP was there. 100% ATP. At that time, two muscle proteins, actin and myosin. These two muscle proteins were at their normal location. लेकिन कुछ देर के बाद ATP destroy हो गया ना, right? Now there will be depletion of ATP. Okay. After some time, now there will be what? Depletion of ATP, 85 to 35%. Basically what? ATP is depleting. When ATP is depleting, no, now actin and myosin, they will come close together like this and they will make what? है ना, ये दोनों स्लाइड करते एक दूसरे पे क्या हो जाएगा? बिल्कुल जो एक तरह का बॉन्ड बनाएगा, राइट? दिस इज कॉल्ड एज actinomyosin component. This is called as actinomyosin component. This is called as rigidity or rigor mortis. But after some more time, now there will be what? Zero ATP. Now there will be what? Zero muscle proteins also, because after that there will be decomposition of proteins. Now even the protein will be dissolved. Now again there will be what? Secondary relaxation. Keep in mind, after death, body has to go through this phase. Primary relaxation first. After that, rigidity, then secondary relaxation. Very easy to understand. This is the rule. Okay, so this is called as what? First of all, you should understand here, rule of 12. Rule of 12. It takes approximately 12 hours to appear, 12 hours to persist, and 12 hours to disappear. So rule of 12 is related to rigor mortis. Some other rules also please keep in mind. One is called as a Shapiro's rule. Another is a Niston's rule. Please keep in mind, very, very important. Shapiro said that there is no any sequence of rigor mortis. Smaller muscles will go into rigidity first, bigger muscles will go afterwards. But Niston said no, there is a sequence from top to toe, which I will show you just now. Okay, fine. That is a Niston's rule. Overall, what is the first muscle to go into rigor mortis? It is what? Myocardium, heart muscle. You can say what? Heart muscle. First, overall first muscle. But if examiner is asking you overall first external muscle, right? So that is what? Eyelid. That is what? Eyelid. But overall, number one is what? Heart. So what I'm saying is that in a rigor mortis, there is involvement of involuntary muscle also, voluntary muscle also. And there is primary relaxation. And this is completely what? Postmortem. Postmortem. Now, examiner is asking a question here related to cadaveric spasm. Okay. So now let's learn what is the meaning of cadaveric spasm. When you look at these pics, what do you understand? After looking at picture number 1, you can have some clarity. Okay, this was the case of suicide or homicide, whatever. After looking at picture number 2 also, okay, you can understand that just before that person was struggling a lot. Okay. Remember here, what is the meaning of cadaveric spasm, which is also called as instantaneous rigor. Instantaneous rigor. Remember, there are few conditions where just before death, only the voluntary group of muscles, or the only component of muscles which were at maximum work. Like suppose if a person was about to kill himself with a gun. So basically I can say that in his condition, his hand muscles are at maximum work. This is at strenuous work, right? So just before death, only a voluntary group of muscle goes into sudden spasm, right? No, sir. See, here what I'm saying, just before death I'm saying, sudden spasm. And after pulling the trigger, now this will continue to be in the spasm even after death. This is called as cadaveric spasm. Cadaveric spasm. Easy to understand? See here, what I am saying, see what I have said here. I have told you that just before death. So what is this? This is completely ante-mortem. And suddenly it goes into a spasm without going into primary relaxation, no primary relaxation. And remember, this posture you cannot produce artificially. Very easy to understand. Here only voluntary I'm saying, not involuntary, only voluntary group of muscles. With the help of this, we can understand the posture of death, manner of death, just before death, what was the condition. When you look at this picture, don't you think this is a case of drowning, पानी में डूब रहा था बंदा, डूबते डूबते वो कुछ पकड़ने की कोशिश कर रहा था, but he can hold only some plants and weeds in his hand, right? Now, so this is drowning. So plants and weeds in the hand, right? This is also sign of what? Drowning. You can understand, okay, this was the condition, right? Now, okay, fine. So how to differentiate rigor mortis and cadaveric spasm? ये बहुत ज़्यादा बार सवाल पूछा गया, right? Now, so please keep in mind when I talk about rigor mortis, this is completely post-mortem in nature. Cadaveric spasm, this is ante-mortem in nature. Remember, primary relaxation is present in rigor mortis, but absent in cadaveric spasm. Muscles involvement, voluntary and involuntary both, but in cadaveric spasm only voluntary. Remember, only voluntary. Cadaveric spasm is extremely important topic. Please keep in mind, right? Cadaveric spasm mimics like rigor mortis. This is not completely rigor mortis because see here, so I have taught you here the differences, right? No, so remember, a cadaveric spasm mimics like a rigor mortis. Now you can come back to this question and you can easily mark the answer. So only voluntary muscles are involved? Wrong. Post-mortem in nature? No, ante-mortem. Primary relaxation is absent? Yes, this is also right here. Mimics rigor mortis? This is also right. So in this question, 2 options are actually right. B is also right, mimics like a rigor mortis, and primary relaxation is also absent here. So 2 options are actually right here. Remember here, rigor mortis and related to cadaveric spasm, repeatedly they are asking the question, right? Very easy to understand. And now there is one more condition that also mimics like rigor mortis, that is heat stiffening. See, After severe burns or when a person will be exposed to more than 65 degrees centigrade, now there'll be what? Muscle protein coagulation. Muscle protein coagulation. Body will become like this. So this is somewhat like which kind of attitude? Boxers, defense, fencing, also called as pugilistic. Please write down pugilistic attitude, boxers, fencing, and defense attitude. All these are the synonyms of heat stiffening. Remember here, these are mimicking like a rigor mortis, like cadaveric spasm also, heat stiffening also. But remember here, heat stiffening or pugilistic attitude, this you cannot produce artificially. And see, overall what I'm saying about rigor mortis, see, 12 hours to appear, 12 hours to persist, 12 hours to disappear. यानी कि 1.5 दिन में आकर के खत्म हो जाएगा वो, राइट नो. बट प्यूजिलिस्टिक एटीट्यूड बहुत बहुत दिनों तक रहेगा. अप टू डिकम्पोजिशन इट विल बी लाइक दिस ओनली. वेरी इजी टू अंडरस्टैंड. नाउ सी सम अदर parts of decomposition. One is called as adipocere, another is called as mummification. See, look at these two pictures, picture number 1 and picture number 2. Adipocere formation and mummification. These are the types of putrefaction. Putrefaction means what? Sadna galna. Putrefaction. Remember, when warm temperature is there, airflow is there, and moisture is also there. Warm temperature, airflow, and moisture. All these are there, it is called a putrefaction. When only warmth and moisture, no airflow, तो बॉडी कैसा बन जाएगा? कुछ इस तरह से, कुछ इस तरह से. ठीक है, तो इसमें एडिपोज टिश्यू का क्या हो जाएगा? सोप, साबुन जैसा कुछ डिफरेंट, या फिर इफ यू सी समथिंग लाइक दिस, नो, वैक्स जैसा, right? So this is called as what? Adipocere formation, also called as saponification. Saponification. Wax jaisa, wax in a grave, it is also called as grave wax. It is also called as grave wax. But इसी में अगर warmth हो and air flow हो, no moisture, तो उसमें ऐसा लगता है क्या कि because of that there will be what? Evaporation of liquid inside the body. राइट नो. तो जब इवापोरेट हो जाएगा बॉडी से पूरा लिक्विड, तो क्या श्रिवलिंग ऑफ बॉडी हो जाएगा, राइट? समथिंग लाइक दिस. दिस इज कॉल्ड एज ममीफिकेशन. सो व्हाट आर द डिफरेंसेस दे आर आस्किंग. आफ्टर लुकिंग एट दीज टू, वेयर डू यू सी दैट देयर कैन बी बैड स्मेल? फाउल स्मेल कहां पे आएगा? ऑब्वियसली एडिपोसीर में, राइट नो. अमोनिया लाइक स्मेल, फाउल स्मेल, और यू कैन से रैंसिड बटर. See, this can be completed in 3 weeks to 6 months. But mummification, अब दोनों में से देख के बताओ वेट लॉस कहां पे होगा, राइट? मम्मीफिकेशन में 70% वेट लॉस, नो फाउल स्मेल, ड्यूरेशन 6 months to 12 months. Okay, fine. So, what is the meaning of Nisten's rule? See, remember here, Nisten's rule we are using for rigor mortis. Rigor mortis. इसका क्या मतलब है? From the top to toe, sequencing. सबसे पहले, first of all, there'll be what? See, overall, which muscle will go into rigidity at first? Myocardium, or you can say what? Myocardium or what? Heart muscle. Heart muscle first. But externally, first of all, eyelid. First of all, eye muscles. After that, neck. Eye muscles, eyelid, orbicularis oculi, उसके बाद से neck. After that, jaw and face. But remember here, sequence याद रखने के लिए, first eye muscles, neck, after that you go down over the chest, then upper limb, then over the abdomen, then lower limb, at last fingers and toes. This sequence they are asking, right? Nisten's rule. Nisten's rule. First of all eye, then neck, after that chest, then upper limb, then abdomen, then lower limb, at last fingers and toes. At last, fingers and toes, as per Nisten's rule. Now, look at this. Now we are going to learn mechanical injury. Which type of injury is this? This is abrasion, bruise, incision, laceration, right? No. So remember here, what is the definition of abrasion? What is the definition of bruise? Abrasion and bruise. Abrasion, after any trauma, if there is what? A rupture of epidermis, like even after scratch, right? No, rupture of epidermis, where you can see minimal or no bleeding, but you can see rupture of epidermis, that is called as abrasion. But suppose if a person is going to hit you like this, externally epidermis, no rupture, no damage, but inside, because of the pressure, there can be rupture of a small blood vessels, and inside there can be clotting, and externally you can see bluish discoloration like this. This is called as what? Bruise, also called as contusion. Bruise is also called as contusion, right? Okay. Now, so basically now we are learning mechanical injury, or you can say what, any kind of trauma. So this can be blunt and this can be sharp or blunted trauma. Blunt means what? When a person is using lathi, rod, stone, brick. Sharp ka matlab kya? Blade, right? No, blade, knife, sharp trauma. Now let's look at this table. Blunt trauma, so what are the examples? Like abrasion, contusion, and laceration, fracture of bones. But when I talk about sharp, if I'm using a light weapon and which is causing what? Sharp cut. So this is what? Incised injury. This is called as cut injury. इसको क्या बोलते हैं? Incised or cut injury. But if a person is using heavy cutting weapon, sharp, so that will be causing what? Chop injury. If a person is using sharp but pointed, है ना? Pointed में क्या? Stab injury, right? No, incised or cut injury, chop and stab, right? Very easy to understand. Now see here, look at the difference between abrasion and contusion. See here what I have said here just now. In abrasion there will be what? A rupture of epidermis. Rupture of epidermis, right? But here you cannot see any rupture of epidermis. Externally you cannot see, but internally you can see some kind of clotting here, no? Some kind of accumulation of blood. This is contusion, also called as bruise. There are 4 types of abrasion. One is called as a scratch, graze, and pressure and pattern. Easy to understand. See, like nails, thorn, right? That will be causing what? Scratch. इसको कहते हैं nail abrasion, नाखून से. Graze, overall, this is the most common type of abrasion. Overall, this is the most common type of abrasion. See here, when a person will be dragged on the road, suppose if you are playing cricket and suppose if you want to dive, तो dive करने के लिए जब ऐसे गिरते हो जमीन पे रगड़ा जाता है ना हाथ, तो ऐसे जब जोर से रगड़ा गया खरोच, multiple parallel lines, that is called as graze abrasion. You will see something like brush burn. This is also called as brush burn. Also called as brush burn, right? Also called as, see here on the road over the rough surface, small stones will be there, no? Gravels. This is also called as what? Gravel rash. Gravel rash, right? Now, see when I talk about patterned abrasion का मतलब क्या हुआ? If you can see the exact pattern of a weapon, that is called as patterned abrasion. Abrasion because of exact pattern, like I can say tire mark, right? No, tire mark. But pressure abrasion because of any pressure is called as pressure abrasion, especially in a case of hanging. Right? No, hanging case where a ligature material was applied here. After that, when you can see only abrasion, if you cannot identify the exact pattern, obviously abrasion has happened here, but because of pressure. So in a case of hanging, pressure abrasion. Even in a case of teeth bite marks, pressure abrasion. Look at some photos and we'll be having more clarity. See, picture number 1 is what? Just one scratch. This is a case of what? A scratch abrasion. A scratch abrasion. But look at picture number 2. Here you can see abrasion around the neck. But exact pattern I may not be able to identify. Maybe it could be rope, wire, something like that, right? No? So here I can say this is the example of what? Pressure abrasion. This is also a type of what? Teeth bite. So this is also a type of, see, look at this page. This is also an example of what? Pressure abrasion. What about this picture? Picture number 3. Here you can say multiple parallel abrasion. Right now, this is a case of what? Graze abrasion. Graze abrasion. But what about this picture? Picture number 4. Here you can see exact pattern of belt. Right now, so this is a case of what? Patterned, right? So this is a case of what? Patterned. In the same manner, here also you can look at, right now. So this is also the exact pattern of tire. So these two are the examples of what? Patterned abrasion. Now with the help of pictures, you can easily rule out. Now what about contusion? Different types of bruises, contusions. Ectopic means what is the meaning of ectopic bruise? Ectopic means far from the natural side. Suppose if there was a fracture of anterior cranial bone here or frontal bone, but here there cannot be accumulation of blood. No, so accumulation of blood is in the orbital part. So raccoon eye sign. No, raccoon eye sign. This is an example of ectopic, where you can see exact pattern of bruise, patterned. See here, if there will be bruise because of lathi or a rod. Suppose if a person will be hit by a lathi or by a rod, so only external part will be imprinted. Only external part will be imprinted like this. In between, there will be empty part. This is something like a railway line or tram line, right? 6-penny bruise, very important. 6-penny bruise around the throat like this, or in the neck. So this will be a case of what? Manual strangulation, or you can also say what? Manual strangulation or throttling, around the neck, right? Around the wrist. 6-penny bruise. 6-penny bruise means what? See what the meaning of a penny means? Like a coin, like a disc. So if a person is going to throttle someone like this, so do you think around the neck, because of the pressure of the tip of the finger, there can be contusion and bruises? Yes, right now. So multiple more than 5, that is called a 6-penny bruise. So in a case of manual strangulation, gala daba karke jab kisi ko mara jata, right? That is also called as throttling. Around the wrist, child abuse. Around the wrist, that is a case of what? Child abuse. And butterfly bruise. Suppose if a father is going to pinch someone like this, pinch, right? Pinch like this. Okay, fine. After this, see over the face, if you see, or over the body, you can see bruise like butterfly. So butterfly bruise is also seen in child abuse. Now look at some pictures and you will be having more clarity. Look at picture number 1 and picture number 2. Now you can easily understand. See here, abrasions or injury around the neck. This is a case of what? Manual strangulation or throttling. But picture number 2, you can see some injuries around the face, around the lips, around the nose. This is a case of what? Smothering, right? है ना, किसी का अगर मुंह दबा कर कैसे मारा जाता है ना? No, this is called as smothering. This is a smothering. If you can see abrasions and injury marks over genital organs, right now over the body part. So sexual assault, right? Now look at picture number 1 and picture number 2. Picture number 1, when there will be a fracture of anterior cranial fossa, right? Raccoon sign. This is also called as eyes like a panda, panda's eye sign. This is also called as a black spectacled hematoma, black eyes. But if there will be a fracture of basal part, basal fracture or middle cranial fossa, you can see blood accumulation just behind the ear. It is called as battle sign. These two, ye jo dikh raha hai na, raccoon eye sign and battle eye sign, very important, repeatedly asked question. Now look at picture number 1. What is the diagnosis here? Obviously you can easily diagnose. You can easily say, sir, this is a love bite. I know you can diagnose this case. My question is, this is abrasion or contusion? This is a case of contusion. This is bruise. Remember here you can see the exact pattern of lips. So this is a case of patterned contusion. Abrasion means what? There will be superficial rupture of epidermis. Here you cannot see any kind of rupture. No, damage of epidermis is not there, right? Under the skin there is accumulation of blood. This is a case of contusion, patterned contusion, love bite, right? Picture number 2, what about this one? 6 penny bruise or multiple bruises around the neck you can see in this picture. So this is a case of what? Either you can say manual strangulation, or you can say what? This is a case of throttling. This is a case of throttling. Right? Or this is a case of throttling. See, when I look at this picture, see, a study of lip printing is called as what? A study of lip printing, it is called as chyloscopy. What about this one? What about this picture? Yes, this is a case of what? Butterfly bruise. Butterfly bruise, where do we see? In a case of child abuse. Here you can see railway line bruise, something like this, railway line bruise, right? No, railway line bruise. So where do we see? So this is called as what? A railway line or what? Tram line, right? No, so this will be a case after lathi charge or by a rod. Very easy to understand, right? Now, how to difference between ante-mortem and post-mortem contusion? Remember here, what does it mean? Suppose if I have a dead body in front of me and I have to do the examination, I can see multiple bruises, I can see multiple contusion. Now I have to differentiate which one is ante-mortem, which one is post-mortem. Yani कि मरने से पहले और मरने के बाद, right now? So how I'm going to understand? First of all, you should always be careful about vital reactions. What is the meaning of vital reactions? Vital reaction means what? Redness, swelling and pain, right now? Okay, vital reactions will be present only in ante-mortem when person was alive, but it will be absent when person will be dead. Post-mortem mein absent hoga, right? Okay, fine. See here, before death, bruise can be anywhere, but after death, bruise can be only at the dependent part, bony prominences, right? So bony prominences. Very easy to understand. Chalo, these things are very easy to understand. Okay, now the next point from where examiner will be framing a question. Related to blood. Related to blood. इसमें क्या होता है? If you can see, if you can easily wash the blood, or if you cannot easily wash the blood, then suppose if you cannot, what does it mean? Hemodynamics was normal, clotting was normal. When person was alive, अगर clotting normally हो जाएगा ना, तो आसानी से wash नहीं होगा. Right now? Right now? So it means ante-mortem bruise. लेकिन अगर आसानी से wash हो गया तो इसका मतलब क्या हुआ? Clotting नहीं हुआ था, right? So if you can easily wash it away, it means post-mortem. You cannot easily wash it away, it means what? Ante-mortem. Now look at this picture. A person is presented to casualty with the injury shown below. अब ये देख के बताओ, ये sharp cut है, avulsion है या split laceration. First of all, देख के बताओ, this is what? Sharp cut trauma or this is blunt trauma. Some of you will say what? Yes, 100% this is a case of what? Sharp cut, right? No, 100% this is a case of sharp cut. Some of you might be saying this, right? Chalo, theek hai, let's discuss this case. First of all, look at this picture. What is this? This is a sharp or blunt. Sharp trauma or blunt trauma, right? See, dekho, when a person will be attacked by a blade or a knife, और अगर तुम किसी को ब्लेड से कट करोगे ऐसे ना, ब्लेड से, सपोज इफ यू आर गोइंग टू गिव अ कट विद द हेल्प ऑफ अ ब्लेड, ब्लेड से कट करोगे तो बिल्कुल एकदम शार्प ऐसे कटेगा, राइट? मार्जिन, बाउंड्री लाइन बहुत ही एकदम इवन होगा, रेगुलर होगा. व्हेन यू गिव अ शार्प कट, ब्लड वेसल्स विल आल्सो बी शार्पली कट. तो ब्लीडिंग तो बहुत तेज होगा ना, देयर विल बी फास्ट ब्लीडिंग. बट what is the meaning of blunt trauma? Blunt का मतलब क्या हुआ कि if a person was walking on the road, suddenly a car came and hit him like this. तो जैसे when a blunt weapon is going to hit you like this and go away like this, तो क्या होगा? यहाँ से there can be rupture of skin and subcutaneous tissue, ऐसे निकल करके बाहर आएगा, right? No? So अब ये बताओ, अगर blunt trauma हुआ, ऐसे suddenly बाहर निकल गया skin and subcutaneous tissue, do you think there will be a regular margin? Obviously no. Do you think there will be a regular boundary? Obviously no. Do you think there will be a fast bleeding? Remember here, whenever hard hit like this, so what will happen to the blood vessels? Blood vessels को अगर blunt trauma होगा ना, blunt trauma होगा तो blood vessels क्या होगा यहाँ पे? Remember here, blood vessels will be crushed. दब जाएगा, ऐसे कर चिपक जाएगा, right? No, because of this there will be what? Sluggish blood flow, slow bleeding, right? That is right. No, so now you look at this photo and now you understand. if you look at this photo, right? Now you look at this photo and now you tell me, do you think margin is regular? Do you think boundary line is what, even here? Obviously no. Do you think there is what, very fast bleeding? Obviously no. There is what, sluggish blood flow. So I can say this is not sharp cut trauma, this is blunt trauma. This is a blunt trauma. So how to differentiate sharp and blunt? Sharp and blunt. See here, laceration is a type of blunt trauma. Blunt trauma. But incision, this is what, sharp. Incision is what, sharp. Right? So remember, margin is uneven, boundary line irregular. Irregular. Bleeding will be what, very slow, or you can say what, sluggish blood flow. But what about incision? This will be even. Okay, boundary line regular. Bleeding will be what, fast, or you can say what, profuse bleeding. Profuse bleeding. But there is a term that is called as tissue bridge. What is the meaning of tissue bridge? Do you understand here? Tissue bridge means what? Suppose if I am going to give one incision like this, so here when there will be gap in the, see this is what incision is, so like incision is like this. So ye gap may see blood vessels and neurovascular bundle will sharply be cut. You can see only one gap, right? No. But in a laceration, in a case of blunt trauma, what will happen whenever you are going to hit someone like this? No, now there will be a rupture of a skin or subcutaneous tissue like this. This will be coming out like this. No, when it will be coming out like this, in between neurovascular bundle will be intact. Neurovascular bundle will be intact like this. This is called as what? Tissue bridge. Remember, tissue bridge will be seen only in laceration, not in incision. Not in incision. You can see, now you can look at this photo, you can easily understand. I am showing you tissue bridge here. I am showing you tissue bridge here. Tissue bridge here. You can see this is absent. This is sharp cut trauma. But here you can see it is present. This is what? Blunt trauma. Blunt trauma. I hope all these points are clear to everyone. Now, laceration. Now you can easily understand laceration photo and incision photo. Types of laceration. First of all, split laceration. This is very, very important for your exam. So we are going to discuss it very soon. But इससे पहले देखो, stretch laceration means what? Suppose अगर किसी का accident हुआ, bone fracture हो गया. You cannot see bone fracture outside. तो अंदर में ही ना fractured bone ऐसे है. Right now? तो ये जो ऐसे जो फ्रैक्चर है तो ओवर द स्किन, डू यू थिंक दिस इज गोइंग टू अप्लाई अ प्रेशर? ठीक है, कुछ देर के बाद स्ट्रेच होते होते क्या स्किन फट जाएगा. दैट इज कॉल्ड स्ट्रेच लैसरेशन. कॉमन टाइप बिकॉज ऑफ लोकल इंपैक्ट, इट इज कॉल्ड द टेयर. बट शेयरिंग फोर्स, shearing force का मतलब क्या हुआ? When a person was standing at the roadside, a car came across him and hit him like this. ऐसे जोर से मार के चला गया at an angle. Because of the shearing force, now skin can come out like this. This is called as avulsion injury. Avulsion injury. Let's see the pictures and you will be having more clarity. Look at this photo, picture number 1. And now you tell me, this is a sharp or blunt? This is a case of blunt trauma and this is a case of what? Laceration only. This is a case of laceration. But now what about picture number 2? Picture number 2, this looks like what? Obviously sharp cut, no? This looks like incision. But if you see it minutely, see? Now, do you think this is sharp? Now you look at the margin and boundary line, right? Now, margin and boundary line. So, when you look at this photo from the far, this appears like incision. Incision looking. But this is a case of what? Laceration. So, this is called as what? Incised looking laceration. That is called as split laceration. Split laceration. Remember, this is a case of what? Blunt trauma. Split laceration. Remember here, whenever there will be a bony prominence, इस पे अगर अटैक होगा तो बिल्कुल ऐसा लगेगा वुंड जैसे कि इंसिजन है, शार्प दिखे, लेकिन इसको क्लोजली देखोगे, sluggish blood flow, irregular margin, right? No, uneven margin and boundary line. Very easy to understand. So this is also a case of what? Split laceration. Now, avulsion injuries, only skin is coming out. It is called as a flaying. It is called as a flaying. Skin plus subcutaneous tissues, say skin plus subcutaneous tissue, this is called as a degloving injury. Degloving injury. Degloving. But see here, when say skin subcutaneous tissue of a scalp is coming out like this, it is called as scalping. It is called as scalping. Right? Now, what about incised cut? Incised cut means what? Sharp cut. So here, length is the most important dimension. So from the point, see here, see from the point of starting. So where you are starting, that point will be, so there will be big end, that is called head end. And see, suppose if I started from here, if I'm going to finish here, the point where you are going to stop, right? That is called as what? That will be narrow. That is called a tail end. That is called a tail end. If you see a gap, this is called a gaping. Right now, so now you look at picture number 1 and picture number 2. What is the point of starting? Point of starting will be bigger here, no? So here this is starting point, and the narrow tail end is what? Right now, this is tail end. Now, suppose if a person is going to give a cut like this, so starting point, there can be penetration. Starting point you can appreciate, other point you cannot appreciate. This is called a beveling cut. Remember here, beveling cut is seen in sharp cut only, not in the blunt trauma. Now, if you can see multiple small cuts over the forearm, over the chest, over the neck, okay, you can easily understand, okay, this is a case of what? Hesitational cuts, also called as tentative cuts. Also called as tentative cuts. Okay, so this is also called as trial cuts. This will be seen in which condition? This will be seen in suicide case. This will be seen in suicide case. Now, when you look at this kind of injury, right now, obviously heavy cutting weapon was used, right now. So this is a case of what? Chop cut, right now, chop cut injury, chop cut. So even if you can see only one injury, only one, so if it is a case of heavy cutting weapon, right now, so at one side you can see what? Some kind of bruise, some kind of severe contusion, okay. If a knife was used, sharp cut, pointed weapon, if you can see only one entry point, it is called a penetrating wound. If you can say entry also, exit also, this is called a perforating wound, right? Perforating. Now, if a person was using a weapon of single-edged weapon, so after looking at the shape of the wound also, you can easily understand. If shape is like a triangle, right now, or a wedge shape, one angle will be sharp, another will be blunt. This is so when you look at these pictures, you can easily understand, okay, single-edged weapon was used, but double-edged, if you can see shape of the wound like this, something like this, elliptical or slit like, right? Both angles will be sharp. This is so what does it mean? Double-edged. And now if someone is attacking on you, ठीक है ना, अगर कोई आप पे attack करता है, if you are going to hold the weapon like this, you can see the wounds around web spaces in the palm. It is called as what? Active defensive wound. So this is a case of what? Active defensive wound. But if you are going to protect yourself like this, अगर अपने आप को ऐसे है ना, ऐसे बचाते हो, you can see wounds over the forearm, over the back of the hand. That will be called as what? Passive defensive wound. Passive defensive wound. Picture number 1 is what? Active defensive wound. Picture number 2 is what? Passive defensive wound. Right? Very easy to understand. If you can see wounds like this, active. If you can see wounds like this, it is passive defensive wound. Next question. A motorist had suffered head-on collision at low speed where he hit his head on the steering wheel. Injury over the brain at the point of impact is called as. यानी कि जहां पे जैसे उसको स्टीयरिंग पे ऐसे चोट लगा ना, so at the point of impact inside the skull, yes, brain tissue injury will be there, no? So that is called as what? Remember here, suppose if you are going to hold a person, hold his head like this, दीवार पे ऐसे जाके मार दोगे, तो at the point of contact कुछ injury होगा cerebral cortex में. Inside the skull, cerebral cortex is loosely fit now. तो वो cerebral cortex पीछे भी जाके लगेगा ना, at the back of the skull. तो anterior point injury is called as coup injury. An injury at the posterior part is called as counter coup injury. Remember here, very, very important. At the point of impact injury, it is called as coup injury. Against the wall, right, opposite side, this is called as what? Counter coup. You can easily understand here, right? Now, one is called as coup injury, another is called as what? Counter coup injury. Now, what is the meaning of pond fracture? Remember here, pond fracture is seen in newborns, or you can say what? In infants, right? We are going to learn it. Remember here, some regional injuries. After local fracture, if you can see only one linear crack, it is called as a fissure fracture. See, after looking at this injury, are you able to tell me which weapon was used? Easily you can say one hammer was used, hathodi, no? Why? Because see here, you can see there is a depression. Okay, this is called a depressed fracture. But you can also see that hammer has given its signature here. Right now, this is also called as signature fracture or fracture a la signature. Easy to understand, right? Okay, fine. When there will be multiple fracture, it is called a compound fracture. Now, understand here, in a case of newborn or infant, their skull will be very, very soft. So after any kind of injury, you can see only a small denting here. You can see what? A small denting, right? No, denting you can see. This is called a what? Indented fracture. Okay, same like a table tennis ball. In China, it is called as what? Ping pong. In China, it is a national game. It is also called a ping pong fracture. Ping pong fracture. Remember, if you can see after injury, if you can see separation of suture like this, it is called a sutural fracture, also called a diastatic fracture. If you can see at this picture where you can see that a small portion of a skull bone is removed, you can see only one hole, you can see like a gutter, it is called as a gutter fracture. If you can see one rod is entering here and coming out from this side, this is called as perforating fracture. And now you look at this photo. If there is a history of fall from the height, when a person is landing on his butts or feet, so what will happen? See, from the down part there will be what? Heavy pressure here, right? So a skull can get separated from the spine, from the point of a foramen, from the ring of foramen. This is called as a ring fracture or a transverse fracture. But if a person was riding a bike very, very fast, and suddenly if there is what accident, if he is falling on the road, right now, when there will be heavy blow from this side, and what is happening here? Remember, head can be divided into two parts. Something like this, like a nodding face. This is called as what? Nodding face sign. Something like a hinge fracture, also called as motorcyclist fracture. Now, look at this photo. A man is brought to hospital after head injury. His CT scan is shown below. Which of the following is wrong statement related to medical legal case in this patient? First of all, this is a case of what? Where do you see this kind of appearance? You see in a case of extradural hemorrhage. Right now? So, in a case of extradural hemorrhage, now let's learn this topic first. After that, we can solve this question. See, first of all, this is a skull bone. This is a skull. After that, see, inside there can be a rupture of some layers, right? Pia mater, arachnoid mater, dura mater. If there is bleeding here, right, this is extradural. If there is bleeding here, this is what? Subdural. If bleeding is here, subarachnoid. So extradural hemorrhage, which blood vessel is getting ruptured? Middle meningeal artery, right? Subdural bridging veins, subarachnoid, where you will see that there is what? Thunderclap type of headache, worst headache of the life, patient will say like that, right? So there can be what? Rupture of what? Aneurysm, AV malformation, right? Now, very easy to understand. So here, like especially related to medical legal importance, we have to talk about extradural hemorrhage. What is happening here? when you look at this photo, you can easily understand what is happening with the patient here. Right in the extradural hemorrhage, there is something called as lucid interval. Lucid interval. What does it mean? Lucid interval means what? Remember here, a period of consciousness in between two periods of unconsciousness. When patient got admitted in your hospital, he was fully unconscious. After basic line of management, after a few hours, he became fully conscious. But after few hours, again he can go into unconsciousness. So period of consciousness in between two periods of unconsciousness is called as what? Lucid interval. Lucid interval, right? Very easy to understand. So which of the following is wrong? Remember, see option number 1, he can have a period of consciousness in between. Yes, this is called as lucid interval. He can sign a valid contract during the period of consciousness. Yes, remember here, during lucid interval, if a person is signing any contract, yes, this will be considered as a valid. Right now? Okay, fine. Now you tell me, suppose after head injury, if a person was completely unconscious and lying along the roadside, when police van came, he got up. After looking at the police, again he fell unconscious. What police will think? Police will think what? Okay, he is drunk. So remember, EDH can resemble like drunkenness. Now, what is the root cause here? Rupture of middle meningeal artery, not the bridging veins. Very easy to understand. This is important for your exam. Now, next, some of the torture methods. Police is beating a person on his soul. Which type of torture method is this? Right? Which type of torture method is this? We have to know. See, beating on the soul, this is called as phalange or bastinado, or beating on the soul. Beating on the ear, it is called as what? Telephono. Remember here, if a plastic bag is there, fecal matter or urine, okay, something like this, this is called as a wet submarine. Only a plastic bag around the face, it is called as a dry submarine. These are methods of torture. Now, if you are going to hang someone like a parrot, it is called as parrot's perch. If you are going to make someone sit like this on a wooden horse like this, this is called as saw horse. This is called as saw horse, right? Even if you want to give him more punishment, you can do what? You are going to tie 5 kilogram here, just below the legs. Saw horse, right? Dubo dubo ke marna, kisi ko dubo dubo ke marna, like this. एक बार डुबोया, after that you are going to take him out. You will give him a time to confess the truth. सच बोल. अगर वो नहीं बोलेगा, दोबारा डुबोगे. इसको कहते हैं डंकिंग, डुबो डुबो के मारना. Incapacitamento means what? Incapacitamento. This is especially used by mafia people. Especially used by mafia people. They can tie the wrist and ankle. Same rope they can ligate around the neck. Person can die because of partial hanging. This is called as incapacitamento. Now, what is the meaning of cattle prod? Genital shock. Remember here, electric shock over genitals. Over genitals. Black slave in old age, only for black Americans. If they used to do any mistake, black hot iron rod used to get inserted into their anal canal. It is called as black slave. Black slave. Okay, now look at this question. So basically, see, this is a case of hanging, but how we are going to understand? So with the help of this question, we are going to start the new chapter about asphyxial death. Asphyxial death. Question is, how we are going to learn about asphyxia? See here, if there is complete suspension of body and neck constriction is also there. Basically, किसी को लटका दिया गला दबा करके. That is called as what? Hanging. That is called as hanging. Suspension of body with the neck constriction. Second condition, no suspension of body. Body को लटकाया नहीं ऊपर. एक इंसान बैठा हुआ है, But in neck constriction, see, suppose if I'm sitting here, someone is standing at the back, he is going to ligate my neck. पीछे से कोई गला constrict करेगा, दबाएगा. That is called as what? Strangulation. That is called as a strangulation, right? Strangulation. So there are two types of strangulation. If a ligature material is applied, रस्सी से कोई strangulate कर रहा है, that is called as ligature strangulation, right? Ligature strangulation. लेकिन कोई हाथ से गला दबा करके मार रहा है, manual. This is called as what? Manual strangulation. Manual strangulation is also called as throttling. This is also called as throttling. Now, one more condition: no suspension of body and no neck constriction. Still there is asphyxia. That is called as suffocation death, right? Suffocation death. Here only we are going to learn about drowning, पानी में डूब के मरना. बाकी भी different methods of suffocation we are going to learn one by one. So look at this question now. In this question, what is the diagnosis as per the photo? Is it partial hanging, complete atypical, typical, or ligature strangulation? So first of all, we have to understand all the terms. Then only we can solve this question. So first of all, see here, hanging can be divided on the basis of knotting. First of all, knotting. Knotting का मतलब क्या होता है? देखो, see here, with the help of this wire, when I am making a knot, हिंदी में कहते हैं गांठ बांधना, right? है ना? ये जो this is called as what? Knotting part. This is called as knotting, right? No? तो अब आता है कि जहां पे knotting है, knotting का location क्या, उसके basis पे हम लोग नाम देते हैं, right? So if knotting is placed exactly at the center of back, exactly over the occiput, it is called as typical hanging. Apart from occiput, if knotting is anywhere else, यहाँ पे भी हो सकता है, यहाँ पे भी हो सकता है. All these are called as what? When I talk about these two, all these are called what? Atypical hanging. Atypical hanging. So knotting over occiput, or you can say what? Centrally located over the nape of the neck, right? Over the back of the head here. This is called a typical hanging. But लेकिन अगर ये submental position हो या angle of jaw हो, angle of mandible, these are called as what? Atypical hanging. Remember here, look at picture number C, this one, where knotting is over the angle of jaw, angle of mandible. See, this is a type of what? Judicial hanging. Judicial hanging. So what is the meaning of judicial hanging? As per the law, as per judiciary system. But if examiner is asking you, out of these three, which one is the most effective way of hanging a person? Most effective kya hai? This one. Submental position. This is what? Most effective way. This is most effective way. ठीक है? तो on the basis of knotting we can understand there are two types of hanging: typical hanging, atypical hanging. But on the basis of suspension of body, if body is completely suspended in air, पूरी तरह से हवा में लटकाया गया है बॉडी को, इसको बोलते हैं complete hanging. But if any part of the body is going to touch the ground, it is called as partial hanging. Partial hanging. Easy to understand. See here, अगर किसी को लटकाया जाता है, ठीक है ना, अगर हैंग किया जाता है, तो बेसिकली आइडियली देयर शुड बी एनी फोर्स ऑफ कॉन्स्ट्रिक्शन. यहाँ पे कुछ तो ऐसा फोर्स हो, कोई तो ऐसा वेट हो जो गला को दबाए, राइट ना. सो क्वेश्चन इज इन कंप्लीट हैंगिंग, व्हाट इज द फोर्स ऑफ कॉन्स्ट्रिक्शन? फोर्स ऑफ कॉन्स्ट्रिक्शन इज बॉडी वेट. Force of constriction is body weight. Body weight. Right? But when I talk about partial hanging, see here, any part of the body is going to touch the ground like knees, legs, whatever, right? Now, so in this manner, lower part of the body weight will be neutralized. So here, what is the force of constriction? Weight of head. Weight of head. So when I talk about body weight, complete neck constriction, what is the most common cause of death in complete hanging? Obviously here it is what? Asphyxia. Here it is what? Asphyxia. But when we talk about partial hanging, here it is what? Mostly ischemia. Mostly ischemia. Because see here, whenever there will be partial hanging, there will be obstruction of blood vessels here, right? No, lack of blood supply to the brain. So mostly ischemia. If examiner is asking you, what is the most common cause of death? Overall, what is the cause of death in hanging? Your answer should be asphyxia with ischemia. Now, I hope these definitions are completely clear to everyone. एक तो हो गया नॉटिंग के बेसिस पे typical and atypical. On the way of, see, suspension here, क्या है? Complete and partial hanging. Now, let's learn some more points. Question is that, if hanging is there, what should be the signs and symptoms? ये बताओ, अगर गला दबाया जाएगा manually or by a ligature material, रस्सी से, so do you think there will be obstruction over the neck? हो रहा है obstruction? Yes. So do you think there will be cyanosis? Yes. Cyanosis होगा नहीं? Cyanosis, bluish discoloration? Yes. जब गला दबाया जाएगा, do you think there will be congestion? Yes. There will be congestion. Congestion. अब ये बताओ, when there will be severe pressure, heavy pressure over the blood vessels. Now after some time, do you think there will be heavy congestion inside the blood vessel, and there can be rupture of blood vessel also, right? No, so now you tell me, because of the heavy pressure, because of the heavy congestion over the face, do you think there can be small blood spots, red spots over the face also, right? Now nearby here, so these spots are called as what? Petechial hemorrhages. These are called as what? Petechial hemorrhages. These are called as petechial hemorrhages. Basically, this is also called as tardive spots. This is also called as tardive spots. Easy to understand? So whenever there will be asphyxial death, no, whenever there will be asphyxial death, yes, there will be a triad of what? Cyanosis, congestion, and tardive spots. So these are the signs of asphyxial death. Easy to understand? Right. Now, the question is that when neck will be constricted. Okay, now let's understand this part. Suppose if they'll be hanging like this, ये ऊपर की तरफ जा रहा है, ठीक है ना? See, देखो, now rope is just at the base of the mouth here, floor here. My question is that, do you think there'll be dribbling of saliva? बाहर निकलेगा saliva क्या? Yes. Why? There will be irritation of salivary glands. First point clear. Second, do you think zaban bahar aa jayega? Do you think there will be protrusion of tongue? Yes, because there will be pressure over the lower part of the tongue, or posterior part of the tongue, right? So there will be protrusion of tongue and dribbling of saliva. Okay. Remember here, when I talk about dribbling of saliva, no, please write down, this is the surest sign of antemortem hanging. Antemortem, I am saying it means what? See, antemortem means what? Before death. Dribbling of saliva is surest sign of antemortem hanging. Question. Now, what is the meaning of Livor sympathetic? When a person will be hanged, the knot which is going to compress the cervical sympathetic chain, because of that on the same side, eyes will remain open. This is called as Livor sympathetic. Please remember, this is also an antemortem sign. Antemortem sign. अब क्वेश्चन है, लिगेचर मार्क्स क्या आएगा ये बताओ, ठीक है ना? तो जब भी आप पोस्टमार्टम एग्जामिनेशन के लिए देखोगे डेड बॉडी को ना, तो डेड बॉडी को देख करके नेक के अराउंड में लिगेचर मार्क्स कैसा, उसके बेसिस पे आप बताओगे ये सुसाइड केस था, या होमिसाइड था, या फिर ये टिपिकल हैंगिंग था, एटिपिकल था, या किसी और ने गला दबा करके मारा है, राइट ना? सो लिगेचर मार्क्स तो देखना पड़ेगा ना. सो लेट्स सी लिगेचर मार्क्स एंड लेट्स अंडरस्टैंड. फर्स्ट ऑफ ऑल आई एम टॉकिंग अबाउट टिपिकल हैंगिंग, कंप्लीट हैंगिंग. टिपिकल हैंगिंग का मतलब क्या हुआ? Knot will be at the back side. अब देखो ये, see देखो, जैसे अगर लिगेचर मार्क पीछे है, राइट ना? See, yes, you always remember where there will be knotting, no, वहां पे लिगेचर मार्क अच्छे से नहीं आ पाए, क्योंकि वो थोड़ा सा लूज हो जाएगा ना, राइट? सो अगर देखो बैक साइड में, see if it will be like this, no, so now you look at here. So first of all you look here, see this is suprathyroid or infrathyroid? This is supra. Okay, now you look at here, this is oblique or horizontal? So answer is what? obliquely, no, obliquely placed. So ligature mark oblique आएगा. तीसरा, जहां पे नॉटिंग होगा ना, नॉटिंग, वहां पे लिगेचर मार्क नहीं आएगा. तो इसका मतलब पीछे में जहां पे नॉट एग्जैक्टली वहां पे नहीं आए, तो लिगेचर मार्क अराउंड द नेक विल बी कंप्लीट और इनकम्प्लीट. ऑब्वियसली इनकम्प्लीट. सो व्हाट आर द लिगेचर मार्क्स इन टिपिकल एंड कंप्लीट हैंगिंग? आंसर इज व्हाट? IOS. फर्स्ट ऑफ ऑल इनकम्प्लीट, ओब्लिक एंड सुपराथायरॉइड. एक बार ये फोटो देखो और आपको समझ में आ जाएगा. देखो सबसे पहले यहां पे क्या, देखो लोकेशन क्या है? सुप्रा. सेकेंड देखो ये कैसा जा रहा है? दिस इज गोइंग व्हाट? ऑब्लिकली, है ना. देखो ऑब्लिकली जा रहा है, राइट. नो, ऑब्लिक है ये लिगेचर मार्क. अगर यही लिगेचर मार्क आपका ऐसे होता तो आप कहते हैं हॉरिजॉन्टल या ट्रांसवर्स, बट हियर यहां पे क्या है? ओब्लिकली प्लेस्ड. यहां पे देखो लिगेचर मार्क नहीं है, इसका मतलब क्या हुआ? इनकम्प्लीट. अब तो ये देख के तो बता सकते हो ना, ये सी व्हेन यू लुक एट दिस फोटो, दिस इज एन एग्जांपल ऑफ टिपिकल हैंगिंग और एटिपिकल हैंगिंग. देखो लिगेचर मार्क जहां पे नहीं है, इसका मतलब नॉटिंग वहीं पे था, राइट ना, नॉट वहीं पे था. तो नॉट यहां पे कहां पे? एंगल ऑफ जॉ पे है, एंगल ऑफ जॉ पे है, राइट. सो दिस इज एन एग्जांपल ऑफ व्हाट? एटिपिकल हैंगिंग. Atypical hanging, right? Very easy to understand. I hope all these points are clear to everyone. Now look at these pictures and you will be having more clarity. ठीक है, सबसे पहले एक और चीज डिस्कस कर लेते हैं. चलो ठीक है, complete hanging understood. Now ligature strangulation. Ligature strangulation means what? Someone is standing at my back. Suppose if I'm sitting here, someone is going to ligate my neck, someone is going to constrict my neck. Ligature strangulation I'm talking about, right? तो पीछे से अगर कोई रस्सी करके ऐसे गला दबा करके मार रहा, राइट, तो इजी टू अंडरस्टैंड. सो अगर पीछे से कोई ऐसे खींच रहा तो ये पूरा ऐसे चला जाएगा. नाउ यू लुक एट हियर, सी इफ देयर विल बी लिगेचर स्ट्रैंगुलेशन और दिस विल कम डाउन, पूरा नीचे, पीछे में खड़ा है कोई, सो दिस विल बी इंफ्राथायरॉइड. दिस इज ओब्लिक और हॉरिजॉन्टल, हॉरिजॉन्टल है, राइट. नो, पीछे से अगर कोई गला दबा रहा, ही विल नॉट बी टेकिंग एनी चांस, वो पूरा का पूरा गला दबाएगा, राइट. सो इट विल बी कंप्लीट. सो व्हेन आई टॉक अबाउट लिगेचर स्ट्रैंगुलेशन, what will be the sign, what will be the ligature marks? ITC Grand Chola Hotel 7-star mnemonic. I for what? Infrathyroid. T for what? Transverse or horizontal. C for complete. Ligature marks in hanging and ligature marks in ligature strangulation. How to differentiate these two is repeatedly asked question. And now you look at these pictures and now you answer me. Picture number 1 and this is picture number 2. Out of 1 and 2, which one is hanging and which one is ligature strangulation? Now you can easily understand, right now. See, देखो here it is going what? Obliquely, suprathyroid also, and incomplete. So picture number 1 is what? Hanging. Look at picture number 2. This is what? First of all, infrathyroid. It is what? See here. So this is what? Transverse, and this is complete around, right now, neck. So remember, this is hanging and this is strangulation. Now there should be no confusion. On the basis of ligature marks, we can easily differentiate hanging and ligature strangulation. Very easy to understand. Okay, now there can be confusion in between typical complete hanging and partial hanging. See here, complete hanging, yes. Here it will be what? IOS. Incomplete, oblique and suprathyroid. But partial hanging, no, partial hanging में क्या होगा? See here, head will come down. So see here, ligature material will also come down, right now. So when it will come down, this will become what? Infrathyroid, below thyroid, right now, infrathyroid, and this will become what? Transverse, or you can say horizontal. Okay, so how to differentiate typical complete hanging and ligature strangulation? One question. How to differentiate complete hanging and partial hanging? Second question. On the basis of ligature marks, we can solve the case and solve the question also. Now look at these pictures. See here, picture number 1. Picture number 1. When a mob is going to hang someone, एक भीड़ अगर किसी इंसान को फांसी पे लटका दे, इसको बोलते हैं लिंचिंग. दिस इज कॉल्ड एज लिंचिंग. Lynching. Judicial hanging, what I have taught you, judicial hanging, this is a case of what? Judicial hanging. What I have taught you about judicial hanging? As per the judiciary system, as per the law. तो यहाँ पे इसके कुछ rules है. First of all, knotting should be at angle of jaw. Angle of jaw. Okay. Second, length of rope. Length of rope from the point of suspension should be equal to the height of the person. Height of the person. Okay, no? So when knotting is at the angle of jaw, when a person will be left, जैसे उसको छोड़ेगा ना, suddenly जैसे नीचे गिरेगा ना, तो कैसा हो जाएगा यहाँ पे उसका? Suddenly इस तरह से jerky movement over the neck, and there will be sudden fracture of vertebra. Which vertebra? C2 vertebra. Now suddenly there will be what? C2 vertebra fracture. Right now, C2 vertebra fracture. Very easy to understand. Axis. Okay. So that's why fracture of C2 vertebra, that's why it is also called as hangman's fracture. Hangman's fracture. Very easy to understand. Right. The question is that, see, remember here, sometimes examiner can give you one X-ray. An examiner will be pointing towards fractured C2 vertebra, fractured C2 vertebra. And examiner can try to ask you, in a case of hanging where a knot was placed, is it typical type or atypical type? So obviously now you understand that this is atypical type of hanging. Now remember here, I have taught you about IPC and CrPC, which CrPC is associated with hanging, process of hanging. Please remember this is what? CrPC number 354. CrPC 354. So, see, the process of hanging is through CrPC 354. Judge has to say hang till death. Why? Because a fatal period of hanging is 3 to 5 minutes. 3 to 5 minutes. If judge will not say hang till death, then what will happen? Suddenly rope will be ligated here after hanging. Person can leave him within 1 minute. And there will be what? A type of suspended animation. For time being his life will be suspended, but after resuscitation he could be revived. Dobara zinda kar sakte hai usko. That's why judge has to say what? Hang till death. Remember here process of hanging is CrPC 354. Here only you should know about IPC 354. Try to understand here how examiner will try to trap you. One is IPC 354. Another is a CrPC 354. CrPC 354 is for hanging, but IPC, Indian Penal Code, which defines offenses and punishment. Remember here, there are 4 sections of IPC number 354. 354A, 354B, C and D. E for sexual assault. IPC number 354B defines what? Disrobing a female. Disrobing a female by using power. IPC number 354C, this defines what? Voyeurism. Voyeurism, scotophilia or peeping Tom. This is a type of paraphilia. What is the meaning of voyeurism? Sexual gratification by watching the act of sexual intercourse by someone else. Or if a female is undressing, or if a man is watching her secretly and getting what? Sexually gratification. No? So that will be called as what? Voyeurism. That is also type of paraphilia. That is an offense. IPC number 354D. This defines stalking. So what is the meaning of a stalking? Following a woman without her knowledge. Offline and online, both are punishable offense. This is 354D. Remember, IPC 354 defines sexual laws. 354 CrPC is related to what? Hanging process. I hope all these points are clear to all of you. Now, you look at this picture and you can easily understand this is a case of what? This is a case of manual strangulation or throttling, right? No, throttling. So now you tell me, what kind of bruise can occur here? What kind of bruise in manual strangulation? If you are going to ligate, suppose if you are going to ligate the neck, see, suppose if you are going to throttle someone, किसी को हाथ से गला दबा करके मारोगे, so because of the pressure exerted by tip of the fingers, do you think यहाँ पे bruises आ सकते हैं, multiple disc shape? So now you tell me which type of bruise will be here. This is called as 6 penny bruises. Multiple small disc shaped contusion over the neck is called as what? 6 penny bruises, right? Always remember that signs of a struggle will be more in a strangulation than hanging. Now, look at these pictures and now you try to answer. Now, I'm sure you can easily answer this question. Picture number 1 is what? Hanging, ligature strangulation or manual strangulation. Now, you can easily answer. So, this is a case of what? Hanging. My question is, this is typical or atypical? This is atypical. Why atypical? Because look at the occiput. Okay? Ligature mark is not there. So it means what? Knotting was placed at or over the occiput. So this is typical hanging. This is going oblique, right? Oblique, suprathyroid. So this is a case of what? Typical complete hanging. Typical complete hanging. Okay, so this was the question. So answer is what? Answer of the question which I have shown you just now. Fine. So what is the answer here now? This is a case of, say here, this is a case of knotting was here. So this is a case of typical and complete hanging. Answer is C here. Typical and complete hanging, right? Okay. Now, look at picture number 2. Look at picture number 2. You can see multiple bruises over the neck. You can say what? These are what? 6 penny bruises. No, these are what? 6 penny bruises. So this is a case of what? Manual strangulation, also called as throttling. Also called as throttling. Okay, fine. Now, what about picture number 3? Here you can see the ligature mark here. No, ligature mark here. Right? So this is what? This is infrathyroid, transverse and complete. Right? Infrathyroid, transverse and complete. So this is a case of ligature strangulation. Ligature strangulation. I hope all these points are clear to all of you. On the basis of ligature marks only, you can diagnose multiple cases. Now, special types of strangulation. See, remember here, special types or different methods of constriction of neck. When a rope will be thrown from behind, पीछे से कोई रस्सी फेंक करके खींचेगा, this is a type, this is called as what? Garroting. Garroting. A type of garroting where not the rope but iron rod will be ligated around the neck. And after that, a screw fixation will be screw fix करके इसको tight करते हैं. This is called as a Spanish windlass. In Spain, this is judicial method of execution. Remember here, Spanish windlass. This is a type of garroting. This is a type of garroting. This you should not forget. Garroting, रस्सी फेंक करके एंड उसी में है ना, रस्सी से गला दबाया गया पीछे से ऐसे करके, राइट? उसी तरह से आयरन कॉलर रॉड अगर गले में दबा करके, है ना, स्क्रू फिक्स करके टाइट करके अगर किसी को मारा जा रहा है, दिस इज कॉल्ड एज व्हाट? स्पेनिश विंडलास. स्पेनिश विंडलास, which is a type of garroting. 2 bamboo sticks, 2 rod are applied around the neck, है ना, like this. This is called as what? बांस डोला. बांस डोला. If you are going to kill someone under the bend of your elbow, right, this is called as mugging. इसको क्या बोलते हैं? Mugging. Now, see, when I talk about hanging ho या strangulation ho, thyroid cartilage will be damaged for sure. Yes, it will be damaged in both ligature में भी और hanging में भी, but mostly किस में होगा? Ligature strangulation. Okay, fine. Ligature strangulation. But hyoid bone fracture, remember here, on the basis of nature of fracture of hyoid bone, we can easily understand. अगर किसी को हाथ से गला दबाया जा रहा है ऐसे, when you are going to throttle someone like this, so hyoid bone fracture will go inside. There will be what? So basically this is coming inside adduction. No, this is called as adduction fracture. adduction fracture, inward compression. This will be seen in throttling. But in hanging case, see here, so ligature material will be pushing the fracture part to the opposite side. It is going outward compression, यानी कि बाहर की तरफ जा रहा है. This is called as abduction fracture, right? Abduction, or you can say outward compression. So in hanging, you can see hyoid bone fracture will be going out. In manual strangulation, fracture will be coming inside. Now, look at this question and try to answer. Combination of a smothering and traumatic asphyxia is called as. तो सबसे पहले समझेंगे smothering होता क्या है, right? Okay. First of all, so basically we are going to talk about what? Suffocation death. Keep in mind, देखो नाक और मुंह को बाहर से बंद किया जाए ऐसे, with the help of palm or a pillow. So external blockage of respiratory passages, it is called as smothering. See here, blockage of internal respiratory passages. If it is accidental, it is called as choking. Accidental किसमें होगा? Fish bone or obstruction by a coin. Okay, but homicidal, if someone is going to push a paper roll or cloth inside the mouth of a person, now that will be called as what? Gagging, right? So we are going to learn different suffocation deaths. Now you can easily understand blockage of external respiratory passages, right? It is called as smothering. Accidental, right? Accidental. So this is called as accidental. It is called as choking. Gagging means what? Someone is going to push a paper roll or cloth into the mouth. अंदर जैसे होता है ना कि मुंह के अंदर में एक तो कपड़े ठूस करके जो अंदर का जो होता है ना रेस्पिरेटरी पैसेजेस उसको ब्लॉक करना, दैट इज कॉल्ड एज गैगिंग. नाउ लुक एट दिस पिक्चर. दिस इज एस्फिक्सिया ड्यू टू अ ट्रॉमा. व्हाट डज इट मीन? अगर किसी जगह पे बिल्डिंग कोलैप्स हुआ, बिल्डिंग कोलैप्स, अगर स्टैम्पीड हुआ, स्टैम्पीड, और रोड ट्रैफिक एक्सीडेंट और रेलवे एक्सीडेंट. Now you tell me, suppose if there is a building collapse, एक building पूरा गिर गया and now there is very heavy object over the chest. Suppose if a 150 kilogram is there over the chest of a person, do you think there will be mechanical obstruction? Yes, है ना? mechanical obstruction होगा ना, block होगा ना, सांस लेने में दिक्कत आएगी ना, asphyxia due to trauma हो रहा है, इसी को बोलते हैं traumatic asphyxia. Now, if there will be heavy object over the chest, mechanical blockage here, so yes, obstruction in the blood passage also. So do you think there will be cyanosis over the upper part of the shoulder, neck and face? Yes. Like ऐसा लगे ना पूरे इसमें mask आ गया ecchymosis का, right? It is called as what? Ecchymotic mask, or you can say what? Mask ecchymotic. Mask ecchymotic. Mask ecchymotic. Remember, a mask ecchymotic is seen in traumatic asphyxia. Next. So now, see, if I combine a smothering and traumatic asphyxia, now what it will be called as? देखो, smothering भी है, traumatic asphyxia भी है, दोनों साथ में अगर ज्वाइन करके किसी को मारने जा रहे हैं, इसको क्या बोलेंगे? इसको बोलेंगे हम लोग क्या? Burking. Here, smothering with traumatic asphyxia. See, Burke and Hare, these two were friends. Whenever they wanted to kill someone, they used to invite the person. They used to offer the person alcohol. When person used to be intoxicated, after that Burke used to sit on the chest of that person. वो बैठ जाता था, and after that he used to do what? He used to block his nose and mouth. like this. So basically obstruction over the chest and blockage of external respiratory passages. Burke used to sit on the chest and do like this, and here what he used to do, he used to hold the leg and he used to drag him around the room till the time person used to die. This is called as Burking method of killing. Remember last time FMG question, Burking. This is combination of a smothering and traumatic asphyxia. आसमान से गिरा, खजूर में अटका, यहाँ टायर में अटका, देखो टायर में अटका. When a person will be, see here now, because of the position, do you think this is very easy to get out of this tire? No, it will be very, very much strong, no, right? So because of the position, क्या होगा, इसका गला दब जाएगा ना, like this. Because of this, he will not be able to breathe in and out normally. This is called as positional asphyxia. See, ऐसा ही बोला जाता है ना कि मदर शुड नॉट बी स्लीपिंग विद द न्यूबॉर्न बेबी. न्यूबॉर्न बेबी को सेपरेटली सुलाते हैं. क्यों? एक्सीडेंटली कभी हो सकता है कि मदर बेबी के ऊपर में सो गई, ऑब्स्ट्रक्शन हो गया वहां पे, राइट? नो, सो दिस इज ऑल्सो टाइप ऑफ सफोकेशनल डेथ. सो दिस इज कॉल्ड एज ओवरलाइन. कैफे कोरोनरी सिंड्रोम. Suppose if a person was enjoying meal in a restaurant, he was enjoying lunch in a restaurant with alcohol, and suddenly there was obstruction of bolus in the larynx, and suddenly what will happen? Sudden laryngeal spasm, severe pain in chest, and he will hold his chest like this and he will fall on the ground. Other people will think what in the cafe that he had coronary artery disease. You can say what? Heart attack. Coronary type of symptoms in a cafe is called as cafe coronary syndrome. Easy to understand, cafe coronary syndrome. So how to help the patient, right now? By using Heimlich maneuver, right? By using Heimlich maneuver, right? Okay, fine. Cafe coronary syndrome. All these are important. So in the question, now you can easily solve. This is a case of what? Burking. Okay. Now, next question. What is the most common cause of death in a case of drowning in cold water? First of all, do understand here, there are two types of drowning. First of all, one is called the typical drowning. Another is called as atypical drowning. अगर किसी को पानी में फेंका and water has actually entered the lungs, it is called as typical, or you can say wet drowning. Okay, fine. So when I talk about a wet drowning, जहाँ पे पानी lungs में actually में गया है, तो बताओ वाटर विल मिक्स्ड विद फॉस्फोलिपिड्स, वहां पे लेसिथिन, स्फिंगोमाइलिन जो पढ़ा होगा आपने, लंग सर्फेक्टेंट्स जो पढ़ा होगा आपने, उससे मिक्स होकर के अगर वही पानी बाहर निकलेगा झाग के शक्ल में आएगा क्या? सो डू यू थिंक देयर विल बी फ्रॉदिंग डिस्चार्ज? Yes, there will be frothing. Froth will come out. So when I talk about a wet drowning, white froth will come out. Jhag aayega, right? But atypical drowning means what? Where when water entered the airway, suddenly there was what? Laryngospasm. Water did not enter the lung. Because of that, because of the laryngospasm, and person died because of what? Asphyxia. That is called a what? Dry drowning. So here, are you going to see froth? No frothing here. समझ में आ गई बात? Typical and atypical drowning. So typical drowning is of two types. One is called as fresh water drowning. Fresh water. दूसरा क्या है? Salt water drowning. Right now, salt water drowning or sea water drowning. Let's see here. After that, we will get back to this question. See here, na? See, one is what? Fresh water drowning, another is salt water drowning. So सबसे पहले सीखेंगे different types of typical drowning. उसके बाद I will come to atypical drowning. Now, see, let's learn the pathophysiology, because from here they are framing the question. Fresh water drowning का मतलब क्या होगा? नदी तालाब में ऐसे है ना, जहाँ पे जैसे हिमालय से पानी निकल रहा, fresh water, ठीक है? Okay, fine. So when a person is alive, normal human, है ना, normal human, सॉल्ट कॉन्सेंट्रेशन कितना? 0.9%. हियर सॉल्ट वाटर में, ओशन वाटर में, समंदर के पानी में 3 to 4%. फ्रेश वाटर में कितना होगा? 0.45%. ओके, फाइन. नाउ लेट्स लर्न हियर. व्हेन आई टॉक अबाउट फर्स्ट ऑफ ऑल टोन ऑफ द वाटर हियर, tone of the liquid here, when I compare human normal, when person is alive, and fresh water, so inside the human normal person there will be what? Hypertonic fluid, and fresh water में क्या है? Hypo. ठीक है? तो always remember here that hypertonic fluid attracts hypotonic fluid. Basic physiology है. ठीक है. Now water is going to enter the airway, and from the airway water will enter the lungs. Water will enter the lungs. After the airway, from the lungs, now it is going to enter the systemic circulation. Systemic circulation. So now when water is there in the systemic circulation, do you think there will be hemodilution? Yes, there will be what? Hemodilution. Hemodilution. Dilute हो गया blood. अब hemodilution होगा, then do you think there will be hemolysis also? Yes. Now there will be what? Hemolysis. When there will be hemolysis, now there will be fragmentation of what? RBCs. जब ऐसे hemolysis होगा तो फिर क्या होगा? Physiological response क्या होगा? Potassium बढ़ेगा. Now there will be what? Increased level of potassium. Basically what I'm saying is that now there will be hyperkalemia. Because of hyperkalemia, what will be there? Ventricular fibrillation. Okay, fine. Now so see, remember here, when I talk about this much part, hemodilution is there. See here. So now fluid is there in the circulation also. So do you think there will be what? Fluid overload also. है ना? Fluid overload, or you can say what? Cardiac overload. Cardiac overload, right? No, cardiac overload. So do you think this will also be causing problem in the heart? Yes. Cardiac overload, ventricular fibrillation. So if I ask you what is the cause of death in freshwater drowning, please write down. Answer is what? Cardiac arrest. Answer is cardiac arrest. Easy to understand. Now let's learn about salt water drowning. Here if I compare normal human being and salt water, so hypertonic fluid will be salt water, right? Hypertonic. So now when water is entering the airway, and from the airway water is entering the lungs. But remember here, this is hypertonic fluid which has entered the lungs. What it will do? It is going to attract hypotonic fluid. So it will attract fluid from systemic circulation, from your blood only. So now do you think inside the lungs there will be what? Extreme level of accumulation of water here now. More fluid. So now this will be causing what? Severe pulmonary edema. There will be what? Severe pulmonary edema. Very easy to understand. Severe pulmonary edema. And what is the first root cause of death here? Respiratory failure. Severe pulmonary edema. After that, heart will also be affected, right? After that, heart will also be affected, obviously. So now we have understood freshwater drowning and saltwater drowning, right now? So here, along with the respiratory failure, after that there will be what? Even cardiac issues also, right now? So even there will be what? Cardiac issues also, right? Now, let's learn how to differentiate if the dead body was recovered from fresh water or seawater. See, when a person is alive, I am writing here, this is what? Normal person. Here, how much is the sodium chloride here? 0.9%. Here, 3 to 4%. And here, 0.45%. Okay, now let's talk about one more physiology. From the higher concentration, see here, movement of solute from higher concentration to lower, right now? Higher concentration to lower concentration. Let's learn this part. Now you tell me, when a person will be thrown in fresh water, so do you think from the human body, salt will be flowing to river? Easy to understand, no? And now when we will be doing post-mortem examination, do you think there will be loss of salt from the normal human body? Because see, salt has already, see, moved from higher concentration to lower concentration. So remember here, when I check chloride content in ventricle or in the blood, obviously now this will be lesser than normal. Now this will be lesser than normal. But when I compare salt water drowning, higher concentration to lower concentration, so do you think from here this will be flowing to normal human body? Yes. Now if I do post-mortem examination, do you think salt content or chloride content will be more than the normal? Yes, more than the normal. Approximately 25% variation we see. 25% variation we see. If salt content, chloride content is lesser than the normal, it means freshwater drowning. Chloride content is more than the normal, it is what? Salt water drowning. This is called as Gettler's test. Gettler's test. Right now, Gettler's test, you cannot take a chance to for it because this is a repeatedly asked question. Gettler's, very, very important. I hope all these points are clear to all of you. Now, see, what is the meaning of diatoms? Diatoms test. Diatoms are what? These are unicellular algae. Unicellular algae. These are extremely small, micro, very, very small. Size is 60 micron, very, very small, very, very small. So this can easily enter the systemic circulation also. Easy to understand? So after death, if we can find out a diatom, remember here, this a diatom, no, unicellular algae, these are very much inert, very much inert. You cannot destroy it easily. So even after many weeks also, even in the decomposed bodies, diatom will be there. If we can find out a diatom, it means what? 100%. This was the case of drowning. Drowning. Very easy to understand. Diatoms test and Gettler's test. Right? These are related to drowning. Now, atypical drowning. See, remember here. Okay, one more point related to diatoms. Diatoms will be seen only when water is going to enter the lungs. Right now? So basically, wet drowning. Now, atypical drowning, where water is actually not entering into the respiratory part here. So, atypical, let's see here, first of all, dry drowning, then immersion syndrome, then submersion of unconscious, then near drowning. Near drowning, which is also called a secondary drowning syndrome or post-immersion syndrome. Let's learn about dry drowning first of all. Dry drowning means what? When water entered the airway, suddenly there was a laryngospasm. Suddenly there was what? Laryngospasm. And after that what? See, after that asphyxia. So in a case of dry drowning, person is dying because of asphyxia. Now immersion syndrome means what? This is also called as hydrocution. Or you can say what this is called as cold water drowning. Cold water drowning. What is happening here in cold water drowning? Do understand? When a person will be thrown in cold water, when cold water is entering inside through nose, ear and mouth, now when it is going to touch the laryngeal ends, no endings of vagal nerves, now there will be what? Sudden vagal inhibition. There will be what? Sudden vagal inhibition. I hope all of you know this fact that vagus nerve is supplying heart also. Because of sudden vagal inhibition, there will be what? Death. So, what is the cause of death in immersion syndrome? It is what? Vagal inhibition. Vagal inhibition. Because of that cardiac arrest. Right? Okay, fine. So now you can easily solve this question. What is the most common cause of death in a case of drowning in cold water? Means what? Immersion syndrome. Answer is what? Vagal inhibition. Remember here? First is what? Vagal inhibition. Vagal inhibition. Now, submersion of unconscious means what? Before submersion, person got unconscious. Kya matlab? If a person was walking near the swimming pool, suddenly he got heart attack, he fell in swimming pool. He had a seizure, he fell in swimming pool. He had any kind of attack, he fell in swimming pool. This is submersion of unconscious. If a person was enjoying alcohol after sitting in a bathtub, pita gaya, pite, wo so gaya. This is also a type of what? Submersion of unconscious. Last is near drowning. डूबते डूबते बच गया, किसी ने बचा लिया, लेकिन जब ये जो पानी अंदर जाएगा, लंग्स का एयर रिप्लेस कर रहा है, तो lungs will be affected, heart will be affected, different organs will also be affected. When there is what? No air, asphyxia है ना, तो brain will also be affected, no? So many secondary complications will be there, no? एक बार डूब रहा था, बचा लिया किसी ने, एक हफ्ते बाद वो मर गया secondary complication की वजह से. This is called as near drowning. Near drowning means what? When a person First time after drowning, he got saved by someone, but because of secondary complication, he's going to die, right? Because of brain encephalopathy, right? Okay, fine. All these points should be clear now. Now, let's learn some post-mortem appearances, post-mortem changes. Very, very important. See, if you look at these pictures, this is called as what? This is washerwoman's hand. Washerwoman's hand. Even if you keep feet in the water for longer time, this will also be similar to washerwoman's hand. So first is what? Washerwoman's hand. This indicates drowning. Yes, you can see here piloerection like this, no? Erected hair, and you can see the skin. So what kind of skin is? Something like the puckered skin. This is called as goose-like skin. This is called as what? Goose-like skin. Goose-like skin. This is called as overall cutis anserine. Cutis anserine and washerwoman's hand. These are indications of what? These are indications of drowning. Some other post-mortem changes. See here, when there will be enlargement of water into the lungs, so lungs बहुत बड़ा हो जाएगा ना, heaviness of lungs, there will be so much accumulation of water in the lungs, right? That is called as emphysema aquosum. That is called as emphysema aquosum. First point. Now, when see here, dirty water is entering the lungs, right? So do you think this can damage the lungs parenchyma? Yes. And because of that, there will be hemorrhages over the lungs. That is called a what? Paltoff's hemorrhage. That is called as Paltoff's hemorrhage. Now, when I talk about heavy accumulation of water in the lungs, when you do post-mortem examination, when you remove a sternum, suddenly lungs will come out like a balloon. That is called as ballooning of lungs. See, that is called a what? Ballooning of lungs. I hope all these points are clear to everyone. Remember, drowning is an important topic for all exam. Okay, FMG also, NEET PG also, INICT also, everywhere. Okay, fine. And now look at this question. An accused person in court is claiming that he is only 17-year-old, so that his punishment could be decreased as a juvenile. Judge has sent this person to hospital to find out the accurate age. What should be the best step to calculate the exact age? So now we are going to start learning about identification, right? Identification. Human identification, very, very important. So for this, see, better option is what? X-ray of wrist. Why it is important? X-ray of wrist. What exactly we are going to check there? How we are going to calculate? So remember here, on the basis of ossification of bone. On the basis of ossification of bone, right? Ossification of bone. See, different bones have different age of ossification, and on the basis of complete ossification we can identify the age. Let's see here. Remember here, so first of all, look at ulnar part. If there is complete ossification of ulna, yes, this will be completed by the age of 17 to 18 year. 17 to 18 year. But if you look at radial part here, no, radial part here, right? So remember here, if it is completed, no, this ossification will be completed only at the age of 18 or 19. So if there is complete ossification at the radial end here, it means what? 100% he is adult. 100% he is approximately 18 or more than 18. Very easy to understand. So wrist X-ray will be enough to understand if he is an adult or not. Easy to understand, right? Sometimes examiner can give you some X-rays, and after that examiner will try to ask you the age of ossification, and examiner will try to ask you age of the person. Look at the elbow joint. Elbow joint ossification will be completed by the age of 14 to 16 year. 14 to 16 year. Okay, fine. But if you see, if you look at what, ischial tuberosity, this will be completed by the age of 22 to 23 year. So fine. So if there are two X-rays, and after that, if examiner is asking you the options, right? Examiner is asking you on the basis of these X-rays, how much is the age of the person? So minimum age will be how much? Approximately 22 to 23 year. Very easy to understand, right? Age of ossification, right? Very easy to understand. When I talk about upper limb joint and lower limb joint, upper limb joint like wrist, elbow and shoulder. See, if I ask you to join, see now suppose if you are going to touch the knee with the elbow like this, right? Now you see here, you start from the lower to upper, wrist, elbow, shoulder, and here ankle, knee and hip joint. Knee and hip joint. So how much is the age of ossification? Very easy to understand. See, just now I have taught you that wrist approximately 18, elbow 16, shoulder 18. Here opposite 16, 18, 16. Very easy to understand. So basically this is what? Age of ossification. So on the basis of age of ossification, we can understand the age of a person. And here only we can discuss one more point related to identification. See here, fetus age estimation. Suppose in a bush you have found one dead fetus. Length is 25 centimeter. Length of fetus is 25 centimeter. Now, how much should be the age of the fetus? Remember here there are two rules. One is called as a rule of Hesse. Another is called as a rule of Morrison. Rule of Hesse is for starting 5 months. First 5 months. And rule of Morrison is for next 5 months. Next 5 months of intrauterine life. So what is the rule of Hesse? See, this is square root of CHL. CHL is what? Crown to heel length. Okay. So this length will be in centimeter and age will come in what? Right now. So age will be coming in month, right? Okay, fine. So now what about the rule of Morrison? This length we have to divide by 5. So if we talk about this fetus whose length is 25 centimeter, even if we are using rule of Hesse, okay, square root of 25, answer will be what? 5 months. In the same manner, even if we calculate, even if we divide the 25 by 5, answer will be what? 5. So please remember, rule of Hesse and rule of Morrison, these are related to what? Age estimation of fetus. Okay, gestational age. Actually what? Gestational age. Gestational age. I hope this is clear to everyone. Now, sex determination is illegal in India. Illegal, right? But if we have to determine the sex of a fetus, by which age we can determine the sex of a fetus? Remember here, by the end of 4th month. 4th month of intrauterine life, or you can say 16th week, with the help of ultrasound and physical examination, right? Now, look at this question and try to answer. On examination of a pelvic bone, subpubic angle was found to be 88 degree. Greater sciatic notch was deep. I'm repeating. Now look at this question. On examination of a pelvic bone, subpubic angle was found to be 88 degree. Greater sciatic notch was deep. Mostly it should be a bone of male or female or what. Remember here, on the basis of a skeleton, we can determine the sex of a person. First of all, what is the best bone for race determination? Answer is what? Skull bone. Race determination. I hope you remember that there are 3 types of races, 3 different races. One is called as Caucasoid, another is Mongoloid and Negroid. I'm saying what? Caucasoid. Remember, European people and Chinese people, these are what? Caucasoid race. Mongoloid race, Japanese and Asians, Negroids, Aryans and Africans. These are three important races worldwide. So what is the best bone to determine race? Skull. So Indian skull is what? Mostly there will be what? See here, mostly there will be Caucasoid and Negroid. And to determine the race, we have to calculate the length and breadth of the skull, and we have to take one ratio. So what is the name of index? This is called as cephalic index. This is called as cephalic index. Cephalic index. Remember here, how to calculate breadth of the skull divided by length of the skull multiplied by 100. Okay, so ratio will be called as what? Cephalic index, where we have learned about dolichocephalic, mesocephalic, brachycephalic, right? Ratio will be like, when I talk about dolichocephalic, ratio will be what? 70 to 74.9. In between mesocephalic, ratio will be 75 to 79.9. Now brachycephalic, ratio will be 80 to 85. Easy to understand. So basically this is all about cephalic index. So for race, best bone is skull. For sex determination, what is the best bone? Hip bone. Remember, hip bone is the best. For the determination of height or stature, best bone is what? Femur. Best bone is femur. Now let's learn about the pelvic bone here, hip bone here. Now see here, this accuracy chart. Suppose if you have found bundle of bones, if you get entire skeleton, 100% accuracy. Pelvic bone alone, hip bone, 95% accuracy. Only skull bone, 92%. Pelvis plus skull bone, right, both 98%. Basically this accuracy chart is given by what? Krogman's accuracy. But remember here, in the pelvic bone, what is the best parameter to assess? This is what? Greater sciatic notch. This is what? Greater sciatic notch. Remember here, what is the greater sciatic notch? See this red portion, what you see here, and this is what? Greater sciatic notch. Remember here, greater sciatic notch is deep and narrow in male, wide and shallow in female. Now you can easily solve this case. See here, picture number 1 and picture number 2. What is the meaning of deep and narrow? When it will be like this, it is called as a deep and narrow. When it is like this, it is called as wide and shallow. So picture number 1, obviously this is a male. Picture number 2, obviously this is what? Female. Very easy to understand. So basically what I'm saying here, that on the basis of sciatic notch, if it is a deep and narrow, male, wide and shallow, female. One point is clear to everyone. Now what about some other aspects? Who is considered as big-hearted person, male or female? Males are big-hearted or females? Okay, fine. Chalo, I can say males are big-hearted. Males are big-hearted people. Okay, fine. Heart-shaped pelvic inlet in male. But who is the mother of all these big-hearted people? Obviously female. Now I have compensated, right? So remember here, female, it will be what? Pelvic inlet will be what? Circular shape, right? And this will be what? Circular shape. Easy to understand. I hope all these points are clear to all of you. Pelvic cavity, funnel shaped in male, but in female, flat bowl. Remember, subpubic angle. This is important. Subpubic angle. If it is acute or if it is obtuse. Remember here, what is subpubic angle? 90 degree or less, male. But if it is 100 or more, it is a female. Now you can easily understand, right now? Okay, fine. Now this part is called as what? Preauricular sulcus. This is prominent in female. See, remember a general rule here. Remember a general rule. All muscle markings, all tuberosities are more prominent among males, except 3. One is called a frontal eminence. Second is parietal eminence. parietal eminence. Third is preauricular sulcus. Preauricular sulcus. These three are more prominent among females, but remaining all other muscle markings, all other tuberosities are more prominent among males. Now you can easily solve this question right now. See here, now on the basis of this question, subpubic angle 88 degree, greater sciatic notch was deep. So this is a case of what? Male only, male hip bone. Now on the basis of a skull and different structures here, remember here, see here, always remember that frontal eminence and parietal eminence, these are more prominent among females. If you see the external architecture, now if it is very much smooth, female, but if it looks like rough, tough, rugged type, male. Look at forehead. See, a male forehead will be steeper, right, at an angle, but females will be vertical. Now glabella, this portion, more pronounced among male, less among female. Frontonasal junction, I am talking about this frontonasal junction. See here, among males, see this angle is this much prominent that we can keep a pen also here. So in males, frontonasal junction will be more angulated, but among female it will be what? Smooth. Okay, when I talk about mastoid process also, please remember here, among the male it will be large and blunt, but among female it will be pointed. Next question. A dead body was found at the roadside. A dead body. Okay, face was completely disfigured. Police is asking for the old photo from the family members so that skull and photo can be matched. See, photo of the skull will be, see, image of the skull and old photo will be superimposed. And there will be inquiry if there is matching or not. This is called as superimposition technique. Repeatedly asked question, 2 times continuously they have asked in FMG, superimposition technique. So what actually we are doing here? Image of the skull and old photo right now. So there will be superimposition. If these are going to get matched, okay, fine, this was the same person. This is called a superimposition technique. Some other techniques of identification. So can you answer me, what is the most reliable method of identification? Most reliable method of identification is what? Dactylography, which is actually what? Fingerprinting. This is also called as Galton's test. In the same manner, study of lips is called a chyloscopy. Remember here, first center for the fingerprinting was established worldwide in India only. In India, first fingerprinting, no, India. In India where? Kolkata in India. Now a study of sweat pores over the fingerprinting, it is called a poroscopy. A study of rouge, it is called a rougoscopy, hard palate. A study of a footprinting is called as what? Footprinting is called as podography. Question is, study of footprinting, where do we use? Okay, fine. So this can be, so basically footprinting at the murder scene we can understand, we can get. And second, in the maternal hospital also. Maternal hospital. In one day, there will be delivery of many babies. No? So just after delivery, when nurse is going to weigh the newborn baby, at the same time, nurse is going to do what? Footprinting also. Fine, so that there should be no exchange of babies. Now, fingerprinting, remember here, by what age, by what intrauterine life age, fingerprinting will start appearing? By 12th week. It will be completed by 24th week. Question is that when you are applying a form, you have to give fingerprinting. Okay, fine. So light touch. So there will be what? So multiple lines. And in the examination center also, again, they will take your fingerprinting. Basically, they are going to what? They are going to match if it is same fingerprinting or not. Question is that how many points of comparison should be there? 10 to 12 points. How many types of fingerprintings are there? Very easy mnemonic, no? Claw, composite, loops, arc, holes. Most common type is loops. Question is that this is the most reliable method of identification. Even in identical twins, it will be different. Fingerprinting, right? Since the childhood to the death, just after birth, means birth to death, Fingerprinting will be same. Fingerprinting will not be altered. In which condition fingerprinting can be altered? Please write down. One is radiation exposure, radiation injury, leprosy, electric injury, and skin grafting. And after the grafting, yes, in these conditions fingerprinting can be altered. Now remember here, see, this is called a DNA fingerprinting. From the crime scene we have collected one drop of blood, and we have harvested the DNA with the help of PCR machine, polymerase chain reaction. Okay, fine. Now, from the one copy of the DNA, we are going to make multiple copies of DNA with the help of PCR. So basically what we are doing, fingerprinting of multiple DNA, no? Same DNA ka fingerprinting. This is called a DNA fingerprinting. Don't think that DNA fingerprinting means DNA and fingerprinting together. No, this is only DNA. Only DNA. So see here, from the crime scene we collected this. We have two suspected person, 1 and 2. Okay, so now this is matching with the second person. This is matching with the second person. Very easy to understand. DNA fingerprinting. Okay, fine. DNA fingerprinting, where it will be useful. Okay, so who is the real father? Who is the real mother? Right now, so basically heteropaternal condition, right? So there we can understand. There we can use DNA fingerprinting also. And now some more points we should know about one more thing, that is called a tattoo. See here, old and decomposed or actually disrupted tattoo can be visualized with the help of what? H2O2, hydrogen peroxide, 3%. We can also use what? Some magnifying glasses, ultraviolet lamp. Okay, fine. Important thing from where examiners are framing the question. Suppose during the murder or at the time of murder, if murderer is going to eradicate or if it is going to destroy, right, that destroy their tattoo. Now, what is the last examination to do? Suppose if there is a dead body and family members are claiming that over the nape of the neck there was a tattoo which murderers have destroyed, have removed actually. Fine. No? So what is the last here? Remember here, what is the ink we are using in tattoo? We are using what? Indian ink. We are using what? Indian ink. This is called as black ink. Remember here, after the tattooing, now this black ink will be taken up by regional lymph nodes, right? Now regional lymph nodes. So what is the last option we are left with? We have to do biopsy of lymph nodes. Biopsy of lymph nodes. And if lymph nodes will be having that ink, we can understand, yes, there was tattoo. Okay, next question. Eruption of upper lateral incisure, and especially examiner has mentioned primary, is seen mostly at which age? So basically now we are going to talk about dentition, right? Now dentition. Dentition, there are two types of dentition which you know. One is called a primary dentition, another is a secondary dentition. See here, primary dentition is also called as temporary dentition. This is also called as milk teeth, also called as a deciduous teeth, right? Deciduous. What is the meaning of deciduous? You would have heard about deciduous forest. Deciduous forest, where in extreme winter leaves will be falling and in this summer again leaves will be coming. Basically जिसके पत्ते झड़ जाते हैं, right? Now, so deciduous teeth का मतलब क्या है? कि in future these are going to get replaced by permanent teeth. That is deciduous. So secondary teeth is also, secondary dentition is also called a what? Permanent, right? Now permanent dentition. Permanent dentition. Now, what is the first primary tooth to be erupted? It is what? Lower central incisure. First primary tooth to be erupted is what? Lower central incisure. At which age? 6 months. What is the first permanent tooth? Molar number 1. By which age? 6 years. Remember, how many temporary teeth are there? How many? Remember, in total 20, permanent in total 30. What is the sequence here? 2, 1, 2. Here 2, 1, 2 and 3. Remember, there is no premolar. There is no premolar in primary dentation. There is no premolar in primary dentation. I hope all these points are clear to all of you. Now, let's learn the eruption of temporary teeth. First of all, what I have taught you? Lower central incisure. Lower central incisure. After that, upper central incisure. After that, upper lateral incisure. After that, lower lateral incisure. By which age these are erupting? Lower central incisure by 6 months. 6 months of life. Upper 7 months. Upper lateral 8 months. Lower lateral 9 months. What about the question now? Upper lateral incisure by the age of 8th month. Easy to understand? I hope all these points are clear to all of you. Now, some other eruption where you can have a mnemonic of I am Chief Minister. So, remember the age rule of 6 years? This is what? Central incisure. Molar number 1. This is canine. This is molar number 2. This will be erupting by the age of 6 months. Molar number 1 by the age of 12 months. Canine by the age of 18 months. And molar number 2 by the age of 24 months. By the age of 24 months. See, yes, so basically we have learned about dentition in the primary. Now let's learn about dentition in secondary. Secondary dentition, right now? Secondary dentition. Now, when I talk about permanent dentition, very famous mnemonic is there, very commonly used, right? Mom is in pain. Mom is in pain. And Papa can make medicine. Papa can make medicine. Now, see here, this is molar number 1. I am talking about permanent teeth now, right? Molar number 1. This is central incisure. This is lateral incisure. This is premolar number 1, premolar number 2, canine, molar number 2. This is molar number 3. Okay. What is the age of eruption now? First at the age of 6 years. After that 7 years, 8 years, 9 years, 10, 11, 12. And last is what? Molar number 3. That will be erupting by the age of 17 to 25. Now you can easily solve. Okay, now see the period of mixed dentition. Last time FMGE exam, they have one question. See, they have asked one question that in a 10-year-old boy, how many permanent teeth and how many temporary teeth will be there? So, see here, first permanent tooth will be erupting by the age of 6 years. 6 years, and that is what? Molar number 1. Remember, in between 6 to 11 years, there will be permanent teeth also, temporary teeth also. This is called as what? Period of mixed dentition. 6 to 11 years. Total number of teeth will be 24. 24. Now, how to calculate total number of permanent teeth? See, remember here, age minus 5 multiplied by 4. Real age minus 5 multiplied by 4 equal to number of permanent teeth. So suppose if there is a 10-year-old boy, right? Very easy to understand. So in total this will be what? 20. So number of permanent teeth 20 and 24 minus 20, okay, that will be equal to 4. Very easy to understand. In this same manner, you can solve the question. Suppose if there is a 9-year-old boy, how many permanent, how many temporary teeth? Okay, 9 minus 5 multiplied by 4. Okay, so this will be equal to 16. So I can say what? Number of permanent teeth is 16 and temporary will be what? 24 minus 16. So it will be what? 8. 8 will be temporary teeth. Very easy to understand. This is called as period of mixed dentition. Now, one more is there. One is called a super added teeth and one is called a successional. One is super added. Another is successional teeth. What is the meaning of super added and a successional? See, successional means what? See, when I talk about a successor, right now, see, the successor who is going to, right now, so if there will be a predecessor, right now, तो उसका successor, जैसे if I can take the example of Amitabh Bachchan, Abhishek Bachchan will be the successor of Amitabh Bachchan, right now. So when one is going to replace another, or when one is going to take the place of another, one is going to take the place of the predecessor. Easy to understand. That is called as successional teeth. Successional teeth. Super added means what? Who is never going to have any successor. Same, जैसा start हुआ था वही last तक रहेगा. Very easy to understand. Remember here, all molars are super added. So how many super added teeth are there? 12 super added. Remaining all 20 are successional teeth. Successional teeth. I hope all these points are clear to everyone. Now see one more method. See here, age by the dentition. How we are going to understand age by the dentition. So here I want to mention 2 points. One is called as Boyd's method. Another is called as Gustafson's method. See here only I am writing. One is called as Boyd's method. Another is Gustafson's method. Gustafson's method. Keep in mind, Boyd's method, see, this is for the newborn babies. In a case of infanticide, suppose if a 5 days old baby died, right now, so actually we don't know the exact number of days, newborn babies, right now, it's a newborn baby. तो ये कैसे पता चलेगा कि यार ये है ना कि 5 दिन या 7 दिन या 8 दिन पहले पैदा हुआ था बच्चा, राइट? सो फॉर दिस वी आर यूजिंग अ मेथड दैट इज कॉल्ड एज Boyd's मेथड. तो Boyd's मेथड क्या है? सी रिमेंबर हियर, ऑन day 2 और day 3, a neonatal line will be erupting over the jaw. सबसे पहला जो लाइन आता है इनेमल का, राइट नो, इनेमल का, दैट इज कॉल्ड एज नियोनेटल लाइन. ठीक है, ऑन डे 2 और डे 3 आफ्टर बर्थ. Okay, fine. And on daily basis, every day, one line will get added. And these lines you can see only with the help of electron microscopy. These are called as lines of Ritzius. So with the help of electron microscopy, if you can count 5 lines are there. 5 lines. तो अब ये बता दो कि how many days before that baby had the birth? बताओ कितना दिन पहले पैदा हुआ था बच्चा? 5 लाइन्स. ये पहला लाइन कब आएगा? डे 2 पे आएगा या डे 3 पे आएगा? ऐड कर दो. सो ईदर, है ना. सो बेसिकली आई कैन से दैट इफ आई कैन सी 5 lines, no, 5 lines. So 5 plus 2 and 3 we can add. So minimum the age will be what? 7 days old baby. 7 days old baby. Very easy to understand. This is called as Boyd's method. So Boyd's method we can use for infanticide. Boyd's method, if we can find out neonatal line, 100% this was the case of live birth baby. Easy to understand. One more method है, यहीं पे mention कर लो, that is called as Stack's method. This is also for infanticide, for the newborn baby. See, with the help of weight and height of the teeth, we are going to compare and we are going to understand the age. Remember, Boyd's and Stack's method, these are used for newborn babies to calculate the age. Right? Okay. But for elderly people, for adults, especially age more than 21 years, we are using a method that is called as Gustafson's method. See here, as per the age, there will be what? Resorption of teeth. Right now. सो जितना ज्यादा रिजॉर्प्शन होगा उससे आपको समझ में आएगा कि भाई हाँ कितना एज रहा होगा, है ना, मोर देन 21, ये यंग एज में था, एडल्ट में था या ओल्ड एज में था. दैट इज Gustafson's method. And what is the most reliable criteria? There will be what? Root transparency of teeth. The most reliable method in Gustafson's. Keep in mind, Gustafson's method is for age estimation by dentition. In the same manner, Boyde's and Stack's age estimation by the teeth. Easy to understand, right? Next, see this question. Old blood stains are found at a crime scene. Which of the following test is performed to check the blood if it belongs to human origin or not? Basically, from the crime scene, if you have found a drop of blood or whatever, right now, so blood मिल गया अगर ना, कैसे पता चलेगा this blood belongs to human being or animal? So for this we have to do what? Serological test. No, serological test पता करना पड़ेगा. So out of these 4, human है या animal है या different species है, इसके लिए कौन सा टेस्ट है हमारे पास में? Precipitin test है. What about other test? See here, when I talk about Florence test, I'm sure you know about Florence and Barberio's. यहीं पे लिख लो Florence and Barberio's test. Florence and Barberio's. These two are for semen analysis. These two are for semen analysis. अगर किसी जगह पे कोई रेप सीन है या फिर मर्डर स्पॉट है, कहीं से मिला, if you found old cloth with any stain, how will you understand कि ये सीमेन था? सीमेन पता करने के लिए कौन कौन सा टेस्ट करते हो? एक है फ्लोरेंस, दूसरा है बारबेरियो. इससे याद रखो फ्लोरेंस एंड बारबेरियोस, FB. फ्लोरेंस टेस्ट में you will see what? Brown color. Rhombic crystals, right now? फ्लोरेंस में कौन सा कलर दिखाई देगा? ब्राउन कलर, रोम्बिक क्रिस्टल्स. बारबेरियोस में याद रखो BY, येलो कलर, नीडल शेप्ड क्रिस्टल. ठीक है ना? तो याद रखो फ्लोरेंस में ब्राउन कलर एंड बारबेरियोस में येलो नीडल क्रिस्टल. राइट? वेरी इजी टू अंडरस्टैंड. राइट. Now, where do we use Teekman's and spectroscopy? Spectroscopy, this is the most reliable method. This is the most reliable method to detect blood. Suppose if you found old stain कहीं पे दिख गया, कोई कलर दिख रहा है, so that can be blood also, pus collection also, saliva, semen also. कैसे पता चलेगा ये blood ही है? Right now, this is blood only. For this, most reliable is what? Spectroscopy. And see a Teekman's test. Remember, Teekman's and Takayama. Important test. So let's see this table. This table is really important for your exam. First of all, ये समझो, to understand whether this blood belongs to a human being or not. For this, especially you can remember precipitin test. Some other tests are also there, है ना, जो स्पेशली देखना है अपने को यहाँ पे, है ना, सिरोलॉजिकल के सपोर्ट से, सिरोलॉजी पार्ट. राइट? ओके फाइन. बट स्पेशली टू चेक वेदर दिस इज ब्लड और नॉट, रिमेंबर हियर स्पेक्ट्रोस्कोपी, अगेन आई एम टेलिंग यू, मोस्ट रिलायबल. आफ्टर दैट मैक्रो एंड माइक्रोकेमिकल में याद रखो. सी माइक्रोकेमिकल में मोस्ट इंपॉर्टेंट इज व्हाट? टाकायामा हीमोक्रोमेजन क्रिस्टल टेस्ट. क्या होगा? इफ यू कैन फाइंड आउट पिंक फेदरी क्रिस्टल्स ऑफ हीमोक्रोमेजन, इट मीन्स ये पक्का ब्लड है ना, क्योंकि ये कहां पे होता? ब्लड में ही होता. दिस इज कॉल्ड व्हाट? टाकायामा हीमोक्रोमेजन टेस्ट. ओके फाइन. टीकमैन टेस्ट क्या है? यहां पे देखो, टीकमैन टेस्ट, इफ यू कैन फाइंड आउट ब्राउन क्रिस्टल्स ऑफ हीमिन क्लोराइड, this will be seen only in blood, right? So it means what? Pakka blood hai. So remember, Takayama and Teekman's, these are also for what? Blood stain. Now macrochemical, where you are using hydrogen peroxide, especially remember, keep in mind Kastle-Meyer test. These are the tests which you have to know for blood stains. Okay, see this question now. Changes in physiological variables of suspect when the patient is exposed to questioning regarding the crime. This principle is seen in which lie deception test. Right now, remember here, Basically, examiner is asking about what? Examiner is asking about physiological variables. Physiological variables. So now we are going to learn about what? Something like लाई डिटेक्शन, झूठ पकड़ने वाले जो टेस्ट होते हैं कुछ कुछ, ठीक है ना, जैसे लाई डिटेक्टर टेस्ट का नाम सुना होगा, ठीक है. ऑल दीज पॉलीग्राफ, ब्रेन मैपिंग, नैर्को एनालिसिस, दीज आर यूज्ड फॉर व्हाट? लाई डिटेक्शन. पॉलीग्राफ इज कॉल्ड एज व्हाट? लाई डिटेक्टर टेस्ट. लेट्स लर्न हियर. फिजियोलॉजिकल वेरिएबल्स का मतलब क्या हुआ? अगर पेशेंट से सवाल पूछोगे, व्हाट यू वर डूइंग ड्यूरिंग द टाइम ऑफ मर्डर इन दैट बिल्डिंग, अगर उसको सच्ची पता होगा ना, दिल की धड़कन तेज हो जाएगी उसकी, राइट ना. उसका क्या होगा? ब्लड प्रेशर. नाउ सी हियर, बीपी, पल्स रेट, रेस्पिरेटरी रेट स्टार्ट्स फ्लक्चुएटिंग. व्हाई? बिकॉज द fear will stimulate sympathetic nervous system. Very easy to understand. This is called as what? Polygraph. This is called a what? Polygraph, right? No, polygraph, right? No, so these are what? Deception detection test. Polygraph में क्या होगा यहाँ पे बताओ? Polygraph में see here, changes in physiological variables like blood pressure, respiratory rate and pulse rate. So here answer is what? Here this is called, this is a case of polygraph. This is lie detector. Next is brain mapping. Brain mapping में क्या है याद रखो? We ask the patient, see here, we ask the patient to wear a skull cap. I will show you the photo and you will be having more clarity. See here. First of all, when you see this, this is called a polygraph test. यहाँ पे इस तरह से जितने भी apparatus देख रहे हो आप ना, basically यहाँ पे क्या है, ये जो polygraph test है, इसमें क्या हमारा, इसमें क्या logic है? If you ask a question related to any crime, if patient knows the truth, उसका जो है ना physiological changes start हो जाएगा. Pulse rate, blood pressure, respiratory rate. In the same manner, this is called a brain mapping. Brain mapping में क्या है? देखो यहाँ पे जैसे एक wave होता है P300 wave. ओके जो एक स्कल कैप ऐसा यूज करते हैं, राइट? स्कल कैप. आस्क द पेशेंट व्हाट यू वर डूइंग ड्यूरिंग द टाइम ऑफ मर्डर अराउंड दैट बिल्डिंग. इफ ही और शी नोज द ट्रुथ, उसको कुछ अगर पता है तो कुछ तो मेमोरी वापस आ जाएगा ना, क्या हुआ था, अगर उसको कुछ पता है रिलेटेड टू क्राइम, राइट? नो, सो दिस वेव विल बी फ्लक्चुएटिंग, यू नो, सो दिस कैन बी मॉनिटर्ड. दिस इज कॉल्ड ए व्हाट? ब्रेन फिंगरप्रिंटिंग, ब्रेन मैपिंग. वन मोर इज नैर्को टेस्ट, narco analysis test. Here we are going to use what? Truth serum drugs. So narco test में क्या होता है? हम लोग कुछ इंजेक्शन देते हैं, है ना. जैसे अभी जो केस था वो श्रद्धा आफ्ताब पूना वाला केस जो था, उसमें जो था उसको नार्को टेस्ट किया गया था, राइट? ओके, नार्को टेस्ट में क्या होता है? यू आर गिविंग सम ड्रग्स लाइक स्कोपोलामाइन, है ना, और सोडियम अमाइटल और सोडियम पेंटोथल, जिसको आप कहते हो ट्रुथ सीरम भी, या फिर सोडियम सिकोनल. दीज आर द ड्रग्स विच यू हैव टू मेमोराइज. सो दीज ड्रग्स वी आर यूजिंग फॉर नार्को टेस्ट. ये जब इंजेक्शन देते हैं ना, तो बेसिकली हमारा लॉजिक है यहाँ पे, वी आर गोइंग टू प्रोड्यूस व्हाट? अनकॉन्शियसनेस. 100% नहीं, 95% तक अनकॉन्शियस, यानी कि नाउ पेशेंट इज अबाउट टू लूज 100% कॉन्शियसनेस. पूरा लूज नहीं करने देना है, अबाउट टू, यानी कि 95%, 96%, 97%, or approximately 90%. See, in that phase, now that person will not be having that power to create any new story. He or she will not be able to manipulate anything new. उसके अंदर कुछ भी नई कहानी बनाने का जो सलाहियत होता है ना, वो खत्म हो जाता है. So basically, whatever question you ask, he or she will be replying the same thing. यानी कुछ भी नई कहानी नहीं बना पाएगा वो, right? This is called as narco test. So I have taught you 3 tests related to lie detection. सबसे पहला क्या था? Polygraph. After that, brain mapping. Third, narco test. Next question. Now we are going to start learning about toxicology, right? Toxicology. A factory worker who is working in matchstick industry presented with pain and swelling in jaw with multiple discharging sinuses of jaw. What is the likely cause of poisoning? This was the question in last time INICT. Now अब ये बताओ कि which out of these 4, which we are using in the matchstick, which is being used in the matchstick industry, and the condition of the patient is what? Swelling of the jaw. कुछ इस तरह से होगा, swelling of the jaw, right? Now, so this is called as what? Glass jaw or Fossey jaw. This is also called as Lucifer's jaw, right? This is also called as glass jaw. कहाँ पे दिखता है ये? This is seen in phosphorus poisoning. Phosphorus poisoning. Remember here there are two types of phosphorus which you should be knowing. Phosphorus में एक है yellow और white, दूसरा है red phosphorus. Remember here, red phosphorus is a non-toxic. Red phosphorus is a non-toxic, but yellow or white, this is extremely toxic. This is this much inflammable that this is kept under water. बहुत जल्दी आग लग सकता है, and this can be very much disastrous, right? बुलेट बनाने में भी यूज करते हैं, फायर क्रैकर में भी यूज होता है, इसलिए दिवाली पॉइजन भी कहते हैं इसको, ठीक है ना, फॉस्फोरस को. सो बेसिकली सी फॉस्फोरस का सुना होगा ना, वॉर में भी यूज होता है. सो दिस इज एक्सट्रीमली इन्फ्लामेबल एंड रिमेंबर हियर दिस एमिट्स लाइट, this emits smoke. So first of all, if a person is having poisoning with phosphorus, even if he is going to have vomiting, see, vomiting will be having what? Vomiting will be emitting light and a smoke. Even when he is going to pass the stool से भी निकलेगा light and धुआं. This is called as smoky stool syndrome. Smoky stool सिंड्रोम, मतलब जब वो जाएगा टॉयलेट में तो धुआं सिंड्रोम, ऐसा याद रखो, ठीक. स्मोकी स्टूल सिंड्रोम बिकॉज ऑफ फॉस्फोरस ओनली, राइट? एंड इन लॉन्ग टर्म दिस विल बी कॉजिंग व्हाट? लिवर डैमेज. ऑलराइट, नाउ वन मोर पॉइंट वी हैव टू लर्न अबाउट फॉसी जॉ. व्हाट इज द मीनिंग ऑफ फॉसी जॉ? रिमेंबर, इफ अ पर्सन इज एक्सपोज्ड टू द फ्यूम्स ऑफ फॉस्फोरस, ना, तो इसमें क्या होगा? फर्स्ट ऑर्गन विच इज गोइंग टू गेट डैमेज्ड, फर्स्ट बॉडी पार्ट. सो रिमेंबर ये लोअर जॉ को डैमेज करना शुरू होता है. लोअर जॉ बेसिकली मैंडिबल को डैमेज करेगा. सेकेंड पॉइंट क्या होगा उसके बाद से? आफ्टर दैट लूजनिंग ऑफ टीथ. फिर क्या होगा? धीरे धीरे नेक्रोसिस होगा जॉ में. नेक्रोसिस होगा, देन सिक्वेस्ट्रेशन ऑफ बोन्स. नाउ देयर विल बी पॉकेट लाइक स्ट्रक्चर, नो. सो नाउ देयर विल बी फॉर्मेशन ऑफ पस कलेक्शन विल बी देयर. सो पस ऐसे इकट्ठा हो जाएगा यहाँ पे, समथिंग लाइक दिस, विच यू कैन अप्रिशिएट. This is called as Fossey jaw, Lucifer's jaw or glass jaw. One liner question, repeatedly asked question in MCI. ठीक है ना? Lucifer's jaw or glass jaw because of phosphorus poisoning. Now, when we talk about toxicology, let's learn some of the points related to poisoning because you can expect minimum 3 questions from toxicology. ठीक है, सबसे पहले ये बताओ, एज पर विच CrPC वी आर सपोज टू इन्फॉर्म द पुलिस इफ वी गेट एनी पॉइजनिंग केस इन हॉस्पिटल? फर्स्ट ऑफ ऑल CrPC नंबर 39. We have to inform the police as soon as possible. See here, in all the poisoning case, most important is what? Mercury, lead, arsenic. These 3 poisons you should know at any cost. From here, they are framing the question frequently. Apart from these, like snake bite and the plant poisoning. Okay, fine. Let's learn some more points related to toxicology. First of all, there is a term that is called as vitriolage. Vitriolage. What is the meaning of vitriolage? Acid attack. This is called as acid attack. है ना? किसी के मुंह पे एसिड फेंक के मारना, राइट? दिस इज कॉल्ड vitriolage. Obviously, this is a punishable offense as per IPC number 326A. Lifetime jail or 10 years in jail. One more is there that is called a 326B. This is attempt to vitriolage. 5 to 7 years in jail. 326A vitriolage. Right now, 326B is what? Only attempt of a vitriolage. Okay. When we know about acid, see, related to acid, always keep in mind minimum 2 acid. One is sulfuric acid, another is nitric acid, HNO3, nitric acid. See, sulfuric acid will burn everything. No? So wherever it will go, it will burn the thing. So there will be what? Black color of tongue. Even when it is going to go inside the stomach, this will turn the stomach completely black. So if you do postmortem examination, what color of a stomach wall? Remember here, black color. of a stomach wall, or you can remember black charred. But when sulfuric acid is mixed, sulfuric acid is getting mixed with enamel, no? So which color of teeth? Chalky white teeth, chalky white teeth. Now what about nitric acid, right? Remember here, nitric acid. See, remember here, so there will be what? Xanthoprotic reaction, formation of picric acid. So wherever nitric acid will go, no, so this will turn the organs, tissues in yellow. Remember, everything will become yellow, yellow organ, yellow tissues, or even if nitric acid, like afterwards, if it is going to touch the cloth, okay, so yellow cloth, very easy to understand. But what will be the color of a stomach? Nitric acid with hydrochloric acid, right now. So a stomach wall in postmortem examination, this will appear to be brown color. Next, carbolic acid, very, very important. Please remember, very important is carbolic acid. Carbolic acid, also called as phenol. Phenol. Some important points we should know about carbolic acid and phenol. Remember here, in the case of toxicology, we have to do what? Decontamination. We have to do what? A stomach wash. A stomach wash is called as what? Stomach wash is called as what? Gastric lavage. That is called as what? Gastric lavage. Right now, gastric lavage. For this, you are inserting a tube inside. You are going to insert what? Normal saline, lukewarm actually. And after that, you are going to take it out, right? Now, that is called a what? So actually a stomach wash, gastric lavage. Remember, gastric lavage is contraindicated in all acidic and alkali poison except carbolic acid and phenol. So this becomes your question. Remember here, gastric lavage is not contraindicated. Remember here, gastric lavage is contraindicated in all acidic and alkali poison except carbolic acid and phenol. This is the question. Right now, gastric lavage can be done here. Okay, fine. Now remember here, see here, when a person is going to consume phenol, phenol is used as what? Disinfectant. Right now, so see here, after that, after further metabolism, when this will be passing through the urine, and after getting exposed to air, urine will turn into green color. So remember here, green color urine, green color urine, green urine is seen in carbolic acid poisoning. I hope all these points are clear to all of you. If examiner is asking you acid and alkali, which one is more dangerous? Remember, alkali poisons are more dangerous. Why? Because it has hygroscopic nature. ठीक है ना? So because of this, there will be deeper penetration. Easy to understand? I hope all these points are clear to everyone. Now, one more poison you should keep in mind. One poison is thallium poison. Thallium poison. This is the most ideal homicidal poison. Why? Because this mimics like Guillain-Barré syndrome. Guillain-Barré syndrome. This is important. Which poison mimics like Guillain-Barré syndrome? Remember here, what will be the symptoms here? Mnemonic is A, N, D, and alopecia, neuropathy, and diarrhea. So this is all about thallium poison. Very easy to understand, right? And some more poison. See, remember here, like cadmium poison, no? Cadmium poison. See, especially in the Japan, where so many people, they use actually seafood item, right? So when seafood item, no, when these are getting contaminated with the cadmium, remember here, first of all, cadmium is a nephrotoxic also, and golden yellow teeth. Remember here, first of all, a nephrotoxic, and golden yellow teeth. Golden yellow teeth. Okay, fine. Apart from this, cadmium is going to destroy the minerals of bone, calcium, phosphorus, and all. And finally, overall, what is happening here? No, cadmium will cause osteomalacia-like symptoms. Osteomalacia-like symptoms. Because of this, what is happening here? There will be what? Brittle bones, very high risk of fracture. And see here, there will be severe bony pain. So whenever you are going So whenever you are going to touch the patient, or even if you are going to touch it like this, and a patient will say, ouch. This is called as ouch disease, right? Ouch disease. Ouch disease. Japanese name is what? Ita disease. Ita disease. Or you can say what? Ouch disease, right? Ouch disease. Ita means what? It hurts, it hurts. So related to cadmium poison, remember ita disease. Ita disease. Okay, one more. See, one is oxalic acid. Oxalic acid. See, oxalic acid. Now, this is used in used as bleaching powder also, in the like in the printing press also, and this is used as ink remover solution also. Ink remover. तो इससे याद रखना कि अगर एग्जामिनर मेंशन करता फॉर्जरी केस है कोई, है ना, फॉर्जरी केस है, किसी का साइन वाइन अगर किसी ने ऊपर नीचे इंक रिमूवर सॉल्यूशन यूज किया है, तो समझ जाओ कि उसको अगर किसी ने कंज्यूम किया तो वो क्या है? ऑक्सैलिक एसिड. रिमेंबर हियर ऑक्सैलिक एसिड, दिस विल, सो बेसिकली, सो हियर what is the antidote for oxalic acid? What is the antidote? Remember here, calcium gluconate. Calcium gluconate, right? No, calcium gluconate. Okay, when oxalic acid will get mixed with hydrochloric acid in the stomach, after that when there will be vomiting, what kind of vomiting will be coming out? Coffee colored vomiting. Coffee colored vomiting. Remember here, all these points are simple points, but very easy to remember. Okay, fine. Now let's learn about mercury in detail, and after mercury, arsenic and lead poisoning. See here, mercury का symbol क्या होता है बताओ? Hg. So mercury poisoning is called as what? Hydragyrism. This is called as hydragyrism. Hydragyrism. Now let's learn here what will be the symptoms. First of all, where do we use mercury? See here, when I talk about hat industry or glass blower industry, first of all, mercury is going to damage what? Nerves, right? No, nerves. तो जैसे आपने पढ़ा होगा ना PSA में कि भाई फैक्ट्री वर्कर्स को भी मेडिकल चेकअप होते रहना चाहिए, राइट ना? फैक्ट्री वर्कर्स रूल में आपने पढ़ा होगा. तो क्या होता है कि फर्स्ट सिम्टम कहां पे आएगा? सबसे पहला जो होता है ना, फर्स्ट symptom of mercury poison in the hat industry and the glass blower, okay, this will be seen in the handwriting. Workers लोग जब साइन करेंगे ना अटेंडेंस के लिए, तो हाथ ऐसे कप आएगा, something like the palsy. This is called as what? Shaking palsy. Shaking palsy. Hat industry में है, hatters shake. यार glass blower shake, है ना? Hatter shakes, glass blower shakes. Also called as Danbury tremors. This is nothing but shaking palsy. Palsy, हाथ कांपना. After that, after handwriting, lips shaking, and then extreme conditions होगा ना, तो walking problem भी होगा. Even patient will be having difficulty in changing the clothes also. ठीक है, ये समझ में आ गई बात? ओके फाइन. यही अगर इसी हैट इंडस्ट्री वर्कर में या फिर ग्लास ब्लोअर में अगर न्यूरोसाइकेट्रिक सिम्टम्स आ गया, पर्सनालिटी चेंजेस आ गया, न्यूरोसाइकेट्रिक सिम्टम्स आ गया, ओके, देयर कैन बी इरिटेशन, एजिटेशन, डिलीरियम, देयर कैन बी व्हाट? Okay, behavioral changes. He will behave like a mad in hat industry. It is called a mad hatter syndrome, also called as erethism. मरकरी वेपर अगर जा रहा है, लेंस जो लेंस के सामने में डिपॉजिट होता है ब्राउन कलर का यहाँ पे इन फ्रंट ऑफ द एंटीरियर पार्ट ऑफ द लेंस, दैट इज कॉल्ड एज मर्क्यूरिया लेंटिस. मर्क्यूरिया लेंटिस. एक बच्चा है जो गया है डेंटिस्ट के पास में, वहां पे जो फिलिंग पाउडर यूज करते हैं ना, वहां पे मर्क्यूरस क्लोराइड यूज करते हैं. सम किड्स दे विल बी हाइपर सेंसिटिव टू मर्क्यूरस क्लोराइड एंड दे कैन डेवलप जस्ट आफ्टर दैट दे कैन डेवलप व्हाट? पिंक कलर ऑफ हैंड्स. ओके, सो हियर हैंड्स हो जाएगा पिंक हैंड, पिंक फीट, पफी फेस, पैरेस्थीसिया. दैट इज कॉल्ड ए पिंक डिजीज, ऑल्सो कॉल्ड एज एक्रोडाइनिया, ऑल्सो कॉल्ड एज स्विफ्ट फीवर डिजीज, राइट? एक्रोडाइनिया इंपॉर्टेंट. मिनीमाटा जापान में एक रिवर है, मिनीमाटा. तो एट वन बैंक ऑफ रिवर वहां पे एक इंडस्ट्री था और दूसरे किनारे पे एक पॉपुलेशन, कुछ लोग रहते थे वहां पे, एक कम्युनिटी पूरी. तो ये जो इंडस्ट्री वाले जो अपना वेस्ट मटेरियल ना, ये पूरा इसी मिनीमाटा रिवर में ही डिस्पोज करते थे. एंड दीज पीपल दे यूज्ड टू फीड ऑन फिश है या जो भी सी फूड मिलता था. तो बेसिकली दैट सी फूड वॉज एक्चुअली कंटामिनेटेड विद मर्करी. फाइन. So one patient got admitted in the hospital with seizures, है ना, seizure में फिर some kind of shaking palsy and all, ठीक है. तो doctor started treating only for seizure, but they did not know the root cause. From the same community, some more patients got admitted. Doctor को थोड़ा शक हुआ. They went there and they found that in this river there is what actually contaminated fish, right? Because of mercury. So because of that, that is called a mini-martyr disease. One more severe poisoning of mercury, where there can be blindness also, temporary blindness. Okay, there can be blindness, deafness also, ataxia also, seizure also. That is called a Hunter-Russell syndrome. I have taught you 6 disorders because of mercury poison, and all these are important. Remember here, very, very important. First of all, you can easily understand here, this is called as pink disease, also called as acrodynia. ये दिख रहा है यहाँ पे, you can easily understand brown color, but remember here visual acuity will be normal. This is called as what? Mercuria lentis, and this is what? Seizure and all, mini-martyr disease. Next, arsenic. First of all समझो arsenic करता क्या है. Arsenic से related repeatedly asked question, they are asking questions multiple times. First of all, do understand arsenic will cause vasoconstriction. Vasoconstriction. दूसरा, when arsenic is going to enter the GIT, you know, this is going to create imbalance in mucosa. Basically, arsenic GIT mucosa को disturb करता है. Because of this, patient will be having what? Gastroenteritis. Gastroenteritis, like cholera. So what kind of question they have framed? Which poisoning mimics like cholera? Arsenic. याद रखना. Arsenic. Right now? Arsenic. Okay, fine. Here antidote we are using what? Ferrous hydroxide. Ferrous hydroxide क्या करेगा? Arsenic को bind करके निकाल देगा. Right? Okay, fine. So now, what will be the color of stomach in postmortem examination in arsenic poisoning? Remember here, अब एक चीज और समझो. जब मैंने यहाँ पे कहा कि भाई this will be causing what? Vasoconstriction, right? No, vasoconstriction. Vasoconstriction. Because of vasoconstriction, there will be what? Lack of blood supply, है ना? Vascular insufficiency, cyanosis, फिर necrosis. यानी कि blood supply धीरे धीरे कम होगा तो भाई necrosis हो जाएगा ना, right? ये हो रहा है. Now in the stomach part, remember here. Now, first of all, disturbing the mucosa, destroying the mucosa. Apart from that, vasoconstriction also. ठीक है, तो finally necrosis वगैरह भी हो रहा ना, ठीक है ना. तो if you do the postmortem examination, no, you can see some old clotted blood also at the background में. कुछ fresh भी होगा जो कि आपको red color का दिखाई देगा साथ में, red, है ना, red and black background. कैसा नजर आता? Something like a strawberry. So remember here, strawberry stomach. Or pink velvety stomach mucosa. Please remember whatever I am mentioning here. No, all these are questions. One-liner question. कुछ नहीं याद हो, इतना तो याद रखो. Arsenic mimics like a natural disease, that is cholera. And thallium mimics like Guillain-Barré syndrome. ये 2 poison तो याद रखो अच्छे से, right? Okay, fine. तो ये सारे केस में acute में now if long standing exposure, long standing agriculture field में भी जो water use कभी-कभी उसमें क्या arsenic है ना, तो ये बेसिकली ये सब जो है एग्रीकल्चर, फार्मर, ये सबसे रिलेटेड अगर कुछ क्वेश्चन आता है, कुछ अगर रिलेटेड टू वैसोकॉन्स्ट्रिक्शन, रिलेटेड टू नेक्रोसिस, कुछ ब्लैक स्पॉट नजर आता है, समझ जाओ आर्सेनिक पॉइजनिंग होगा. नाउ लॉन्ग स्टैंडिंग अगर है तो क्या क्या हो सकता है? मेटालिक टेस्ट, एक्सेसिव सैलिवेशन, गार्लिक ओडर ऑफ ब्रेथ एंड स्वेट, एलोपेशिया. अब आता है विच अदर सिम्टम्स यू एक्सपेक्ट. फर्स्ट ऑफ ऑल रिमेंबर हियर, आर्सेनिक मैंने आपको जैसे बताया साइनोसिस, फिर फाइनली नेक्रोसिस, तो ब्लैक स्पॉट आना शुरू हो जाएगा. ओके, सी लुक एट दीज पिक्चर्स, यू विल बी हैविंग मोर क्लैरिटी. ब्लैक स्पॉट हियर, स्मॉल ऐसा कुछ लग रहा है कुछ रेन ड्रॉप हाथ पे आ गया है ना, हाथ पे या फिर सम अदर बॉडी पार्ट्स. दिस इज कॉल्ड एज रेन ड्रॉप पिगमेंटेशन. रेन ड्रॉप पिगमेंटेशन, रेन ड्रॉप पिगमेंटेशन. दूसरा, इवन ओवर द नील्स, जैसे पेरिफेरल पार्ट में क्या हो जाता है, एक तरह से एडेप्टेशन जैसा साइन. यहां पे क्या होगा? व्हाइट लाइन स्टार्ट हो जाएगा नेल्स पे. दिस इज कॉल्ड एज मीस लाइन. हैंड्स पे देखोगे टाइट, या फिर फीट पे देखोगे सोल पे एक्सेसिव डिपोजिशन ऑफ व्हाट? केराटिन, हाइपर केराटोसिस. चलो इतना पहले समझ लेते हैं, फिर आएंगे मोस्ट इंपॉर्टेंट टॉपिक पे. So basically remember here, raindrop pigmentation, very very important, very very important. Basically raindrop pigmentation कैसा होगा? Brown pigmentation जैसा, right now. So remember raindrop pigmentation is seen in arsenic poison, hyperkeratosis, Aldrich mesaline, remember here mesalines. Okay, fine. So earliest sign क्या होगा? Macular areas of depigmentation, this is called as leucomelanosis. Remember here, sometimes skin में rash भी दिखने लगता है ना, तो rash resembles like fading measles rash. Now one more important, actually most important is this black foot disease. ये black foot disease क्या है, इसको समझते हैं. यहाँ से क्वेश्चन बार बार आता है. Remember here, look at this. See here, first of all I have told you it will cause what? Vasoconstriction, cyanosis, ischemia, है ना, लैक ऑफ ब्लड सप्लाई हो रहा है ना, फाइनली नेक्रोसिस, यानी ब्लड सप्लाई पूरा ही रुक गया. तो जो पेरिफेरल पार्ट है ना, यहाँ पे क्या हो जाएगा कि भाई लैक ऑफ ब्लड सप्लाई, कंप्लीट गैंग्रीन फॉर्मेशन हो जाएगा, एंड देयर कैन बी स्पॉन्टेनियस एम्प्यूटेशन, पूरा ब्लैक हो जाएगा पाँव. दिस इज कॉल्ड एज ब्लैक फुट डिजीज, ब्लैक फुट डिजीज. आई होप ऑल दिस पॉइंट्स आर क्लियर टू ऑल ऑफ यू. तो आर्सेनिक से कुछ याद हो ना, इतना याद रखो, इट मिमिक्स लाइक कलरा, है ना, गैस्ट्रोएंटेराइटिस. एंटीडोट क्या है? फेरस हाइड्रोक्साइड. पोस्टमार्टम चेंज कैसा आएगा? स्ट्रॉबेरी या फिर मतलब पिंक वेलवेटी म्यूकोसा. ठीक है, हाथ ये सब पे या फिर फ्लेक्सर शोल्डर पे रेन ड्रॉप पिगमेंटेशन. इजी टू अंडरस्टैंड. मीसलाइन एंड ब्लैक फुट डिजीज. ओके, so fine. So when I'm saying there is lack of blood supply, so do you think blood में भी कुछ changes आएंगे? नहीं आएंगे, obviously यार, है ना. अनीमिया होगा. Which type of anemia? Hypochromic anemia. Platelet में भी thrombocytopenia and leukemia. Remember here, acute poisoning में तो पता चल जाएगा भाई ब्लड सैंपल से. इसका देखो यहाँ पे आर्सेनिक से रिलेटेड एक पॉइंट हमेशा याद रखना, वेरी वेरी इंपॉर्टेंट, कि आर्सेनिक का क्या है कि भाई देखो, दिस मिमिक्स लाइक नेचुरल डिजीज. लूज मोशन हो रहा है, डायरिया हो रहा है, कल रहा है, लोगों को लगेगा क्या? हाइपोवोलेमिया, डिहाइड्रेशन से मर गया, यानी कि सबको क्या लगेगा? नेचुरल डेथ था. लेकिन नेगेटिव पॉइंट अबाउट आर्सेनिक इज दैट आर्सेनिक डिलेज डिकम्पोजिशन. आर्सेनिक खत्म नहीं होगा बॉडी से. आर्सेनिक कैन गेट डिपॉजिटेड इन हेयर्स, नेल्स, बोन्स, हर जगह डिपॉजिट हो जाएगा. इवन इफ यू बर्न द डेड बॉडी, नो, एशेज में भी आर्सेनिक मिल जाएगा. समझ में आई बात? देयर वॉज अ केस समवेयर, अ मैरिड फीमेल गॉट एडमिटेड इन हॉस्पिटल विद सीवियर लूज मोशन. 8 दिन, 9 दिन, 10 दिन पूरे, फॉर 9-10 days. डॉक्टर हैज ट्राइड ऑल द एंटीबायोटिक्स बट नो इंप्रूवमेंट. डॉक्टर को थोड़ा शक हुआ, यार ऐसे कैसे, मतलब, है ना, नो इंप्रूवमेंट. डॉक्टर ने पूछा कि यस यू आर मैरिड राइट? या. What about your husband? How is your relation with your husband? Sir, earlier he was not good, but for last 15-20 days, no, he's very good. He doesn't allow me to enter the kitchen. He is making the food himself. और वो खुद लेकर के आता है. He prepares the food himself. Okay, good. What does he do? What is his profession? Sir, he is a professor. Where? Sir, organic chemistry department only. Good. Blood sample में arsenic निकल गया. So basically slow poison. Every day husband was adding arsenic in the food. ठीक है, चलो यहां तो अगर वो तो पकड़ा गया, अगर पकड़ा नहीं जाता ना, अगर पकड़ा नहीं जाता एंड अगर एक्सपायर हो जाती वाइफ, ठीक है, इन द बिगिनिंग एवरीवन वुड हैव थॉट दिस वाज द केस ऑफ नेचुरल डेथ. सो आफ्टर 2 years मे बी शायद उसका कंसाइंस अगर जग जाता, या फिर कोई इसका फ्रेंड हो या कोई जानने वाला जिसको पता था आर्सेनिक, वो जाके अगर पुलिस में कंप्लेन कर देता दैट वाज नॉट द नेचुरल डेथ, दैट वाज आर्सेनिक पॉइजनिंग, देन डू यू थिंक देयर कैन बी री-पोस्टमार्टम एग्जामिनेशन? हो सकता है क्या? Digging out the dead body, that is called as what? Exhumation, right? No, that is called as what? Exhumation. Yes, exhumation. अब इसका परमिशन कौन देगा? पुलिस या मजिस्ट्रेट? ऑब्वियसली मजिस्ट्रेट. विच मजिस्ट्रेट? एग्जीक्यूटिव मजिस्ट्रेट. अब जब एक्सुमेशन दोबारा होगा, इवन आफ्टर मेनी इयर्स आल्सो, इवन इन द बोन्स आर्सेनिक कैन बी फाउंड. समझ में आ गई बात? सो एक्सुमेशन मीन्स व्हाट? डिगिंग आउट द डेड बॉडी फ्रॉम द अर्थ. गड़े मुर्दे उखाड़ना is called as exhumation. Who gives the permission for this? Executive magistrate. Is there any time limit for the permission? No time limit. कभी भी. What is the best time to dig out the dead body? Morning time. So that you should have enough time. Right? Okay, fine. Chalo, all right. Okay, fine. So see, remember here for the long-term exposure, okay, hair, nail, and bone, we use some tests like, range and Marsh test. So remember here, what are the disadvantages of arsenic poison? Delays putrefaction, even in the completely decomposed bodies, bones, hairs, nails, even in the ashes or charred bone, everywhere you can find arsenic. Arsenic, very, very important. Now, next is lead. Remember some points about lead first of all. What actually lead does? Where it creates problem? First of all, lead will create problem in CNS. What CNS? This will disturb myelin sheet, myelination problem. So this will destroy the myelination. Because of this, yes, there is what? Very high risk of neurological symptoms in encephalopathy. Okay. Next, heme synthesis problem. Heme synthesis. Now, in the heme synthesis, this will block two enzymes. Which two enzymes? ALA dehydratase and ferrochelatase. So, if it is going to create problem in heme synthesis, do you think there will be anemia? Yes, obviously anemia. Heme metabolism you would have learned in biochemistry. After heme only there will be a formation of hemosiderin, then biliverdin, then bilirubin. When bilirubin is affected, do you think hepatobiliary will also be affected? Yes. So hepatobiliary, okay fine, hepatobiliary system will also be affected. Digestive system will also be affected, right? So here overall in the long run I can expect some problem in what? See, there can be constipation, there can be abdominal pain, all right? See here, this creates problem in bone also. Lead can get deposited in bones. So osteopathy, bone lines. All right. Now, fourth point, in a renal, this will increase uric acid form. Basically, see here, it does not allow the uric acid excretion. So this will cause hyperuricemia. So it can lead to gout, right? Lead symbol is what? Pb. So lead poisoning is also called as plumbism. This is also called as what? Plumbism. Also called as saturnism. Okay, fine. Now, if you do blood test after lead poisoning, okay? After lead poisoning. So remember here, see, you can see the basophils. So basophils will be something like this, no? Like the stacking of the coin. This is called a basophilic stippling. Okay. Now, if a person is having lead poisoning, person is having any dental caries, right? So see here, because of this, see, there will be what? From the dental caries, yes, bacteria will be there, hydrogen sulfide will be coming out. Lead and hydrogen sulfide together, right? No? So this will be what? Bluish green discoloration here, bluish. This is called as what? Burtonian line. This is called as Burtonian lines. Important hai, sabke sab important hai. Suppose if a child who loves to lick wall paint, now understand where do we use lead? Lead is used in bullet also. Bullet, hai na? Banduk ki goli. Wall paint पे भी होता है, सिंदूर, right? सभी में lead है. Even it is used as anti-knock in petrol, right? So, ये अगर एक बच्चा, suppose if there is a child who licks wall paint, yes, high risk of lead poisoning, Now, let's understand A, B, C, D, E, F, G, H, I. Yes, there will be anemia, yes. B for bone lines, basophilic stippling, Burtonian lines. C for constipation, colicky pain. It is called a dry belly ache. It is called a what? Dry belly ache. Very, very important. I have taught you that myelination problem. So yes, nerve damage. See here, in the pediatric age group, young age group, it will cause encephalopathy and bone lines in young age, bone lines and encephalopathy. But when I talk about adults, wrist drop or foot drop, adults, remember here, please mention here itself, encephalopathy, especially seen among children. But wrist drop and foot drop, right, in adults. Yes, anemia. Remember here, facial pallor is earliest sign, right? Now, facial pallor, gout, right? Saturnine gout, we call it, right? Saturnism, hypertension, impotence. So what are the antidote we are using? We are using some chelating agents, edita and penicillamine. Next, what are the cardiac poisons? What are the cardiac poisons? Remember here, aconite, nicotine, digitalis, oleander like cerebra thavatia, cerebra odorum. These are cardiac poisons. Remember here, see here, aconite, which is also called as monk's hood, woman's bane, meetha zahar, wish, woman's bane, devil's helmet, or blue rocket. All these are common names for aconite. Remember here, why I have taught you all these? Because repeatedly asked question, which of the following is not a cardiac poison, or which of the following is going to kill a person because of, cardiac arrest? Yeah, all these, right? Remember here, what it does, it is going to bind with sodium gated channel of heart. Sodium gated channel. Right now, because of this, there will be what? More efflux of potassium. There will be what? More and more. There will be what? Severe hyperkalemia. So what is the cause of death here? Ventricular fibrillation, or you can say what? Cardiac arrest. Obviously, remember here, no specific antidote, so only symptomatic treatment. Sometimes we are using atropine. Next, identify the active ingredient of poisonous plant which is used to kill infants and cattle. Basically, now we are going to learn about 4 plant poison important. 1, we are going to learn Ricinus communis, Abrus precatorius, Semicarpus anacardium, and Calotropis giganta. Look at the picture and you will be having more clarity. See here, this is a Ricinus communis. Here, active ingredient is ricin. Remember, this is non-poisonous, you would have seen, but plant will be poisonous, right now. So this is used as biological warfare agent. Next, Abrus precatorius. Here, active ingredient is what? Abrine. Where do we use? We use this as sui needle. Sui is a Hindi word which means needle only. So remember here, what actually we use here, how do we use it? This is used as a cattle poison. See here, we take the powder of these seeds, and after that we mix with dhatura and spirit. We make the paste and under sunlight we dry it. ठीक है, उसको सुखा दिया, stick बनाया छोटा छोटा. Now, suppose if you have a business opponent, suppose if you have only 5 buffaloes and your opponent, business opponent, जो तुम्हारा वो है market में जो competitor है, he has more than 20 cattle. Now what to do? You already have made a small needles. लंबे stick के सामने लगा लो. In night time, you go and enter his gaushala. And now you are going to poke all the cattle one by one. Okay, by the morning, all cattle will be dead. But in the morning, remember here, when people will go and look at how all cattle died at the same time. So they will find, a small entry hole, and that will appear to be like a snake bite. So remember here, this sui needle, this mimics like snake bite, right? No, viperine snake bite, viper bite. Sui needle, right? No, sui needle, Abrus precatorius, keep in mind. Okay, Abrus precatorius. Look at the seeds. Sometimes they are showing you, sometimes they can show you the picture of seeds. They will ask you what is the active ingredient, what is the name of plant, right? Okay, Semicarpus anacardium, washerman, washerwoman, right? Now they are using this marking nut. Here, 2 active ingredient. One is called as semicarpol. Another is bilavanol. This we are using to produce artificial bruises, blister, right? Semicarpus anacardium. For this Calotropis giganta, here active ingredient is what? Calotropin. One more, calotoxin. See here, this is this much toxic that even cobra can die because of Calotropis giganta. This is very, very much poisonous. This is being used as a cattle poison. You take the juice of this plant, you mix, you add in a cloth, and you are going to insert into the rectum of the cattle, or you mix with the fodder. Second, it is also used as infanticide. Okay, to kill a baby. Okay, Calotropis giganta. Now you can easily understand the question and you can solve the question, right? To kill infant and cattle, right? Now, so out of all these, answer is what? Calotropin. Semicarpal किसका था? Semicarpal bilavanol, semicarpus anacardium. Abrus precatoris. Capsaicin, please remember here, this is found in capsicum. Capsicum. Active ingredient of capsicum is what? Capsaicin. Shimla mirch. Capsicum, right? So here it can cause one more syndrome. See, suppose if there is a chef who is going to cut so many shimla mirch, so many capsicum, right? So many capsicum. And suppose if there will be exposure to many seeds, no, there will be severe dermatitis. That is called as word Hunan hand syndrome. Hunan hand syndrome. Capsaicin. Now, snake bite question. All of the following are right statements related to the shown snake except. First of all, you tell me which snake I have shown you here. So first of all, we should know the snakes. ठीक है, सबसे पहले पहचानना सीखो snakes कौन कौन से है. So first of all, let's learn here. There are three families of snakes. One is called Elapidae, Viperidae, Hydrophidae. Elapidae मतलब क्या हो गया? Neurotoxic, है ना? After a snake bite, if a patient is getting admitted in your hospital, patient is having neurological symptoms, okay, neurotoxic था. कौन कौन से इसमें? See here, cobra and krat. Okay. Viperidae, viper, vessel से याद रखो. So basically this is what? Vasculotoxic, like a viper. Okay. There are two types, saw-scaled viper, Russell viper. Hydrophidae, sea snake, swimming करते करते muscles pain होता है. So remember, this is what sea snake, myotoxic. So one is a neurotoxic, one is vasculotoxic, blood related, and another is what? Muscles toxic. So now, neurological symptoms है तो या तो king or cobra. I'm repeating. So if there is what? Neurological symptoms, you can easily understand either cobra snake or krat. If vascular symptoms, like suppose if a patient is having what? Blood related symptoms, DIC, disseminated intravascular coagulation, okay, viper snake, extremely painful. Muscles, severe body pain and a spasm here, myotoxic, sea snake. Now let's learn here. What is the cause of death in neurotoxic? First of all, it is going to damage respiratory muscles. So here, cause of death in neurotoxic snakes, respiratory failure. Myotoxic, here also there will be what? Damage of respiratory muscles. Here also cause of death is what? Respiratory failure. But what about a viper? Blood related, no? Vasculotoxic, no? So finally, hypotension and all this is going to affect heart. So here cause of death is what? Cardiac arrest. Easy to understand? Cardiac arrest. Now, look at the picture. You will be having more clarity. Out of these, which one is the most dangerous here? Okay, now look at the snakes. First of all, how to recognize snakes, ठीक है? तो देखो जहाँ पे band like structure, no? Band. So where you can see bands at the interval, that is actually what? Which snake? Now you can easily recognize here. Remember here, there can be different species also, different color also, but if you can say band, no, you can easily understand, okay, this is also one of the species of krat. If you can see this kind of the right shapes, like the diamond shape, separated, it is what? Russell viper. But there can be confusion in common cobra and king cobra. Common cobra is also called as what? Naja, right now? Naja. Remember how to differentiate common cobra and king cobra. Remember here, look at the head. Here, are you able to appreciate these two specks? Something like this. Right now, this is called as bispectacled head. Right now, specks like a chashma. Easy to understand? So over the head, if you can see bispectacled head, right now, this is a common cobra. Remember here, king does not need specs every time. Only common people wear specs every time. Remember like that. Okay, king does not need a spec. So bispectacled head, common cobra. No bispect, that is king cobra. Next, now you can look at this picture. Now, so this is also type of say band like a stitch. This is also so these two are what? This is also krat, right? No, krat. Now, Russell viper and saw-scaled viper, there can be confusion. Russell viper, see here, separate. These are what? Separate, no? Separate. But a saw-scaled viper, something like saw, right? No, something like saw. Here you can easily see, now when you look at the picture, now you can easily understand, right? No, like this, something like this. So this is what? Saw-scaled viper. So there should be no confusion. Now the question is, which one is more dangerous? Remember here, extremely dangerous. Yes, this one is extremely dangerous. You might be thinking, why not cobra? Why especially you are talking about crat. Remember here, for the king cobra and common cobra, dose of venom which is lethal, that is approximately 8.5 and that is approximately 12. But for the crat, only 2.5 to 6.5 milligram. This is more than enough to kill a person. So a small amount of venom, is enough to kill a person, first of all. Second, after a snake bite, obviously there will be local marks like 2 fang marks. Fang marks. Remember here, if there will be a poisonous snake, there will be 2 fang marks. Or you can say there will be 2 puncture marks. Okay, fine. See, a snake bite, 2 fang marks. Local bite. Okay, fine. There will be swelling, pain, bleeding, necrosis. All these are the local symptoms. But remember, when I talk about this snake, no, mostly there will be minimal or no local symptoms. Even fang marks you will not be able to appreciate, right? Because it will be very, very small. See here, so even it is not very much painful. When person will be sleeping on the road, snake bite हो गया है, वहां पे आकर के कट लिया उसने, है ना, वो काट लिया स्नेक ने, person भी ऐसे करके छोड़ देगा, उसको लगा मच्छर काटा है, fine. But after that, when neurological symptoms will start happening, then he will get up, when he will be taken to hospital, no, even doctors will not be able to diagnose on that time, because see, no one has seen that snake. So that's why it will be very, very dangerous. Remember here. And along with anti-snake venom, we give adrenaline. We also give one more injection, IV neostigmine, to reverse neuroparalysis. Remember here, neostigmine is effective against cobra, but not effective against crat. That's why it is extremely dangerous. Remember here. Okay. Now let's solve this question. All of the following are statements related to the shown snake. So what is the name of this snake? This is called a crat. Symptoms are like cobra, yes, cobra and crat. Neurological symptoms, Elapidae family, Elapidae, Hydrophidae and Viperidae. Elapidae, yes, mostly no fang marks. Cause of death is cardiac arrest? No, cause of death is what? Respiratory failure, Now, related to the management, related to the treatment of a snake bite, first of all, what should not be done? My question is that, are you going to give incision and drainage? Are you going to behave like Bollywood heroes? You know, like suppose if there is a snake bite to hero, and hero will come, he will suck the venom out. Suction? Obviously no. Incision and drainage? No. Suction? Obviously no. Are you going to apply a tight tourniquet? Answer is no. Are you going to wash with soap? Please don't touch the wound. So no washing. Okay? Chalo, fine. Are you going to run behind the snake to take the revenge? Obviously no. See, all these points are written as per the WHO protocol of snake bite management. So don't run behind the snake to take the revenge. And तूने मुझे काटा, मैं भी तुझे काटूंगा. No. Okay, fine. My question is that, are you going to see if there is bleeding? Are you going to use any electrical appliance like a cautery? No cautery. No use of cautery. Suppose if after snake bite, if patient is asking you, I want my last drink, will you give him alcohol? Okay, fine. So if you are not giving alcohol, suppose if he is asking you, okay, give me at least coffee. Remember here, these are going to increase heart rate, blood pressure. So don't give, right? Okay. So all these should not be done. Okay. So what should be done now? Now remember here, anti-snake venom. Since anti-snake venom is made up of horse serum. So there is always a risk of anaphylaxis, no? Anaphylactic shock. So ASV should be combined with adrenaline injection. We are also giving what? IV neostigmine. Neostigmine. What is the function of IV neostigmine? To reverse neuroparalysis. Remember here, this will be effective only against cobra, not against rat. Adrenaline का क्या purpose है? To prevent anaphylactic shock. Anti-snake venom. Do you think in all snake bite we give anti-snake venom? No. Remember here, first of all, observation. If vitals are unstable, please give anti-snake venom. If swelling is increasing, please give anti-snake venom. If vitals are stable, swelling is getting decreased, no need of giving anti-snake venom. Only observation will be enough. I hope all these points are clear to everyone. Now, here only we can mention scorpion bite. Scorpion bite. Scorpion bite venom, scorpion and snake, almost similar, but amount will be very, very less. Remember here, in a snake bite, 2 puncture marks, 2 fang bite. In a scorpion, only one bite, only 1 puncture marks. Remember here, there will be autonomic storm, because it will be, see here, this is going to stimulate the scorpion the scorpion venom will be stimulating parasympathetic, sympathetic, and overall what? Final is what? Over autonomic storm, right now? Severe sweating, severe tachycardia and all, severe pulmonary edema, right now? So very dangerous for the patient. So see here, what is the first medicine we are giving here? Prazosin. 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 After that, yes, if you have antidote, best. Easy to understand. Remember here, for a snake bite and for a scorpion bite, first management is always immobilization. Immobilization. After that, medicines. Next question related to medical law and ethics. A patient with history of abdominal surgery is admitted in what? Patient complains of severe abdominal pain, fever on post-operative day 3. X-ray of abdomen is taken as shown below. This corresponds to what? Yes, there are some doctrines which are going to inform that whether doctor is responsible for the medical negligent act or not. Here, if you forgot one instrument inside, yes, this is what? See here, 100% doctor, you are responsible for this. No need to prove anything. Things speak for itself. It is called as res ipsa loquitur. Answer is what? Res ipsa loquitur. Please remember, res ipsa loquitur means what? Negligent act is this much obvious that there is no need to prove anything. Doctor, you will be in jail for sure. Res ipsa loquitur. Okay, fine. Some others we can discuss here only. Inevitable accident, or you can say what? Act of God. You can say what? Act of God. Even if you have taken all the precautions, but due to biological variation, you could not save the patient. This is called as what? Inevitable accident or biological or act of God. This is also called a medical maloccurrence. Remember here, suppose if there was a case for this surgery. So before this surgery, PAC was done, pre-anesthetic check was done. And that patient was completely, like he was 100% safe. But there was a drug which had, 1 in 1 million side effect. And that can be because of biological variation. So when anesthesia on the operation table, when it was given, he died on table, operation table. And on clinical postmortem examination, he was found to have what? Biological variation. Even you have taken all these precautions, but you could not save. Act of God. Inevitable accident. Vicarious liability, when the owner has to respond for the mistake of the juniors, for the employees. When the senior has to answer for the mistake of juniors, it is called as vicarious liability. Easy to understand. One more is there which you should know. That is called as novus actus interveniens. Interveniens. What does it mean? Novus means new, actus means action, intervenience means to come in between. New action came in between. What does it mean? Suppose if you had a patient after severe liver laceration, after a stab injury. There was a case of a stab injury, murder. You operated the patient, patient died on OT table, no problem. Doctor, you are in safe zone. But suppose during this surgery, if you missed one instrument inside and after 2 days patient is dying, oh my God, a new action came in between. Doctor, you are also responsible for his death. This is called as novus actus interveniens. Keep in mind. Okay? Fine. Now one is res indicata. One is res indicata. One is a res indicator. Res indicator. Suppose if I have done any mistake and patient wants to sue me, patient wants to file complaint against me, patient has to file complaint within 2 years. Indication of filing complaint against doctor is 2 years. It is called as res indicator. Res judicata, the things which are already decided. Suppose Dr. X is working in a hospital. You can keep the name any hospital. Doctor did any mistake, patient died. Family members, they filed complaint against the hospital. Yes, as per the judgment, hospital had to pay 15 lakhs rupees as compensation. But after 1 month, family members are thinking, oh my God, no. Hospital was not responsible, doctor was responsible. तो वो क्या करेंगे? Now they are going to file complaint against the doctor. Now this case will not be taken into consideration again. Judge क्या बोलेगा? एक केस की सुनवाई हो चुकी है, दोबारा नहीं लिया जाएगा केस, right? So the case which is already heard will not be taken into consideration again. This is called a what? Res judicata. एक ऐसी गलती होगी जहां पे डॉक्टर एंड पेशेंट दोनों की गलती है. That is called as contributory negligence. Contributory negligence. I hope all these points are clear to everyone. Res ipsa loquitur, very, very important. Next, a 50-year-old woman is brought to emergency department with a case of a stab injury. Her situation is critical. She confessed that someone tried to kill her but did not disclose all information as she is not sure about that. After 2 hours, she feels that she is about to die. She called the doctor and asked her that she wants to give her a statement about her murder case. Doctor can write the statement in front of 2 witnesses. This is called as what? This is called as dying declaration. Dying declaration. Okay, let's learn this. See here, when I talk about evidences, no? One is called as a written evidence, another is called as oral evidence, third is called as circumstantial evidence. Written evidence means what? Written evidence means what? Medical certificate, MLC, dying declaration and dying deposition. These are examples of what? Written or documentary evidences. Oral evidence, or it is also called as the parole, right? Means a person will visit the court for giving evidences. This is most effective because see, the person himself is there, no? So leading questions can be asked, multiple questions can be asked, right? No, this is most effective. Circumstantial means what? At the crime spot, something you have found like hair, wristwatch, or any, like maybe specs. Suicidal note, even bullet. So suicidal note is an example of what? Circumstantial evidences, right? So let's learn some points about dying declaration and dying deposition. Very, very important. Remember here, dying declaration, when a person is about to die, right now. So when person wants to give any statement, it can be, ideally it should be recorded by a magistrate. But see, on the spot, magistrate will not be able to come. No, anyone can record. So it can be recorded by anyone, doctor, police, village headman, but it should be recorded in front of 2 witnesses. If a person is about to die, are you going to ask him to take oath? See, it is assumed that dying person doesn't lie. So no oath is required. Can you do cross-examination? No. Leading questions can be asked? No. Leading question means what? Where answer is in yes or no. Answer is in yes or no. Compos mentis का मतलब क्या होता है? If a person wants to give any statement, no, it is the duty of doctor to certify that person was completely conscious and oriented before giving any statement. इसने पूरे होशो हवास में बयान दिया है. He was mentally composed, right? It is called as compos mentis. So obviously it will be done compos mentis. In India, are we practicing? Yes. Dying declaration we are practicing. But dying deposition means what? Suppose if there is a patient suffering from multiple myeloma, 80-year-old, bone marrow transplantation is done, chemotherapeutic, all agents are used, fine, but there is no response right now. So now you tell me, so see here, no, so doctor has told him that you have only 7 to 10 days. Basically, you may die. Means you have very less time. Now this person is very rich. He wants to divide his property among his sons and brothers, right now. So he will invite the magistrate to court, right now. That's why it is also called a bedside court. So this will be recorded only by magistrate. Only by magistrate. Oath, yes. Cross-examination, yes. Opposite side lawyer will also be there. Leading question, yes. Compos mentis, obviously it should be there. In India, are we practicing? No. Okay. Dying deposition and dying declaration, very, very important. Okay, fine. See, here only you should know that one is called as police inquiry, another is called as magistrate inquiry. Right now, police inquest, see, police inquest, inquest means what? Inquiry. And magistrate inquest. Which is CrPC, CrPC number 174, CrPC number 176. Murder case, suicide, homicide, police inquiry will be done. Overall, in India, most common type is police inquiry. But what is the most superior in India? It is magistrate inquiry. Overall, worldwide, medical examining system is the most superior. But in India, only two. Now, in which condition magistrate inquiry will be done? Keep in mind, if death has happened during police interrogation because of the police firing, right now, so higher authority has to come. Magistrate inquiry will be done in 5 cases: A, B, C, D, and E. If there is a death in asylum, psychiatric asylum, hospital, borstal. What is the meaning of borstal? Jail for juvenile. C is death in a custody, custodial death. D for dowry. E for exhumation. Remember, there are 2 types of magistrate. One is judicial magistrate, another is executive magistrate. Executive. Judicial magistrate is appointed by the President of India. Executive magistrate by the state. Executive magistrate like Deputy Collector, Collector, Tahsildar, Revenue Divisional Officer. What is the main function of executive magistrate? To maintain law and order. Judicial magistrate can handle all the cases. Remember here, out of these 5, only dowry and exhumation, these are being managed by executive magistrate. Remaining all can be managed by judicial magistrate. Okay. Now remember here, so remember here, what is the meaning of subpoena? Subpoena is nothing but summon. A legal document which compels you to attend the court. Invitation from the court, from one place to another place. If you have to travel for giving evidences, you will get some money. That is called a what? A diet money. That is called as a diet money. Also called as conduct money. There are 2 cases. One is called as civil case. Another is called as criminal case. Okay. See here. See, in civil case, the party who is filing the case, he is called as plaintiff. And against whom the case is being filed, he will be called as what? Defendant. But what about this one? Criminal case. The party who is filing the case is called as a state. And opponent will be called as what? Same, defendant. Defendant. Here in civil case, for giving evidences, when you are going to attend the court, who will pay you? Who will pay you diet money? The party who has invited you. You will get the money during serving the summon. you will get the money during serving the summon. But what about criminal case? Remember here, in criminal case, diet money will not be given during serving the summon. Answer is what? No. It will not be given during serving the summon. You will get money after hearing the case. Easy to understand? I hope all these points are clear to everyone. Now, sexual jurisprudence. A pregnant lady is presented to emergency with severe abdominal pain, foul smell, intrauterine death is suspected, where gas is noted. This is called as what? Remember here, intrauterine death, very, very important. Right now, for this we have to learn these three signs: Spalding sign, Roberts sign, and Ball sign. Remember, if you can see on ultrasound, if you can see gas in big vessels or heart chambers, it is called a Roberts sign. See, a skull bone will be overlapped, Spalding sign, right now, most pathognomic. Hyperflexion of a spine, Ball's sign. So what is the answer here? Gas in great chamber. It is what? Roberts sign. Remember here, Roberts sign, Spalding sign, Ball's sign, very, very important. Say, which of the following is wrong about physical examination of a woman? Do understand here. Suppose if there is a rape victim and accused person. So for the rape victim, obviously you have to take the consent. Earlier, there was the practice of two-finger test, but now it is abolished. Now it is abolished. Okay, fine. Option B, per speculum examination should not be performed in a female where there is no history of penile insertion. Yes, this is also right. Right now, so this is also correct. This is also correct. Option number D, rape victim, are you going to take the consent? Yes. Option number C here, see, per vaginal examination should be performed in a 16-year-old female presented with amenorrhea. Do understand here, 16-year-old female presented with amenorrhea. Obviously, you might be suspecting any kind of anatomical defect, anatomical anomaly. Are you going to do per vaginal examination? Answer is no. Please don't do this. You can rupture the hymen. No. If you want to do physical examination, per rectal can be done, not per vaginal, right? Okay. After that, radiological investigation. So wrong is what? Option number C. Now, see, if there is a rape victim, suppose if there is a rape victim, yes, now two-finger test is abolished. We are not using it. So we can insert a speculum, okay, no? So that we can see inside, okay, for any kind of damage. Now there are two chemicals, okay? One chemical for rape victim, another is a rape accused. For rape victim, if there will be minor abrasion, no, you will not be able to appreciate with naked eye. So we are using what? We are using a chemical that is called as toluidine blue. Toluidine blue. After that, you can easily appreciate. So toluidine blue is used for what? Fresh abrasion. In the same manner for accused, rapist, you are going to wipe the shaft of penis with a filter paper and you are going to expose to Lugol's iodine vapor. This will appear to be brown color. Brown because of what? Glycogen. Because of glycogen. Because of what? Vaginal epithelial cells. So I have taught you two chemicals here. One is called toluidine blue for rape victim. After that, Lugol's iodine for accused. Remember here, for the victim, you have to take the consent. Consent, are you going to take the consent before physical examination? Yes. With the accused, no need of taking the consent. Remember here, when I talk about this speculum, no, it should not be inserted when there is no history of insertion of penis into the vagina. Or if there is a girl child. In girl child, first of all, there will be what? Deeper location of hymen. Fine now? Fine. So mostly there is what? No rupture of hymen in girl child because of deeper location. So you have to be careful about all these. Now, related to rape, some IPCs are important. 375, it defines the rape. 376, punishment for the rape. If there is a rape victim, you cannot disclose, remember here, you cannot disclose the identity of a rape victim. Okay, disclosure of identity of a rape victim by the media person or by any doctor is a punishable offense, 2 years in jail plus minus fine. CrPC 357. Remember here, this is CrPC 357. What does it mean? For the rape victim, can we give free treatment? Yes, obviously we have to give what? Free treatment. Free treatment, even if you are working in a private hospital. But remember here, police should be informed as soon as possible. And remember here, we cannot admit the rape victim in private hospital. Free treatment done, inform the police. It should always be dealt by government hospital. So remember here, only by government hospital. Only by government hospital. CrPC 416 means what? Recently you must have watched that movie, no, Jawan movie, right? Suppose if a female who has given death sentence, and she is found to be pregnant, now what should be done? Either death sentence can be postponed for 5 years or it can be converted into lifetime jail. So remember here, death sentence in a pregnant woman, CrPC 416. Now, how much is the legal age limit for the female to give consent for sexual intercourse? 18. Earlier it was 16. Sexual intercourse in a female whose age is less than 18 is called statutory rape. Statutory rape. Even with the wife, how much is the legal age limit for sexual intercourse? It is 18. Remember here, as per Indian law, only a man can attempt rape. Okay? And remember, after the rape, if a female is presenting within 4 days, within 4 days, within 96 hours, you have to collect all these samples. All these points are important. Now remember here, rape victim, rape accused. Consent, are you going to take the consent? Yes. Here, no. Which chemical we are using in a case of rape victim? I have taught you just now, toluidine blue. Rape accused, Lugol's iodine. Remember, all these points are important for your exam. And now let's learn MTP Act, Medical Termination of Pregnancy. First of all, for abortion, for medical termination of pregnancy, who has to give the consent? Only wife. Only mother has to give the consent, only female. But in any condition where sexual life can be hampered, like hysterectomy, tubectomy, vasectomy, artificial insemination, for these, husband and wife both are supposed to give the consent. Now MTP Act, remember here, now this is the new update. Opinion of only one doctor is required up to 20 weeks. Opinion of 2 doctors, 20 to 24 weeks. Now maximum limit for medical termination of pregnancy is how much? 24 weeks. Easy to understand? But here you should know this fact that this extension of maximum 24 weeks, this is only in the case of rape victim. So there are 4 conditions where MTP can be performed legally. 1, like if there is risk of mother's life in any condition. 2nd, if there is any risk of any kind of the congenital anomaly like Down syndrome and all. 3rd, rape case. 4th, if a couple was practicing contraception. Failure of contraception, this can cause psychological trauma to the mother. So yes, but in the case of failure of contraception, no, maximum age limit is only 20. Only 20, this you have to remember. In any condition, anytime, if there is risk of mother's life, abortion is legally permitted. Remember, MTP Act is very, very important. Now there is a condition which is called as superfecundation and superfetation. Superfecundation and superfetation. Remember, suppose if there is a female, her name is Anna, her husband name is Mark, and boyfriend name is Jack, and Jack is black. Husband and wife both are white people, but boyfriend is black. Okay. Last night she had sexual intercourse. She had sexual intercourse with husband. In the morning she had sexual intercourse with boyfriend. And now there was, see here, now there was actually fertilization of 2 ova by 2 sperms in this short span of time. Same mature cycle. Now there was a delivery of a twins, and one was black, one was white. Fertilization of 2 ova by 2 sperms. You can say what? Dual SIM card, like that you can remember. Okay. So basically black and white. This is called as what? Superfecundation. This is called as what? Superfecundation. Remember here what I have taught you just now? Fertilization of 2 ova by 2 sperms in same menstrual cycle. But there is a condition which is called a superfetation. Superfetation means what? Superfetation means what? Suppose if a female is having septate uterus, double uterus. Fertilization of 1 ova happened in January, another happened in February. Here also there will be delivery of twins. Fertilization of 2 ova by 2 sperms in 2 menstrual cycle. Superfetation 2T. Remember here. Okay, no? So now delivery of twins, now one will be elder, one will be younger here. This is called a what? Superfetation. These two are what? Heteropaternal condition. There can be 2 fathers. Superfecundation and superfetation, important for your exam. Okay, fine. And now some terms related to legitimacy. Illegitimate child means what? Bastard child. A child born outside the lawful wedlock. Bina shadi ke. Right? Okay. Supposititious child, which is also called as a fictitious child. Which is also called as fictitious child. Suppose there is a child. Fictitious. Movie start होने से पहले आता ना, all stories are fictitious. सारी कहानी काल्पनिक है. यानी कि real नहीं है. Suppose there is a child. This is not a real child. Suppose if a female secretly she was hiding herself, and suddenly after 9 months, suddenly she is presenting with a newborn baby. Basically, she was only pretending that she was pregnant. Now suddenly she is claiming a rich man that like he is the real father, and that man is saying, no, I'm not the real father. Why she is claiming like that? Might be for property, might be for money. Easy. This is called as supposititious child. FMGE August 2020 question. How this can be confirmed? Obviously DNA, fingerprinting, DNA test. Posthumous child, birth of a child after death of father. Atavism, child may not resemble with the parents but with grandparents. With grandparents. Okay, resemblance with grandparents. Atavism. Now some extra points we can learn here. One is called as artificial insemination. Artificial insemination, you understand, right? Artificial insemination where sperm can be taken from the donor, wiki donor. Okay. So now the question is that artificial insemination by husband, okay, legal child, legitimate. Artificial insemination by donor, child will be considered as legitimate or illegitimate. Answer is what? Illegitimate. Illegitimate. The child will not be able to claim the property legally. Why? Because now that father is not the biological father. Easy to understand? This is important. Now surrogacy. Surrogacy. Surrogacy सबको पता है ना? Surrogacy, womb leasing, surrogate mother, right? So basically when a female is going to carry a baby for, like with intention to give away after the delivery for other couple. Surrogacy कहते हैं इसको, right? There are 2 types of surrogacy. One is called as altruistic. Another is called as commercial. Remember here, for business purpose, commercial is illegal in India. Altruistic, where no monetary compensation is given except medical for health, yes, expenses should be given, but not for business. So altruistic, it is legally permitted in India. Surrogacy, remember, ideally who should be the surrogate mother? Ideally relative who should have own completed family, at least 1 child. In the whole life, a female can be surrogate mother for how many times? Only for 1 time. Only for 1 time. If a lady is found to be practicing for commercial surrogacy, 10 years in jail and 10 lakhs rupees fine. Important, right? Important. Easy to understand? Fine. Now there is one more word. It is called as code hank. Code hank. It is called as psychological impotency. Psychological impotency. What does it mean? A man can be impotent to a particular female, but he will be normal for other females. Psychological impotency, code hank. Remember, there are two words. One is called as sterility. Another is impotency. Impotency means what? When a man is not able to perform sexual intercourse. Sterility means what? Man can perform sexual intercourse, but he is not able to deposit the semen in the right place in vagina. Because of this, he is not able to become father. Remember here, impotency is a valid ground for divorce. Divorce. Not the sterility. Not the sterility. Because for the sterile man, artificial insemination is always an option. Impotency in female is called as a frigidity. All these points are important for your exam. Next question. A doctor is sending multiple unnecessary tests to a particular lab center. This can be considered as a type of infamous conduct. So basically, which type of infamous conduct out of these four? What is the meaning of infamous conduct? For which you can get a warning notice also, suspension also, right? No? Suspension for timing, suspension for lifetime is called as what? Penal erasure, right? No, penal erasure. Suspension for lifetime. Okay. So this is called a what? Professional death. Infamous conduct means what? Any conduct by a doctor which is not found to be modest. Yeah, doctor, आप पे ये शोभा नहीं देता है, suit नहीं करता है. This is wrong. This is not ethical, right? This is infamous conduct. So here only you should know dichotomy means what? Fee splitting. Fee sharing, important. This is called a dichotomy, fee sharing. Writing unnecessary medicines, unnecessary investigations and all. Right now, fee sharing. This is dichotomy. Covering means what? If you have association with unqualified quack. Suppose if you have a nursing home, right? A nursing home. And if you have an unqualified person, basically what do you do here? You are covering him. This is also not ethical. You have to hire what? Paramedical staff, legal, educated, right? With license. But here, like suppose if you are hiring a person who is actually what? Who is not educated, right? Who is not qualified medical practitioner. You have hired him. This is also infamous conduct. Okay. Over advertisement by a doctor is also considered as infamous conduct, right? Now, ballistics, last we are going to learn here. A patient is brought to casualty with gunshot injury as presented below. Which of the following statements are true? Look at the gunshot injury. Let's learn this part. Okay, fine. First of all, there are two types of gun. One is called as a shotgun, where barrel will be smooth bore gun. Rifled weapon, where in the barrel there will be what? Groovings, no? Groovings or riflings. Because of the riflings, what will happen? When bullet will be going out, it will be what? Spinning motion and more fast, more velocity, right now? So in shotgun, we are using this ammunition. This is called as lead shots or lead pellets. Where, see here, when you are going to fire the ammunition, no, see, multiple small lead pellets will be coming out, no? Lead pellets. So basically, when you can see multiple wounds over the body, shotgun injury, right? No, a smooth bore gun injury. If you can see only one opening, rifled, because in a rifled weapon, we are using what? Bullet. Bullet will be having only one opening. Okay, fine. Now, let's learn what will be the shape of wound as per the range of firing. Suppose if I am having 4 victims, one victim who is in the direct contact A. See, when gun is in here, it is called as in which range? It is called as in contact range, also called as point blank range. Okay. Second victim, victim number B, who is standing in the range of a flame. आग निकलेगी ना by flame. Okay, fine. He is called as in the range of close. Victim number C, who is standing beyond the range of a flame, but see here, see whenever you are going to open the firearm, no, तो उसमें gunpowder भी निकलेगा. Maximum gunpowder will be burnt, but some unburnt gunpowder will be there. That will also be coming out. So unburnt gunpowder can also get deposited. Because of that, there will be a tattooing effect, which you would have learned for sure. So victim number C, who is standing beyond the range of flame, but in the range of gunpowder. Gunpowder, I am saying, gunpowder means what? Barood. He will be called as in the range of near range. Victim number D. Victim number D, who is standing beyond the range of flame and gunpowder. He will be called as in the range of distant range. Now, let's learn the anatomy of a wound first of all. Obviously, when bullet is going to enter the body, first of all, entry wound. You can see here, entry wound. One circular hole, entry wound. Okay. When bullet is going to enter with the spinning motion inside the body, do you think there will be abrasion around the wound? Abrasion color. In the barrel, we are using grease also, lubricant. Grease will also be coming a dirty color, or you can say a brown color. So around the wound, you can see grease color also. Because of a smoke, blackening. Okay, blackening. Because of gunpowder, unburnt gunpowder, I am saying there will be what? A small deposition under the epidermis. So this you can see what? This is called a what? Tattooing effect. Tattooing effect. Tattooing or stippling effect, right? So how will you differentiate blackening and tattooing? If you wash with normal saline, blackening will go away, but tattooing will still be there. Very easy to understand. All right. Now, because of a flame, do you think there will be a burning effect around the wound? Let's look at this photo again. Because of flame, do you think burning will be there? Yes. Because of a smoke, blackening will be there? Yes. Because of, see here, because of flame, burning. Singeing of hairs? Yes. Let's learn this table, very, very important. Let's talk about victim number B, C and D. I'm saying because of the flame, yes, there will be burning effect, burning around the wound, yes. Singeing of hairs, yes. Blackening and tattooing. Now you tell me, what about the range of B, victim number B, who is in close range, who is in the range of flame? So do you think there will be burning? Yes. Singeing of hairs? Yes. Blackening? Yes. Tattooing? Yes. Singeing of hairs, बाल जल के छोटा हो जाएगा, right? What about victim number C, near range, who is not standing in the range of flame? So do you think there will be a burning and singeing of hairs? No. But blackening and tattooing, especially, what about tattooing? Yes, it will be there. Tattooing will be there. Blackening can also be there. Blackening and tattooing can. Tattooing for sure. Okay, tattooing for sure. What about victim number D, who is standing in the distant range, far from the flame and gunpowder? Are you going to see burning? No. Singeing? No. Blackening, tattooing? No. That's it. So if examiner is framing a question, if there is a patient of gunshot injury in the hospital, on examination of a wound, burning and singeing of hairs are absent, but tattooing is present. What was the range of firing of a rifled gun here? Answer is what? Near range. On the examination, one more patient, I can see blackening also, tattooing also, burning also. What is the range here? Close range. Right now, this will be what? B. Victim number B, close range. Easy to say. I can see only entry wound, no blackening, no burning, no tattooing. Distant range. What about victim number A? Direct contact. Are you going to see flame outside? No. So are you going to see anything outside? No. Inside during postmortem examination? Yes, you can see. In B, C, D, for all these victims, as per the range of firing, what will be the shape of a wound? Circular. But for direct contact, because it will create huge vacuum pressure, so direct contact shape will be like a stellate or what? Cruciate margin. Easy to understand? Fine. Remember here, if bullet was fired, bullet is going to enter the body in direct perpendicularly. No, shape will be circular. Circle means at a 90-degree bullet entered the body. But if shape is oval, something like this, means at an acute angle bullet entered the body. So for the rifled gun, I have taught you all these points, right? Now you get back to this question. See here, so basically now when you look at this photo, what was the range of firing? Obviously contact range. It can be due to rifled gun. Yes. See, even in the smooth bore gun also, direct mein? Yes. See, like this is called a what? Which range actually? Contact range or the point blank range. Fine. Not the close range. Not the close range. Fine. So which of the following statements are true? 1, 2 and 4. Easy. Now, when I have taught you all these, no, burning, singeing, tattooing, now look at the picture and now you try to answer. Where will you see muzzle impression? Obviously in direct contact. Look at these two pictures, rifled gun. Picture number 1, picture number 2. In picture number 1, if you see it closely, no, there can be what? Burning also, singeing of ears, blackening, tattooing also. So what is the range here? This is called as close. But in picture number 2, you can see only tattooing effect, no? Only tattooing effect you can see. So what is the range here? Near range. Now, if you look at this photo, this is what? A rifled gun or a smooth bore gun? A smooth bore gun, lead shots, no shotgun, lead pellets, multiple opening, you can see multiple wounds, you can see here, right? Multiple wounds you can see. Now, let's learn about the distance, the range of firing in a smooth bore gun. Here also you should know some points. Here also same contact range, close, near, but one extra range, intermediate range is here. And after that, distance. Remember here, we can easily understand the contact range. Now here we have to learn about the meter. Less than 1 meter is called as close range. 1 to 2 meter is called as near range. 2 to 4 meter is called as intermediate. More than 4 is called as distant range. You have to know some points here that all burning, singeing, blackening, tattooing, everything will be seen only within 1 meter, only in the close range. Keep in mind, only within 1 meter. Okay. After 1 meter, you cannot see. Dispersion will start. Dispersion of lead shots. See, a dispersion will be like this, no? Dispersion of lead shots will start only after 2 meter. Only after 2 meter. Okay. After 4 meter, maximum dispersion will be there. Now let's understand here. So in the intermediate range, what will happen? See here, when, see here, 2 to 4 meter, no? So dispersion is about to start. So dispersion has just now started. So suppose if there are 16 lead shots, 16 small lead pellets. So when 4 to 5 are entering at the same time, so this will be what? One big hole. Along with that dispersion, or then a small entry wound. This is intermediate range. But distant maximum dispersion, you can say what? All small openings. When you can see all small openings, you can easily understand, okay, this is what? Distant range. Easy to understand? Fine. Now let's look at this photo. This is a 0 meter distance, 1 meter, 2 meter, 4 meter. If a person is standing here, victim number A, victim B, C, D and E. Obviously now you can understand A will be in the range of contact, point blank, B close, C near, D intermediate, E distant. Now where will you see one big opening, then a small intermediate? Where will you see maximum dispersion? Maximum dispersion? Distant. But what about C? What is the special feature? What about a near range here? Near range here. Remember here, before 2 meter, now what will happen? Here all lead shots will be having that kind of the potential to get dispersed, but it could not disperse, and before dispersion this get like entered into the body. So what will happen when it is going to enter the body? It will go inside like this, no? So there'll be for see inside during the postmortem examination, you will see something like this kind of hole. This is called as what? A rat hole appearance. Remember, rat hole appearance is seen within 1 to 2 meter near range. Important is intermediate and distant. Big hole, small, small. Now look at the picture. First of all, see what about this one? What is the range here? Star-shaped contact. Look at this picture. Smooth bore gun. You can see one big opening, then a small, small. How much is the range? What is the range? Intermediate. Where you can say maximum dispersion. What is the range? More than 4 meter. Distant range, right? Distant range. I hope all these points are clear to all of you. Last here. See here, when I talk about a stab injury, entry wound will be bigger and exit wound will be smaller. But this is opposite in gunshot injury. Entry wound will be small and exit wound will be bigger. Okay, fine. Out of these two gunshot, which of the following is right about a big wound? Basically, examiner is asking about what? Exit wound, right? No, exit wound. See, when bullet is entering, okay, inverted edge. Abrasion color will be seen at entry point, right? Now, tattooing, blackening can be seen at like at the entry point. But a fat extrusion, fat will be coming out with the bullet at the exit point, you can see. Very easy to understand. I hope all these points are clear to all of you, right now. So entry wound and exit wound difference. Remember here, see where will you see abrasion collar, grease collar? Obviously at the entry wound, right now at the entry wound. Fat you can see at the exit wound. I hope all these points are clear to all of you. We have discussed most important 30 questions, and with the help of 30 questions, we have discussed almost entire forensic medicine. Okay, so just go through this. I wish you all the best. Do well in the exam. All the best. Thank you so much.